Good morning. I am Helene Weinstein, Chair of the New York State Assembly Ways and Means Committee and co-chair of today's hearing. And today we begin the eighth in a series of hearings conducted by the joint fiscal committees of the legislature regarding the governor's proposed budget for fiscal year 2021-2022. The hearings are conducted pursuant to New York State Constitution and the legislative law. So today the Assembly Ways and Means Committee and the Senate Finance Committee will hear testimony concerning the governor's budget proposal for human services. So let me introduce the members from the assembly, then I'll turn it over to Senator Krueger for who is the chair of the Senate Finance Committee to introduce her members, and then our rankers will introduce their members. So from the assembly, I see we have chair of our Social Services Committee, Linda Rosenthal, chair of our Veterans Committee, Dee Dee Barrett, chair of our Aging Committee, Ron Kim. We have members Anderson, Aubrey, Bronson, Buttonshaw, Darling, Delon, Lunsford, Meeks, Santa Barbara, Seawright, and Zabrowski, and I am sure we will, Assemblyman Jones, I'm sure we'll have some other members, Assemblywoman Rockmore, Assemblywoman Clark, and I'm sure as the committee, as the hearing goes on, we'll have other members join us. We have a busy day in the assembly committees and hearings, as well as sessions. So Senator Krueger, do you want to introduce your colleagues?
Thank you very much. Appreciate it. So far, and again, ours will be joining during the day as well. We have Senator Rachel May, Senator Roxanne Persaud, Senator Diana Savino, Senator Gustavo Rivera, Senator John Liu, just popped on, Senator Pete Harckham, Senator Simcha Felder. I think that's the Dems at the moment. And I will turn it over to Tom O'Mara, the ranker on finance, to introduce his colleagues today.
Okay, thank you, Senator Krueger. We are joined by Senator Ritchie, who is our ranker on Veterans Affairs. We are joined by Senator Dan Steck, our ranker on Children and Family Services, Senator Jim Tedisco, and Senator George Borrello. Thank you and good morning, everyone.
Thank you. Helene, back to you.
Yes, so we're going to go to Assemblyman Ra, our ranker on Ways and Means, to introduce members of his conference.
Thank you. Good morning, everybody. We are joined by Assemblyman Simpson, who is our ranking member on the Social Services Committee, as well as Assemblyman Lawler, Gallahan, and Walczyk. And a couple of our other rankers will be joining us shortly. They are in committee meetings currently. Thank you.
And we've been joined by John Brooks, our Veteran Affairs Chair, since I last talked. Thanks.
And I believe we've been joined by Assemblyman Mamdani. And let me, just before I introduce the first witness, want to remind all of the witnesses testifying today to keep their statements within the allotted time limit. Everybody should, both witnesses and members, keep your eye on the clock. With the hearings being conducted virtually, we are going longer than we have in the past. We want to make sure everybody has an opportunity to testify and members have the opportunity to ask questions. So sort of the ground rules, the governmental witnesses get 10 minutes to make an oral presentation. And we're going to be starting this morning in a few moments with Commissioner Sheila Poole of New York State Office of Children and Family Services. After hearing from the three other governmental witnesses, we will go to the non-governmental witnesses who have asked to testify here today. These witnesses will each have 3 minutes to make an oral presentation to us. They will be in panels, and witnesses are reminded the testimony has been submitted previously, is made part of the record, will be posted, so don't read your testimony. And again, keeping an eye on the clock for members, just to be aware, the chairs have of the respective committees relating to the governmental witnesses have 10 minutes to ask questions, receive answers. The 10 minutes both question and answer. The ranking members of the committees get 5 minutes each. All other members of the relevant committees who are here with us today get 3 minutes. No second rounds for questioning from members except for the relevant committee chairs. And again, just want to emphasize it's both question and answer within your time limit. So Senator Krueger and I want to thank everyone in advance for adhering to these guidelines. Our hearings have been going 9, 10, 11 hours. So we want to be just as alert for the last group that speaks as for the first, starting with the commissioner. So now I will call just a reminder for members, senators, use the raise hand function on Zoom. I also, and I think Senator Krueger will time to time post the order of assembly members, senators speaking on the chat function, which is enabled. So I would like to now call our first witness, Commissioner Sheila Poole from the Commissioner of Office of Children and Family Services. So Commissioner, you can.
Great, thank you. Good
Proceed.
morning, Chairs Krueger and Weinstein, Children and Family Committees Chairs Bridgeport and Hevesy, and distinguished members of the Senate and Assembly. Congratulations on your election, Senator Bridgeport, and congratulations to both you and Assemblyman Hevesy on your appointments as chairs of the Children and Family Committees. My name is Sheila Poole, and I'm proud to be the Commissioner of the New York State Office of Children and Family Services. And I thank you for the opportunity to present Governor Cuomo's fiscal year 2022 executive budget as it relates to the Office of Children and Family Services. This year's executive budget balances ongoing support for OCFS's core child welfare, child care, and juvenile justice programs with the fiscal realities faced by our state during this extraordinary time. The proposed budget also advances bold new policies and initiatives to better serve New York's children and families with an intentional focus on addressing bias and structural racism. The governor's budget maintains the state's historic $832 million in child care subsidies that serve more than 100,000 low-income families. In addition, it proposes to invest $40 million to cap child care copays so that no family will have to pay more than 20% of their income above the federal poverty level. This cap will make childcare more affordable for 32,000 low-income working families. Affordability and lack of access to quality programs can be barriers to families in need of childcare. To increase access in so-called childcare desert, this year's budget proposes $6 million in startup grants for new programs and wage supports for existing programs. Underserved areas will be identified in a partnership with the regional economic development councils. Last year, the governor mandated that the REDCs consider childcare as a component of their region's overall economic development strategy. The state awarded over $8 million to 15 projects aimed at increasing access to childcare statewide. To further emphasize childcare as foundational to the economy and pandemic recovery, the governor proposes that the state establish permanent childcare work groups in each REDC and provides businesses with a guide to subsidizing or helping employees access childcare. Further, the budget proposes enhanced tax credits to help encourage businesses to provide childcare for their employees. The proposed budget would also ease administrative burdens on childcare providers. It eliminates unnecessary and duplicative requirements and lessens costs for childcare providers. We're excited about these proposals and their potential to increase accessibility to quality, affordable childcare for all families who need it. Additionally, I am very excited to share that just last week, New York State was awarded an additional $469 million in child care development funds as part of the Consolidated Appropriations Act of 2021. These one-time funds will provide additional assistance to our child care industry as we recover from the pandemic. The proposed budget continues to invest in both the Empire State After School Program and the Advantage After School Program. We all know that the pandemic has deeply impacted after school programs, and OCFS has been working with providers since last summer to offer contract flexibility so they can adapt their programs to these changing times. So this new flexibility accommodates 100% in-person, 100% virtual, as well as hybrid models, and allows providers to meet changing needs throughout the school year. The governor proposes to include child welfare reforms to promote social, economic, and racial equity. The number of children entering foster care continues its downward trajectory, with children in care at near historic lows. However, we know that the child welfare system disproportionately impacts children and families of color. Last year, New York took bold steps in requiring counties to follow a blind removal process when considering whether to remove a child from their home in an effort to eliminate implicit bias from decision-making. We also implemented a kin first firewall policy requiring an additional administrative review before a child is placed in care. We will now expand these efforts and create a more safe and just child welfare system by creating a blind step-up procedure to determine whether a child needs to be elevated into congregate care. By eliminating the use of prone restraints in all child welfare and residential juvenile justice settings, and by requiring implicit bias training for all child welfare staff statewide. The budget advances legislation to expand the family assessment or FAR approach to certain child protective services investigations. This collaborative alternative response to a traditional CPS investigation allows CPS to engage families in assessing their unique needs and connects them with more tailored services and supports. In counties currently using FAR, families have experienced better outcomes because of higher quality and more focused caseworker visits and a reduced need for indicated reports, which we know can have a lasting negative impact. And we're very eager to expand this approach statewide. In addition to promoting the well-being of children in foster care and addressing racial disproportionality in child welfare, these ongoing efforts complement federal Family First Prevention Services Act implementation efforts. With your support, New York provided $3 million in Family First transition funds in each of the last 2 years to help local social service districts recruit and retain foster families, including kinship caregivers. This year's budget includes an additional $3 million towards these Family First readiness efforts and provides continued appropriation authority for the state, as well as New York City's Administration for Children's Services to access federal transition funds. The budget also proposes to close 4 OCFS state-operated juvenile facilities. These facilities have been underutilized, some have aging infrastructure, and there's ample capacity in the remaining system to serve youth. The time has come to right-size our system to better serve youth in our custody, and most importantly, to reduce the confinement of young people. Although these are extremely challenging times for our state and for the people we serve, we must seize upon the imperative this pandemic and related civil unrest have presented. I strongly believe that now is the moment, with additional federal pandemic relief funding and additional federal relief for human services, to improve our capacity and sharpen our focus to serve all children and families fairly and equitably, regardless of race or social or economic standing. I hope that I can count on you and your support as we embark upon these vital initiatives in the coming year. I thank you for the opportunity to address you today, and I look forward to your questions and comments.
Thank you, Commissioner. And we have been joined while you were speaking by our chair, Assemblyman Hevesy of Children and Families. He just had to finish up his own meeting. So I'm going to go now to our chair for 10 minutes. Assemblyman Hevesy.
And as he starts to talk, I just want to introduce our chair. Excuse me. Sorry, I'm chewing up carrots. That was rude. Jabari Brisport has also joined us. Thank you.
Thank you both to Chairs Weinstein and Kruger, and also to my friend and colleague, Chair Brisport. And Commissioner Poole, good to see you. How are you?
Good morning. Good morning.
Good morning. Good morning. So first, I'd like to start by thanking you for all of the work you do on behalf of children and families, particularly this year. It was a rough year. I know that you're doing everything possible, and I want to thank you and your staff, not only for that work, but also for being helpful with me as I learn this field to the best of my ability. So thank you for that. I do have some questions about the budget. I don't love the budget, but I just want to, before I get to the questions, put a little context on it because I think I was expecting a little something different. So from my perspective, Commissioner Poole, and we've talked about this a little bit recently, this has been a tough year for kids. We now have 325,000 children who are now at or near the poverty level who were not near before. We have 4,000 kids who have a parent or caregiver die. I believe 23% of those are on track to go to foster care. Every adverse childhood experience, every trauma that we're afraid of for the development of our kids has skyrocketed. Domestic violence rates, child abuse. So I was hoping for a different response from the state. And so let me just lead into some quick questions for you. So first, the biggest one, the problem that I have, it scares me a little bit, is the cut to preventative services from the statutory 65-35 split, where the counties get reimbursed by the state at the tune of 65-35 for prevention services. And for my colleagues, when we say prevention services, we're preventing kids from being abused and from going into foster care. But the governor's executive budget proposes to cut that rate down by 5%, which will effectively get us to 59%. So my question is this in the wrong direction when you're considering the Federal Families First Prevention Act, which wants us to do more prevention and get us out of the business of congregate care?
Well, thank you, Assemblyman Hevesy. And as I think we all know, right, that preventing children from entering foster care has really been the bedrock of our child welfare system in New York State. As we also know, right, the pandemic has wreaked havoc on our state's economy. And, while none of us welcome any reduction to our core programming, and I appreciate your perspective, Assemblyman, we're all, right, being asked to do some small part, and every small part is painful, but we are all being asked to take some small part until, and I remain very hopeful that federal relief is on its way very soon. Assemblyman and others, you've heard our state budget director, as well as the governor, talk about the relief we do need from the federal government, and the hope that if that relief does transpire soon, right, we will be able to have a different conversation about restoration, about some of these proposed changes. So as we've heard our administration say, this is sort of the worst case scenario, assuming minimal federal aid, but I am hopeful, and we're all listening every day about federal relief and bills before Congress, and many of them, I am so excited, really seem to be focusing on children and families. So, none of us like any of these, right? 5% proposed reductions, but as you know, all of us across the entire spectrum of executive agencies, as well as the legislature and right many others, we're all asking to do our part until we do have federal relief. But yes, we need prevention. Family First is coming, as you know, later this year. And I do remain hopeful that soon we will be able to have a more celebratory conversation about restoration to many of our programs.
Okay, I appreciate that, Commissioner, and I thank you for that. I will tell you, we have a different read of how much money we have on hand. I would suggest that it is a matter of priorities in the executive budget, and my fear is, particularly with the 5% cut, you're doing two things. We're doing two things that we really don't want to do. One is you strip prevention services. That means, number one, more kids are going to get abused. That's just historically accurate. And then second, those kids are going to wind up and need more expensive care in the future, which actually leads me to my next question, if I can. Along the same lines, the executive budget proposes taking the COPS program, which is another primary preventive care program, consolidating it with a program called STSJP, which is a diversion program for juvenile delinquents, putting them both together and then cutting both programs by 20%, which I think may effectively end the COPS program, yet another prevention program. Can you tell me why we did that, or why we think those two populations should be put together?
Sure. So, I think there's two parts to that. One, obviously, the more challenging part is the 20% reduction. So as you point out, the consolidation does net a $4 million impact in reduction. I think the concept of the consolidation is by bringing both of those program models together, and I believe the appropriation language does also expand the current definition of allowable programs and services of STS-JP to take into consideration some of the COPS program models that have been made available. So the idea would be is that $8 million is added to the current STS-JP appropriation, which would bring the total available to just over $16 million. That through the Office of Children and Family Services, which we administer the STS-JP program through the municipalities, that it would allow counties in a more coherent, unified way to take into account if there is a COPS program in consideration of their STS-JP program. The other thing I would also just mention, Assemblyman, is that the Division of the Budget has committed to continue to support the current COPS programs through September of 2021.
Okay, thank you for that. Much appreciated. Same concern that we're getting out of the business of prevention. So I just want to flag that. Another part of the budget that I don't love is raise the age. Now I appreciate that we are 2.5 years into our 3-year commitment for Raise the Age. And by the way, historic victory to everyone in the legislature, all of my colleagues for Raise the Age, and the governor, and you, Commissioner Poole. The number of kids in detention has dropped 43%, less arrests. So it's a really well done program. But my understanding is the state is now stopping its commitment to reimburse the voluntary agency providers for beds, which scares me. I'm nervous that we're not going to have the beds we need. And also that, what's going to happen to those kids if there's no beds, and, are our providers going to be able to survive? That's the question for those voluntary agency providers.
Yeah. So the programs you're referring to, just so everyone is aware, were 13 foster care programs who at the state's request, at our request, stood up specialized new programming, some intensive programming to be able to serve a number of young people who we anticipated would be coming through foster care placements as a result of raising the age of criminal responsibility. And as Assemblyman said, we've now been at this for 2.5 years. We have been perhaps too successful in Raise the Age, although that's not true. You can never be more successful in having less kids coming into the system. But nonetheless, the number of young people coming into those beds was far less than the state projected. And we had made a commitment pre-pandemic 2.5 years ago, as the Assemblyman has referenced, regardless of whether or not there was a youth in the bed, to hold the agency harmless and pay them 100% of the costs. We as a state have continued to do that up until now. That commitment is set to expire in September of this year. So the proposed budget is saying, given the pandemic, we're going to have to hold back on finishing up that last 6 or 7 months so of our hold the harmless commitment. I think it's important to note, and all reductions are painful, but what's important to note, Assemblyman, is that these beds are empty. We are not taking a service away from a child who's currently in those beds. So I think that was obviously a consideration when needing to make this adjustment. I will also say that these agencies have done a remarkable job. We are very grateful to them. I know this is difficult. We're also having some conversations about this model of beds, and are there other ways, given Family First, given some of the hard to place children we have across the state, about creating a different paradigm to be able to keep some of those beds viable. So appreciate your comments, and hopefully we will have a good option in the future.
Okay, thank you. I have many more questions, but I'm about to get the hook from my chairwoman, so I'm going to stop. I'll come back later. Thank you, Commissioner.
Of course.
Thank you for the following the time. Andrew. Before we go to the Senate, I just want to introduce a number of Assembly members who have joined us since we began the hearing. Assemblyman McDonald, then Assemblywoman Gonzalez Rojas, Assemblywoman Reyes, Assemblywoman Matenis, and Assemblywoman Cruz. And we also are joined by Assemblywoman Barnes, the ranker on Children and Families, and Assemblyman Byrne, a member of the committees. Now we go to Senator
Thank
Krueger
you.
for.
Great, thanks. We have also been joined by Senator Brian Kavanaugh. And for all senators, the testimonies that we didn't have from the government officials until this morning are now on your web-based folders. So just reopen the folder where you found your original group of testimony, and it should also have the commissioner's testimony as well. And with that, I will hand it over to our new senator and new chair of Children and Families, Senator Brisport.
Thank you so much, Senator Krueger, for the introduction. And Commissioner Poole, thank you for the briefing and your testimony at the beginning. I really appreciate seeing you again. My first question is about these budget cuts and these service reductions. Just diving into the nearly $70 million that is being reduced in funding for children and families. The 5% reduction in child welfare services translates to around a $30 million decrease. The 5% reduction in adoption subsidies leads to almost a $10 million increase. You know, my question is based on the reasoning that someone needs to pay for these services, and this is effectively a transfer over from the state's responsibility to localities. And in a sense, you could almost think of this as a parent who is skipping out on child support payments. This, again, somebody needs to pay for this. So I guess my question is, do you have a historical analysis of times we've shifted over responsibility from the state to localities, and if they've had to scale back on services because of that? And my second question is, do you agree that the state, not localities, should be funding these and covering these costs?
Certainly. So again, with the proposed changes, you know, I'll use prevention as an example. When you take $30 million and extrapolate that across all the local social service districts, you know, including New York City. I mean, you know, yes, it is possible that there will be some impact on the services. Again, I think we have to remember that this is not a wholesale, whole cloth cut in the services. It is a reduction in the level, right? Which is generally speaking, a pretty high level of reimbursement. I know advocates would always love it to go back up to 65%. We've been holding it at 62%, you know, during some very challenging fiscal years. Obviously, this is a year like no other. And it's, you know, as you pointed out, Senator, reducing it a bit. And so, you know, counties will need to make a decision, right, about continuing to invest in local share, you know, versus potentially needing to spend more money on foster care placement side, as Assemblyman Hevesy pointed out. So yes, as I said earlier, none of us welcome any reductions to our child welfare, or child care, or our youth justice services. But again, these are collateral outcomes of the pandemic and its impact to our state.
Thank you so much, Commissioner. Respectfully, I do feel like a running theme inside the governor's budget is that we are not all being asked to do more. Our working class people are being asked to, you know, chip in more, whereas, you know, billionaires and the multimillionaires are not. But my second question is regarding these youth facility closures. While I do, you know, support the, you know, not having, you know, having fewer youth in detention centers. My question is, you know, this will impact a lot of youth, and, you know, I've had many of my colleagues in the Senate reach out to me about these. My question is, do we know how many, if any of these youth will be further away from their families, further away from home through these closures? And also, truly, why close? Why not downsize?
Sure. So I'll take your first question, why close? So two of the facilities that we are proposing closures for, two non-secure programs, so the lowest level of care. I think it's important for everyone to understand that the vast majority of young people with these profiles. And we only have 12 of them between 2 state operated programs today. So 12 kids in 2 separate physical plants that cost the taxpayers millions and millions of dollars. You know, there is no question that those children, those young people can be served successfully closer to home. As far as the geographic location, the county of origin of those young people. So for example, in one of our facilities in Long Island, in Brentwood, we have 8 young women there. Several of those young people are actually from Erie County, from Monroe County. They're pretty far away from their families. And so to your very point, the idea here is to try and create transition plans where those young people would be placed in voluntary agencies or step down closer to the home. And there are many, many open voluntary agency beds throughout the state. The other non-secure program we have has 3 young people right now, young men. And again, some of them are being placed in Red Hook, right? Far from home. So I think it makes a great deal of sense from a both economic standpoint to eliminate those facilities entirely. They cost millions of dollars. And I do believe, Senator, we can do a much better job serving those young people at the lowest levels of care, much closer to their communities. We're also calling for the closure of 2 secure facilities. So one of them is Goshen Secure Facility that is in Orange County. Again, we have young people there. We have about 40 young people there. They come from 18 different counties, many of them, right, again, upstate, Niagara County, Erie County. So our plan with those young people, and we already have a number who will be trading out and going to state parole, but we also have a secure facility out in the western part of the state. So our plan will be wherever possible, right, to transition those young people to a secure facility closer to their home. We also plan to transfer a number of them to our Brookwood Secure Facility, which is an hour away from our Goshen facility. And as I shared with you yesterday, we at OCFS take a lot of pride in family engagement and making sure that we do things so that families have the ability to visit their young people. So that facility is 10 minutes away from the Amtrak train station. We use our state transport team to try and facilitate visitation. And we also coordinate with docs because there's also a prison. So we're going to do everything as we have done in the past to make sure that families have the opportunity to remain engaged with their young people.
Thanks so much, Commissioner. And I'll just use my time. I think I have time for one more question. And this is specifically in relation to the reduction in funds to the foster care block grants. I think the reductions come to around 11.2 million. And specifically, I just want to call attention to a really tragic story that I think many of us on this call are already aware of the death of the 4-year-old in Schenectady who was in foster care. And my question is, when we do something like this, when we reduce, $11 million for the foster care block grant, does that impact the ability of the state to screen potential foster parents? And also, I just want to tag onto that. There is also a proposed cut to the child fatality review team by around $41,000. So will that impact our ability, the ability of the state to investigate the death of this particular child in Schenectady?
Yeah, I want to assure you the answer to both of those questions is no. Those, proposed reductions to the foster care block grant, again, I know $11 million, sounds like a lot. I mean, our foster care block grant is a multi-$100 million initiative. So it's a relatively, small amount of dollars. That particular fund, Senator, has nothing to do with our state regulations or policies, requiring foster parent certification training and going through all of those clearances. And I will assure you that the state's responsibilities for fatality reviews are not at all impacted by the other reduction that you mentioned. We still have our staff intact who will continue to complete those fatality reviews.
Thank you so much. I really appreciate it. And I do have a little bit more time. So I want to circle back to a question from earlier, which if you answered, I apologize if I just did not hear or misheard. But I was curious when we talk about these, larger budget reductions, if there is any historical analysis in the past previous years where we've cut or transferred the responsibility of payment from the state to localities, and if these localities have had to scale back in services because of that.
I am not aware. I think it's a good question. I am not aware, Senator, of any analysis that we have done, but happy to speak further with you about that.
Okay. Well, I will see the rest of my time. So I just want to thank you again for speaking to us. And Assemblymember Hevesy, I didn't say hi at the beginning, but hi. Great to see you. Thanks to all my colleagues who are on the call.
Thank you, Senator.
Thank you. Assembly.
So we've been joined by Assemblywomen Jean-Pierre and Assemblywoman Forrest. And we go to the chair of our Social Services Committee, Linda Rosenthal, for 5 minutes.
Thank you so much, Chair Weinstein. Hello, Commissioner Poole. It's good to see you virtually. I was very pleased to have our meeting last week. And I have some further questions about some issues, and I only have 5 minutes, so I will read my questions rapidly, and I hope you can answer rapidly with all the sufficient information. Thank you. So, for years I've been trying to get an increase in funding for the Runaway and Homeless Youth Program. In 2015, I and my colleagues got an increase to 4.5 million, but the funding has been flat since then. And the executive budget has a 5% reduction in funding for runaway homeless youth to $4.2 million. We know that upwards of 40% of homeless and runaway youth across the state are LGBTQ, and there are only 25 RHY programs in 62 counties. I believe we need more money for those youth because they are in precarious positions, and we should be here to help them. What is your thought on that?
Yes. So in an ideal world, we would be adding more money, and you're right that funding has been flat for a number of years. We continue. I've got a great youth development staff here at OCFS. They work hand in hand with all the runaway homeless youth providers, to do whatever we can. A number of the runaway homeless youth programs, were impacted during the pandemic, and a number of them did close their doors. But I think it's also important just to remember that we do have other funding streams to support youth across the state. So we have our YDP program that is funded at over $15 million. I also wanted just to mention as well that we are, on the good news front, looking to receive additional federal dollars to support Chafee, aging out youth, as well as educational training vouchers. So some more funding there. And as I mentioned to you during our conversation, Assemblywoman, that there are also housing, of course, for runaway young people, right, is a primary issue of concern. And that our team here at OCFS has been doing work with social service districts to make sure that they're aware of new federal HUD. It's called FYI. I think it's Fostering Youth Initiative that offers Section 8 vouchers specifically to at-risk young people. So again, while we may not have a growing runaway homeless youth allocation, we do our best to sort of stream together funding streams and to make sure that we're also taking advantage of additional federal programs wherever we can.
Okay, thank you. I still think we need more, but we can talk about that later. It's also my understanding that the governor's budget requires providers of RHY services and others to submit claims to the state for reimbursement within 3 months instead of 12 months. But failure to submit within the new 3-month period would result in losing the reimbursement. So at a time when staff is being cut because of cuts to their programs, how can we realistically demand that they comply within 3 months at peril of losing the reimbursement, which is so crucial?
Well, that was not the goal at all. I can assure you, and I think that there had been a bit of misunderstanding about what the goal was. So, right now the current claim process for them runs January through December. So it does cut across 2 fiscal years, which requires a reappropriation. Our idea was to move the claiming that's more in line with the way that most of our programs claim, which is at the end of a program year, right? You submit your claims, you have 3 months after the end of the program year, to submit your claims. So it's not anything atypical. We were just trying to bring these programs more in line so that they didn't cross over the fiscal years. And it's my understanding that we've had further conversation with the association who raised those concerns. And I think we've now come to a good place with that.
Okay, well, maybe we can talk offline about that, or if others want to hear, maybe later on you can say, because it really would be unfair to cut their reimbursement, which
That's not our intention at all, I can assure you. Yes.
Okay, thank you.
Thank you. Assembly, excuse me,
Senate, yes, thank you.
Sorry. Yes, I know who I am. Our next speaker is Roxanne Persaud, who's the chair of Social Services, and so she gets 5 minutes. Thanks you.
Thank you, Commissioner. It's great to see you, and thanks for always speaking with us. And it's a great conversation we had. Assemblymember Hevesy, congratulations on moving away from social services. Not that I like to be doing that. And Assemblymember Rosenthal, great to be a partner with you. So commissioners, every year I speak of summer youth, and last year, the city of New York and the state, they were at an impasse. Could you tell me, how was the money that was allocated to the city of New York for summer youth spent last year? And, are we working on a plan for this year's summer youth?
You're going to be the first person to stump me this morning, Senator. I actually don't know the answer to that. I know that we share that program with another state agency. So I will definitely need to get back to you on the summer youth employment program.
Okay, thank you. My other question is on workforce. The governor has proposed your FTEs, there's a net decrease. Given the amount of the demand right now for social services, do you think that your staff is able to meet the demands based on the decrease in staff?
Well, like every commissioner, we'd love to have more staff, right? But, state agencies, as I think have been asked to do their part, right? To hold the line on costs, and that has included us, again, outside of positions that are health and safety. So for, in our example, our facilities and for the State Central Register. So we've not been getting a lot of positions backfilled. I will say to you, and this is the truth, I have, as Assemblyman Hevesy referenced earlier, I have an amazing team here at OCFS who is going to do whatever it takes to do what needs to be done to do our work here. And so like everyone, right, who's faced reductions, we just work harder. And the pandemic has brought about, as someone mentioned earlier, a tremendous amount of additional work on state agencies, whether it's standing up call center lines to help people get testing or vaccines, or to deliver PPE, or to keep our facilities for juveniles running. We do what is ever asked for us. But again, we all look forward to a day when we have additional funds and that we can certainly restore some of our funding levels. But by and large, like I said, I am very grateful for the incredible workforce I have here at OCFS and their commitment and their sense of responsibility to serving those who we serve.
Thank you. I appreciate everything that you and your staff do. On domestic violence, with shelters at reduced capacity and many victims remaining in the home because, with their abusers, I'm concerned about a low per diem rate paid to DV shelters. Can you speak about that? I wonder, are we maintaining that baseline for non-residential appropriation? we've seen what is happening during this pandemic in terms of DV. What are you doing in the agency?
Well, that is an area that we have not had funding reductions, or I think in recognition of the vital services that our DV shelters have provided, and especially so, as you point out, Senator, in response to what we know and what we've all been hearing about with respect to domestic violence and the impact that it's had during the pandemic. So there's been no reductions to the rate structure for domestic violence services. I think you're also aware in 2020, and in light of recognition that the pandemic only worsened, right? The ability for survivors to leave their homes and seek services. The governor and the secretary to the governor stood up a domestic violence task force. There were a number of recommendations that came out of that. I'm also very happy to say that we have issued 2 rounds of funding to further assist domestic violence programs. So there's $1.5 million that was put out and just announced to award agencies to provide technology, whether it's access to Wi-Fi or phones, so that survivors have better access to ask for help or seek services. And then we had received some additional federal money, which we turned out into small grants to domestic violence shelters and other programs to do as they wish, to really provide support to their team, to folks who are taking advantage of their services. So that was about $2.5 million that we were able to provide. And as you know, other state agencies, OPDV and OVS, have done their part, as well as the Office of Mental Health, in trying to stand up call centers and hotlines to be available to survivors. But there's no question that the pandemic has only exacerbated what we see to be a huge problem with respect to domestic violence.
Thank you, Commissioner.
Thank you, Assembly.
Yes, we go to the Assemblywoman Barnes, the ranker on children and families, for 5 minutes. Thank you.
Thank you. Thank you, Commissioner. I appreciate the opportunity to speak with you here today. I'd like to go back a little bit to the potential closure, or what will be the closure, of 4 underutilized OCFS youth facilities. I'd like to go back to that, ma'am, with your permission. My question is, in the spring of 2019, I toured a location that was under construction in Saunier, New York, which is in my district, which was supposed to be, they were spending a lot of money, a ton of money, to revitalize this facility, that it was on the grounds of the Groveland Correctional Facility, to make it a youth facility. And my question is, you've listed the 4 locations that are potentially going to be closed as a result of the budget. Is there any specific word as to whether or not construction is going to continue in Saunier, or is that project terminated at this point?
So that facility that you're referring to is a docks that's under the Department of Corrections. That is not an OCFS facility. So I'm not in a position, I'm not familiar with that capital project. I think you'd have to direct that to Commissioner Annucci.
All right, because my understanding, when the Groveland superintendent took me on a tour of the construction, which I had insisted on, is that this was specifically going to be an OCFS facility for youth, not part of the prison system.
Oh, so I think just a slight change in the language. So the docks facility were also, at the time of Raise the Age being passed, standing up a number of specialized facilities for adolescent offenders. But again, I would recommend that you speak to Commissioner Annucci. I'm not at all familiar with what they're planning to do with those facilities or capital projects right now, but they were never OCFS facilities, and they're not today. They're not one of the 4 that we're planning to close under the proposed budget.
All right. My understanding is that it was different than that from a number of people, but thank you.
Of course.
Thank
Go
you.
to, yes, Senate.
Thank you. We've been joined by Senator Martucci, and I believe our next questioner is the ranker on Children and Families, Senator Steck. Although I thought I saw his hand up, and now I'm just double checking. Are you here, Senator Steck?
I am here, but I don't have a question anymore.
Okay, thank you.
Thanks for asking, Senator. Thank you.
Absolutely. Then we go to, excuse me, Senator Savino.
Thank you, Senator Krueger. Good to see you, Commissioner. I only have a few minutes, so I want to focus on New York City particularly. And as you know, over the past little more than a decade, we have seen what appears to be almost a permanent reduction in the state's share of commitment to child welfare and child preventive service spending. As you know, under the statute, the state is required to spend 65, the share of the state spending is supposed to be 65%, but it seems that we've actually reset it to 62%. And under the pandemic, it looks like an additional 5% is reducing it to 59%. The cost to the city of New York, just on the foster care block grant, over this period of time is almost a $62 million loss. And I won't go into the loss of kin care and now PINS. I'm particularly concerned about the fact that the state has provided zero to a program that you and I worked on from 2012, the creation of Close to Home, as you know, has been incredibly successful at making sure that children don't wind up eventually in prison. And the fact that the state, as a matter of policy, has decided that the city of New York is not entitled to a nickel for Raise the Age, not 1 cent, in spite of almost $300 million of investment by the city of New York into the Raise the Age program. But now under the current budget, I spoke to the ACS commissioner yesterday, this additional cut of another 5% is going to cost New York City almost another $20 million out of the foster care block grant. And I'm just concerned because, as you know, the vast majority of the children that are served in the foster care system and preventive services and by the child welfare system in the state of New York continue to be the children who reside in the city of New York just by virtue of the population. And we cannot invest in preventive services. We're not going to be able to fully meet the Federal Family First Preventive Service Act if we don't have the funding. And how are we going to do that, Sheila? How is this possible if we continue to reduce funding to these very vital services?
Thank you, Senator. And, you know, I would say 2 things with respect to this year's budget and the impact on New York City. So number one, just to be clear, in this year's budget, there is no difference in the application of any of the proposed cuts to New York City as there are to every other district across the state. So I just want to, you know, to be clear about that. And, you know, again, not to repeat myself, but again, we all wish we weren't having any conversations about any reductions to anything that we do. And I consider myself, as I think you all know, an advocate as well. So I continue to hope that these are able to be restored and that we can, you know, we can move on and continue to do the good work we've done, you know, particularly with respect to prevention and not having kids come into foster care. And with respect to prevention, you know, New York City is in a bit of a unique position in that prior to the Family First Preventive Services Act being passed, that New York City, to its credit, stood up and said they wanted to be a waiver program. So they piloted a number of prevention programs, and to their credit, really stood up some innovative models. Under Family First, those states and those counties in states who had opted in to a waiver program were given continued authority outside of Family First to continue to draw down federal reimbursement for those waiver services. And so that's why, I don't know if you saw in the budget, and I mentioned it in my testimony, that there's additional appropriation authority specifically for New York City to be able to continue to draw upon that Title IV money waiver, that they are the only county in the state who has the opportunity. And again, because they raised their hand and opted into that program several years ago, that should help them mitigate some, if this proposed reduction to preventive services holds.
All right, I'm out of time, but thank you. We'll continue this offline. Of course, thank you.
Thank you. We go to the ranker of Assemblymember Simpson, the rank of Social Services, for 3 minutes. 3 minutes on the clock, please. Can we set the clock for 3 minutes?
Good morning,
Hold on 1
Commissioner.
second.
Good morning.
How are you?
Can we set the clock for 3 minutes, not 5 minutes, please? Hold on 1 second. Thank you. Now you can go.
Well, I want to start off by thanking you for all that you're doing and your staff through this, these trying times. And I know it must be difficult, especially with the financial aspect of your organization. But I have a question. In the December 2020 federal coronavirus relief package, there was an inclusion of $10 billion total for child care services. And I was wondering how much of this funding will be coming to New York and how it will be coming through. Will it be in the Child Care Development Block Grant, like funds from the CARES Act did? What the requirements will be, on the spending of that? And also how the child care providers that receive the funding from the CARES Act grants will be prioritized for this new funding.
Good questions. So it's good to talk about happier times when we have new money coming to us, and we do, both in child welfare and child care. And so our portion of that $10 million that you referenced, we just received our notice of funding award last week. So it's $469 million. That's a one-time money. So we will need to submit our state's plan to the Office of Child Care by the end of this month. And so we're working very busy on that. And they intend states to spend this money. It has to be encumbered by September of 2022 and has to be liquidated by September of 2023. So that's a lot of money to be spending. It's, and it's one-time only money. So we are working. We have, we knew, right, that this would be coming back in December when the Consolidated Appropriations Act passed. So we were busy putting together our concepts. So we're hopeful that we will be able to present that to our federal partners and receive approval and be able to start getting that money out the door. I will also refer to CARES dollars that we received last year. And that again came through our Child Care Development Fund. So we received 163 million plus some change, again, specifically to support child care. We issued 3 separate rounds of child care funding. So we did scholarships for essential workers. We did a variety of different kinds of grant programs to try and help keep the lights on in childcare programs that were either shuttered and trying to reopen or had remained open, but whose enrollment was reduced, right? Because parents have continued to work from home. So there was a lot of lessons we learned doing this the first time. And we plan to carry out those lessons learned. One of the things we've learned is to keep things as simple as possible, and recognizing that our child care providers, who we're trying very hard to reach downstream, right, are not accustomed to dealing with a lot of government bureaucracy. So again, trying to really keep things simple, straightforward. And then the other thing we've learned from our administration of the CARES project was to really try and shrink our business cycle time. And so some of the things we're talking about and contemplating the additional $470 million is trying to create a much more robust and elegant IT solution, sort of like a TurboTax model that makes it really easy, streamlined for providers to go in, have a drop-down box of things, right, that are allowable under the federal dollars, click them off, and we can match them behind the scenes with our system so we'll know that they are a legitimate provider. And the idea is to really turn around the funding to providers much more quickly. That's the goal of these pandemic funds. And we had some hiccups along the way, particularly with our second round of CARES funding. We did not have an IT solution. Things got complicated. Some of that we owned. We were relying on our fabulous network of our child care resource and referral agencies who, bless them, were really patient in trying to get through some of our rules and regulations. So we are doing everything we can today to push out the first 3 rounds of our CARES dollars. I feel very good about where we are. I want all of you, because I know a lot of you have heard concerns about how quickly we're paying out CARES dollars, to know that I am very involved in overseeing the CARES project. Last week here at OCFS, we pushed out $6 million of payments, and we're going to keep our eye on that. We have a lot of claims that are still outstanding, so we need the CCR&Rs to push those claims to us. But like I said, now that we'll have $470 million, right, we need to even be more fast, more efficient, and have a much more streamlined way of getting money out to the providers and supporting them during this pandemic.
Thank you,
Thank you,
Commissioner. We go to the Senate.
Thank you. Our next questioner is Senator White.
I have searched the room for the senator, but I do not see him here, or her, sorry.
Okay, we'll come back to him if he comes back. And let's go to Senator Martucci. Oh, wait, did we find Senator White? Nope. Okay, Senator Martucci. Did we lose him also?
Yeah, I'm here.
Oh, I'm sorry. How are you, Senator?
Thank you, Chairwoman. I appreciate it. Commissioner, thank you for taking a few moments today for a couple of questions that I have. The questions that I have are with respect to the OCFS facilities closures. Specifically, I've been working with Senator Serino, who I see is who's here with us as well, because many of these closures do affect our region, the Hudson Valley. I have a map here that I printed from which I'm certainly sure you're familiar with, that I printed from your website. And really my big concern has to do with the fact that New York state law requires youths to be placed close to home. And in our case, the facilities that are located in the Hudson Valley, specifically the Goshen Secure Center, is about an hour from New York City. And when you look at the map and the proposed closures, effectively what this does is it's taking families and placing these young people not 1 hour from home, those families that live in New York City, but rather somewhere closer to 3 hours. So I guess my question really is, what percentage of youths in Goshen are from the greater New York City area? And wouldn't it be true then that this would force these youths to be placed, in this case, 3 hours from home?
Sure. No, great question. So today we have about 28 youth at Goshen. And a good portion of those youth, as I mentioned earlier, are actually from upstate counties as far away as Erie, Monroe, Niagara, Genesee. We do obviously have a number of young people from the New York City area. So as I mentioned earlier, the one program that they would move to for those kids who are still with us at the time of the close down would be going not 3 hours away. We would be transitioning them to our Brookwood Secure facility, which is actually an hour away. And Senator, as you may have heard me say, that having youth connected with their families and visitation and allowing families to visit is something that we have taken seriously, and we will continue to do whatever we can to promote family visitation. Our Brookwood facility, as I just mentioned earlier, is 10-minute ride from the Amtrak station. So for families, it might actually be, even if they're from New York City, easier to see their young person at Brookwood than it is getting to our Goshen facility right now. But I assure you, we do everything we can. And to your question about close to home, you know, for a majority of, or for a good number of the young people at Goshen, when we make this transition, they will actually be moving closer to home, because for young people who are placed from the western part of the state, we have a secure facility called McCormick Secure Facility that we will also be able to move those young people, again, where it makes sense, and we're always careful about specialized services, right? We'll be able to accomplish that goal of getting them closer to their families.
Thank you, Commissioner. I see that I'm out of time. I did have another question about the employees, but I'll network with my colleague, Senator Serino, who I think has the same concern. I thank you for your time today.
Yes, thank you, Senator.
So now we go to Assemblyman Roth for 5 minutes. Ways and Means Ranker.
Thank you, Chair. Good morning, Commissioner. I just wanted to go back a little bit to something you spoke to the two chairs about with regard to the voluntary not-for-profits and you know, placement of youth with the closure of some of the state facilities. Basically, you know, my question is just in terms of kind of the timing and the capacity in the system. You know, I know that the change in the hold harmless is, you know, going to be effective, I guess, April 1st. Is that correct?
Yes, if the budget is passed as proposed.
Okay, and you know, the closures are slated for later on in the year. So really the question is, you know, is there a concern with the capacity if the not-for-profits stop receiving that funding to keep that capacity in place? Obviously the transition of these youths out of those youth facilities, are they starting earlier, or will they be starting after the closures this fall? And what is the department doing to ensure that that capacity is preserved you know, in the meantime?
Yeah, so just to be really crystal clear, so the folks, the young people that we're talking about being good candidates to be placed in our voluntary foster care programs, the total number of them between our Brentwood facility in Long Island and our Red Hook facility, the number is 12. So we have 8 young women in Brentwood, and we've got 4 young men at Red Hook. So between now and then, certainly a number of our young people will naturally, right, attrit out of the program. So they'll be going back home to their families. So that's, I think I just wanted to make that clear. The number is very small to begin with. Secondly, when we look across our entire state, I think it's important for everyone to understand that the vast majority of folks who have the same adjudication charges as these 12 young people are already today being served, and served very well, by foster care agencies who have specialized youth programs. And because the numbers in foster care have dropped substantially over the course of the past decade, there is ample capacity, right, in every region of this state to be able to serve those right young people, however many we have left by the time we do this transition. So I feel very confident, Assemblyman, that we will be able to appropriately discharge those kids back to their communities, and for young people who will need a step down closer to their home, that we will work with their counties of origin. And I am confident, given the number of beds available, that we will be able to do that. And just to reference the Raise the Age programs that you mentioned, as I said, even with the reductions, right, some of the agencies may choose to keep those beds open, in which case young people may be able to go into those programs. And we're still working on how we might create a model outside of Raise the Age for them to do so.
Okay, thank you. And one other issue, you know, related to that, you know, I'm very, you know, supportive of our 853 schools. And, many of them have had enrollment reductions as a result of the pandemic and not getting placements from districts. How does that plan impact the 853 schools?
So, so for the 4 programs we have, we don't have 853 schools on our campuses, are state-run school programs. Is that, I'm sorry, my understanding?
Well, with regard to the voluntary agencies, and, has there been any analysis of how, not having perhaps a reduction in capacity from from that change impacting those not-for-profits that run 853 schools?
Well, that's an interesting point. I will say that the Raise the Age beds that those voluntary agencies have not been filled since the beginning of Raise the Age. And so, I think they have been able to address impacts. I know that the State Department of Education through the 853 Special Ed Coalition had also been working separately with the state education, department. And I also know that many of the 853 Special Act schools, as the number of kids in foster care writ large has dramatically dropped, in the past decade, that some of those schools have chosen and been able to successfully fill their seats in classrooms with day students placed through the committees on special education. I hope that helps, Assemblyman.
Right, thank you, Commissioner.
Oh, we go to the Senate now?
Thank you. And I accidentally jumped over Senator Borrello before, so it is his turn.
Oh, thank you, Madam Chair. No problem. First of all, thank you, Commissioner Poole, for being here. Appreciate it. I think we can all agree that childcare is truly the foundation of our economic recovery here. Our childcare workers worked through this pandemic, and they are truly frontline workers. But I can tell you that, although I'm glad to hear that there's more CARES funding, my first question is, we had $163.4 million in the Emergency CARES Act almost a year ago now. And, I know, and myself, Senator Hevesy and others fought hard to try and get that money allocated. It took us months of a bipartisan effort. And my understanding is still that $163.4 million is still not fully allocated. So we have $469 million coming again, but we still haven't spent the money that we had the first time. Meanwhile, we're seeing childcare centers closing and not reopening. What's the status of that original CARES Act funding?
Yeah, sure. Happy to go back to my previous answer on that when I talked about, hopefully you heard some of me, Senator. So just to be clear, so as of, we've allocated the money. It's a matter of now having it claimed and paid out. So we've got a ways to go. We have paid out, as of last week, close to $40 million of that money. So
$463 million from almost a year ago.
Yes.
Okay. And I'm not trying to cut you off. I apologize, but I think what's the plan then for the $469 million to ensure that this money gets out quickly? Because this is emergency funding. I can tell you that in my district, there are several centers that have closed or are close to closing. And we have all this money still unspent from going on a year now. So how do we improve this process for this new allocation of funding from the federal government?
Sure. So I'll repeat what I said earlier, which was that we learned a lot of lessons in administering the CARES 1 through 3. And to repeat what I said earlier, we've learned we've got to keep it simpler. We've got to have a much more robust IT system. Part of the challenge in CARES 2, just to stop there for a moment, as frustrating as it's been, we recognize many of these providers, right, are home-based providers, right? They are not sophisticated not-for-profit. So we're trying to be very accommodating and allowing them to submit their budgets and documents and their receipts, in handwritten format, trying to think that was a way of being able to have it be easier, and it wound up to be not quite the case. And so
my time's almost running up, but if we make this as easy as we made it for people to collect unemployment, I think we could probably get a lot of money into childcare centers right away.
Totally agree. Yep, that is actually our plan, is to create and use a much more robust technology solution to do that very thing, Senator.
Thank you for your time.
You're welcome.
Assembly?
We go to Assemblywoman Lunsford for 3 minutes.
Thank you very much. I would like to address childcare as well. In the executive proposals, there's Article 7 language to limit co-payments for families receiving childcare subsidies to no more than 20% of their income above the federal poverty level. Now, the way that's funded is through prior year federal grants. It's a $40 million price tag, but that's going to be ongoing. So my question is using this prior year federal money, how long can we sustain that that program, and what are we going to do when those federal funds run out?
Yeah, great question. So there's two parts to that answer. So one is, Assemblywoman, we have traditionally had what's called rollover. So no district ever spends out, most of them never. Some of the small counties might, but by and large, we always have what we call rollover. And traditionally, we've allowed that to do just that, to roll over into previous years. But in recent years, our rollover has grown quite considerably. So with the rollover that we have on hand now, we have more than sufficient dollars to be able to support the $40 million, as you said, to limit the copay to 20%, as well as the additional $6 million to try and get after the child care deserts. I'll also say the second part, and it's an important part, is that our federal base funding for childcare has been increasing in prior years. So last year, we received an additional $35 million in our base funding. And again, we are expecting additional federal dollars coming in when we get our new allocation this year. So Assemblywoman, there's a high degree of confidence that between taking a small piece of rollover as well as our new additional federal base funding, we should be more than sufficient in being able to continue that.
Thank you. I also want to ask about the PPP funding that some of our voluntary providers have received. I want to make sure that between the CARES Act funding and these other federal programs, that they won't receive any kind of negative impact on their rates, that this won't be counted as an offset against them. They've had extraordinary expenses, and I want to make sure that we're taking into account that those funds were used for these extraordinary circumstances moving forward, and that we don't punish them for accepting this help.
Yeah, we certainly have received a number of inquiries asking us to be careful about that and to hold folks harmless. The one thing we have to be very careful of is that by doing so, we don't run afoul of any federal or IRS rules. So we are analyzing all of that. But again, understanding, right, these dollars were intended to be, right, pandemic, given extraordinary circumstances. And again, my position and hope would be that if it is permissible and is not something that's illegal or creates problems, that we would certainly want to try and find a way to accomplish that goal.
Thank you, Commissioner. Go now to the Senate.
Thank you. We've been joined by Senator Sue Serino, Ranker and Aging. I just want to double check. Is Senator Wyke back with a question?
Sorry, Madam Chair, I am still not finding him.
But you all know we're looking for him. So then I'm going to turn it over to Senator Sue Serino.
Oh, thank you, Chairwoman. And Commissioner Poole, it's great to see you again. I just want to I want to say that I echo Senator Martucci's comments and concerns. And as you know, I represent the Red Hook facility, which employs between 40 and 50 residents. And I was wondering if you could tell me exactly how the state believes closing only this facility, how much it's estimated to save.
Sure. So there are actually 47, as of a couple of days ago, 47 employees at the facility. And I, you know, for anyone who's got staff in a district where we're proposing closures, I think it's important just to take a moment to make sure people appreciate and understand all that we are doing. There will be no layoffs associated with these closures. The governor and budget director have made that clear. And we have already done a session or a number of sessions in each of the 4 facilities. We brought in the Career Mobility Office from Civil Service. We have, obviously, these employees who are impacted are prioritized for every open position that we have in our other juvenile facilities at OCFS, as well as any other OCFS non-juvenile title for which they would be qualified. So we, you know, we've been through this before, Senator. We've closed facilities. I see these folks, you know, not just as PEF and CSEA employees, they're my employees too. And I do understand the impact on them and their families and what this means. And we take that seriously, and we've been actively engaged with every single employee to try and create as desirable a plan for those staff as possible. As for savings for Red Hook, the estimated savings from a closure of that facility would be close to $3 million annually, and those are all state general fund dollars.
Okay. And then I was also incredibly disturbed to learn that this week, many of the employees have they've been given the cards that they've been asked to fill out to know where like they would want to transfer to when the facility closes. So it kind of sounds like to me that the decision has already been made to close these facilities. So I'd like to know from you whether you believe that this is even up for negotiation. And the other part of that is, can you guarantee reemployment to the employees that might not be able to travel a couple hours away to another facility?
Yeah, so we want to be prepared, right? I mean, we don't, right? The budget is a proposal. It will go through its, you know, its natural deliberation process. But if the budget is passed as proposed, and if we are going to be closing these facilities in October, I don't want us to be waiting, right? We want to make sure we are planning well in advance to give staff every opportunity for reassignment or transfer, you know, or a new position. So I'd rather be us planning ahead and having them fill out their cards and seeing what options are available than at the last minute, right, as a clock is ticking, you know, to do that. As for the closures themselves, I will say this candidly and honestly to all of you, that we as a state, and again, with, you know, staffing aside, you know, we should be celebrating the fact that we are able to close juvenile confinement facilities. We've done a lot in diversion. We've raised the age of criminal responsibility. Our number of kids in care is down, and it is not a bad thing when we are shrinking our physical footprint of juvenile confinement facilities. And so with all due respect, and it is no reflection, and I've said this to all of my staff, and I've had conversations with every facility director who's impacted, these closure decisions are not a reflection on the quality of the program or the quality of the staff at all. They are a reflection of us doing what we're asked to do, which is to try and have young people remain with their families in their communities and taking advantage of services. So I am in support of the
Thank you, Commissioner. We're going to go to the Senate now.
Okay, thank you very much, Assemblywoman. Our next senator is Senator Tom O'Mara.
Thank you, Chairwoman, and thank you, Commissioner, for being with us today. I want to go back briefly to the cost shift of reducing the state assistance to counties for provision of these services, the reduction of the 65-35 split down to 60-40. What is being done for the counties? Are they getting any flexibility on how they provide these services or what they have to provide so that they don't get stuck with this full state reduction on their backs? It's just a cost shift. if they don't have any greater flexibility to control their costs.
Yeah. Yeah, no, I think that's a fair question. You know, if these reductions, right, the 5% or the 3% in the case of the foster care block grant, you know, right, county executives, social service commissioners, right, you know, have to make individual determinations whether to, you know, reduce some of the services. Again, there's mandated services that they're required to provide, but many counties, because of the rich state reimbursement, go above and beyond, right, investing particularly in preventive services. So, you know, it's possible that some counties, and we all know, counties are feeling very stretched and stressed, right, that might result in the reduction of some, you know, some services. So that is absolutely a possibility and an unfortunate part if in fact these reductions have to stay.
Okay, so that, I mean, my concern there is that this, what may be perceived as a 5% reduction from the state is going to result in a 10% reduction overall, because counties, local governments are in no better fiscal condition than the state of New York is, given this pandemic we've been through. So that seems to me it's going to end up being a much larger impact to the provision of these services. But moving on to the closure of facilities, particularly the Columbia Girls Secure Facility. It's my understanding that is the only secure girls facility in the state. So what is going to happen to the girls that are within that secure facility? Where are they going to be transferred to? Are they going to be combined in a boys facility? How's that going to work?
Sure. So, so today we have 3 young women in that secure facility. That's a 16-bed program. So our proposal is to create within our Brookwood secure facility, which is a very large, and I've invited all of you to tour our facilities in the past, and I hope once we get past COVID, you will. So Brookwood is a very large state-of-the-art facility that has plenty of room and physical plant capacity to stand up a unit for those young women. So just to be clear, right, they will not be commingling or co-housed together. There will be a very separate unit for the young women. So they will be housed separately. They will have meals and programming separately from the young men there. The one place and right, you know, I think all of you may know that young people who are in our secure facilities are those young people with the more serious charges, so they tend to stay longer. We made a lot of investments in education and vocation. So we've got a fantastic college program at Brookwood. We have a collaboration with Columbia Green Community College. And so we obviously want to make that available for the young women too. And so there may be some classes virtually that the young women are able to participate in as well, which obviously only makes sense.
Thank you for your time, Commissioner.
You're welcome.
Thank you very much. Assembly, it's yours.
Yes, we go to Assemblywoman Clark.
Hi, Commissioner Poole. Great to see you again.
Yes,
on
nice to
Zoom.
see you.
Thanks for all your help and guidance when I first took office. We're back to childcare because, as you might recall, is my big passion.
Yeah.
It's great to hear about the $163 million from the CARES Act being completely allocated, and anything we can do to continue to help facilitate getting those payments out is wonderful. I also know, you know, with the new money coming from the Consolidated Appropriations Act, which is also good news for the childcare industry, it's still not enough based on some of the recommendations that came out from the reauthorization in 2014. I know we've done a lot around the health and safety for our facilities, but to really create a system that's affordable and accessible for both families and providers and those who work in the industry, it still seems the state may need to come up with its own money to really invest in a childcare system that's going to work across the state. So I guess my question is now, with this over $400 million coming in again, are there any thoughts? And we know some of the recommendations have to come out in the next 2 weeks of what the state plan is. So do you already have some thoughts? I just think, you know, having providers have to take costs on background checks, paying at this point, particularly with COVID still rampant, you know, paying for enrollment, not attendance. There's certain things that I just wonder, can you share any of the ideas that you have come up in conversations or are going to be talked about to be potential ideas in the state's plan for that second round of money?
Yes, you put a lot into your questions.
I did, it was, sorry, very good question.
That's for sure. So, you know, what I will say is sort of big picture, right? Sort of universal childcare, right? Really aspirational goals for us as a state and certainly our childcare task force as well. Pandemic, right? $470 million in pandemic funding is great. It is one time, so it's clearly not, right, the solution to the big issue, right, which is, you know, the goals of that federal bill that was passed, you know, several years ago. So that's still an issue for us, right? The 12-month guarantee and graduated phase out on those kinds of things. You know, $500 million was unaffordable to us when the bill passed. We still don't have that kind of federal support yet. There's hope because, right, the feds are really talking about the deep investment. With respect to the next round of pandemic, the $470 million, you know, we know from CARES rounds, right, that scholarships that we've offered to essential workers, really helpful. I think there's room for us to expand eligibility for who is eligible to take advantage of those scholarships. You know, clearly the kinds of things that you mentioned, you know, reducing clearance fees, all those kinds of things. There are a lot of things that are on the table. And as I just want to repeat, you know, what others have raised earlier, you know, we do know that we have to make it easier for folks to apply and for us to be able to be responsive. To your issue, Assemblywoman, of enrollment and capacity, right? So we do a weekly survey of childcare providers. And while many have remained open, right, what we're hearing from them, roughly 2/3, is that while they might have 75% of their slots enrolled, they actually on a weekly basis have far fewer kids actually coming into the service. So how do we keep those centers, right, alive and keep their staff employed while recognizing it's going to take some time, right, for folks to sort of bring their children back to childcare? So it's those kinds of concepts that we hope to be bringing forward in the new federal money.
Thank you. So now we'll go to the Senate.
Thank you very much. I actually think I may be the last one with questions, and I don't want my 10 minutes, not to worry, but I want to talk to you, Sheila, about what I think a lot of us feel like we know is out there and about to explode, which is the level of teenage sort of angst and suicide, actual suicide because of everything that's going on with COVID. You know, they are forced to stay at home with parents, which teenage years maybe aren't perfect times to do that. They are separated out from their peers, which teenage years, you know, you're so much more dependent for the good and the bad of it with whatever's going on in your peer group. People are self-medicating, teenagers and adults, but teenagers, you know, it's already a pattern. Where are the new programs? Where are the new places where we think we're going to have the resources to deal with this issue? And when I say, I think we all know this, I mean, I'm talking to educators, psychiatrists, substance abuse providers, and they're telling me this is like this secret that's not so secret that's going to explode on us. So I worry that I don't see any new initiatives in the state budget about really dealing specifically with these issues. And they're different for teenagers than they are for older people. They also culturally, you know, play out differently. Disproportionate growth in suicide attempts by young people of color. Already an underserved area for us. I know that for years, people have told me there aren't any child psychiatrists in much of rural and upstate New York. So, don't assume you're starting with them because they don't exist. So I'm very concerned about this, and I'm just not sure the state's doing any kind of planning for something that is real and is out there.
Yeah. So I feel like I'm a little bit out of my wheelhouse in responding to this, Senator, but I share, we have seen some cases where there have been youth suicides, and we all know, right, just the trauma that young people, and right, none of us are the same. I don't think in February of 2021 than we were, right, a year ago for sure. I do know that the State Office of Mental Health, we have done some work with Commissioner Sullivan and her team around teen suicide in 2020. And as I think you all know, right, telehealth and being able to increase access to mental health services using technology has been a big push of the state. But I'd like to, Senator, circle back with Commissioner Sullivan to get you a fuller answer about what OMH is doing as well.
But you don't see it as an issue for you unless you have to take custody of those children? How do the lines get drawn?
Well, it's an issue for everybody, for sure. But, we've not seen a lot of kids come into foster care or custody because of concerns of suicide. So I don't know, and I'm not saying that it's certainly fully an Office of Mental Health issue, but we are not seeing an increase in the number of kids coming into care because of suicide concerns. I think it is a medical and a primary sort of prevention concern. And as I said, that's most typically within the Office of Mental Health. And I'll need to get back to you on what else we can be doing.
All right, thank you very much.
Of course.
Yes, we'll go to Assemblyman Anderson for 3 minutes.
Okay, can I be heard?
Yes.
Okay, good morning. Thank you, Chairwoman Weinstein, and thank you, Commissioner Pohl, for being here this morning to answer very critical questions around children and families. I have a few quick questions. I know time is limited. I want to ask this one first. As it relates to foster care, Chaffee Foster Care Independence Program provides funding for academic supports and for foster kids, tutoring and mentoring, exam prep, like college application stuff in that wheelhouse. Did we receive another round of funding, Commissioner, from the federal government for 2021? And will it be the same formula to disperse these funds around those areas, issue areas? And do you know around about where they'll be released?
I'm so sorry, Assemblyman. My heater fan turned on.
Oh.
I'm so sorry. I didn't hear the name of the program that you referenced.
Chaffee Foster Care.
Oh, yes.
Independence Program.
Yes. Actually, there's some really good news on that program. So,
I like good news. Let's hear about it.
Yes. Thank you for allowing me to share some. So, as part of the Consolidated Appropriations Act, there's an additional, we believe, $28 million coming to us in New York State. So that will add on to, I think, our base for Chaffee has been around $12 million. So there's more money coming for young people. And, it's going to raise the grant awards for young people up to $4,000. So it's pretty exciting. There's also some other new federal provisions included in that act that will allow young people who've left care during the pandemic to re-enter care up to the age of 22. So it's been a long time, and I've been around a long time, but it's been a long time since we've seen a real federal interest and investment in aging out young people. And I am very happy to say that during the pandemic, the sort of plight of young people in care and aging out of care and needing supports seem to be listened to. So we will be getting those dollars out. We've not received our notice of funding availability yet. But we plan, we will have a plan in place, Assemblyman, to get those dollars out. And like the conversation about federal money in CARES, we want to do it as quickly, as efficiently, and get the dollars into the hands of young people who need it just as soon as we can.
Absolutely, and I'm sure you know that the child care, the foster care system has some hiccups, and this infusion of dollars will really work to help in that effort. I have one more quick question. I know, Helene, I'm running out of time, but really quickly, the elimination of the Committee on Special Education state share. I was a special
Assemblyman, the clock is running up instead of down. So why don't you email, we'll be able to email the commissioner the question to ask later.
But it's just really quick, Helene, really quickly, just really quickly. Can you just explain?
Okay, I'm sorry, Assemblyman, but we really have to enforce, we've been enforcing the rule.
Thank you, Chairman.
You can share with me and I'll ask the commissioner during my time. To the Senate now.
Oh, thank you very much. Sorry. We have one more questioner, Elijah Reichlin Melnick.
Thanks, Liz. You got it. Commissioner, I should say Chair Krueger, I apologize. Commissioner, thank you so much for taking some questions. I just wanted to ask you, and I think others may have, childcare resources are a huge concern for me. I've spoken to some of the leading providers and the umbrella organizations in my district. Several have closed. The last year has been very hard for people providing childcare, and so a number have exited the business entirely. And then others are really just still waiting for CARES Act funding. And so I know that you're working hard to get that funding out the door to people, but I just kind of wanted to touch base and ask you, what can we do to speed that up and make sure that as quickly as possible, folks in the childcare sector are able to get their funding and continue providing these services?
Yeah, no, I appreciate that. So there's nothing you can do. I appreciate the offer. I think I will assure all of you, we have made the necessary adjustments and preparations here at OCFS. And when claims come in from the CCR&Rs for CARES dollars, that we are going to turn those around very, very quickly. And we've made a lot of progress. And we know, right, as we heard earlier, there is still money that's got to get paid out the door. So we need those claims coming in, and trust me, as my team here, and I meet with my CARES people once a week, we've got dashboards and trackers. They understand here at OCFS that people are waiting for their money, and we are pushing those dollars out the door just as quickly as we can. So
I appreciate that. And what do you think the timeline may be for getting some of the funds in the recent federal stimulus from December? And then I guess we don't know when Washington is passing the next one, but hopefully, do you think we are able to learn the lessons from CARES Act to get whatever money we do get in this next round out the door even quicker?
That is my fervent hope and commitment. Yes, that we will absolutely have much better agility and technology supports. We did not have the luxury of standing up any kind of system. So this was sort of a long business process, right? And that I think all of us who are getting these big bodies of pandemic dollars know it can't be sort of government as usual, right? It's got to be a new, faster, more nimble system. And we've been really working toward that since the act passed in December.
Commissioner, thank you very much. Appreciate it.
Oh, thank you.
Thank you, Assembly.
Yes, we go to Assemblywoman Cruz, who is back from her committee meeting.
Thank you. I'll keep my question, it's fairly short. Commissioner, thank you for being here today. The $6 million grant that we've been discussing, one of the things that I think it's great, and my apologies for the dinging, I still don't know how to stuff off on my computer. Not very technologically savvy. How are you determining where these childcare deserts are, or actually have you determined where these childcare deserts are, and what parameters are you using to determine it? And then going back to a comment actually that Senator Borrello mentioned, which was making this process easier, and perhaps something like unemployment insurance. I beg you not to make it like unemployment insurance. It's actually been a pretty hot mess for many of my constituents. I represent a community that has a large number of childcare providers. My mother is actually a childcare provider, and I understand the difficulties of actually working with that system. Many of our childcare providers in downstate have a language that is dominant, that it's other than English. So the easier we can make it and the more accessible we can make it in another language, the better. So language, childcare deserts, and how those are being determined.
Great. So language we are absolutely sensitive to. We have always made our applications, our guidance documents. If you go to our website, Assemblywoman, I think you will see that we are very, very much supportive and responsive to language access needs. So with respect to the $6 million that's proposed for childcare desert, so believe it or not, there's actually quite an operational definition of what a childcare desert is, and it's from the Center for American Progress. So I'm going to cheat a little bit and read off. So it's a census tract with more than 50 children under the age of 5 that contain either no licensed childcare providers or so few options that there are more than 3 times as many children as there are childcare slots. So it's a mouthful, it's a lot, but that's generally sort of the threshold about what defines a desert. And when we use that definition from the Center for American Progress and map it over New York State, we actually have around 64% of our state having a childcare desert. So our plan will be to work in coordination with the regional economic development councils, right? It makes sense to use a regional approach. And as you may have heard me say earlier, the REDCs have really become very important strategic and financing partners and investors in childcare. So that will be our plan, is to work through them, get to these census tracts and figure out where is it most strategic to begin making those investments.
Thank you.
Okay. Thank you.
Any more senators?
We do. We have our chair, Senator Brisport, for his second round. Would you like to wait till the assembly completes or have him go now? What do you prefer?
He can go now, right? And then we'll.
Okay. Senator Brisport.
Hi, Sheila, it's me again. And I hope everybody can hear me better. I heard there were some complaints about my audio last time, so I hope I sound a little bit better now. And Sheila, I just apologize. I had to step away for a bit, so sorry if you answered this already, but I wanted to talk more about the cuts to regarding the Committee on Special Education. And just, if the state has consulted with any educational stakeholders that may be impacted by shouldering the shift in burden from the state to localities in these reductions in funding. And, I'm just curious what the response has been, if they've been consulted with. And I'm just curious, what has been looked into how this will affect local school budgets, local property taxes, and so on.
Yeah, so I'll be really candid with you, Senator. I've never understood why this is in OCFS's budget. These are not children in foster care. They're not in the care and custody of any local social service, right, Commissioner? These are kids who, through the local committees on special education and under IEP and special education law, are determined by the school district to place child in residential care. The proposal is to make that shift permanent. I don't know that anyone has had any conversations with either the state education department. I'm not aware of any. I have not had any. And I think the estimated cost savings from that, again, across the entire state is about $28 million.
Well, yeah, I really appreciate that. And I'll just, reiterate what I, said earlier, like way at the beginning, is that someone needs to pay for this. The state has the ability to raise progressive taxation on the wealthiest New Yorkers and should be doing so to shoulder the burden of some of these. But I'll see the rest of my time. And thank you again so much for taking your time to answer our questions.
Pleasure.
Assembly.
So we will go to Assemblywoman Gonzalez Rojas.
Hi, thank you, Commissioner, for being here. My question is also in the same vein for students with special needs. The state is proposing eliminating 18.42% state share room and board for children with severe disabilities. So I want to hear how children will be hurt by this cut and how the local school districts will have to pick up, or whether the local school districts will have to pick up the funding, given that they're struggling right now to meet the needs of their own communities. So if you could share more about how we will be addressing these cuts.
Yeah, so it really is a shift in funding, as I just responded to Senator Bridgeport. So it would require local social service district, local school districts across the state, right, depending on how many young people they place through committees on special education, to absorb that portion of the costs.
Do we have a sense how they're going to do that?
I am not aware of any analysis that has been done, by the hundreds and hundreds of school districts that we have in the state. I'm not aware of that.
All right. I also support Senator Bridgeport's comments about taxing the wealthy to get there. So we have a lot of proposals on the table, and we hope to get the funding to the communities that need it most. Thank you.
Understood. Thank you.
Okay, we go to now to Assemblyman Wolzak. 3 minutes.
Hi, Commissioner. How are you today?
I'm well, thank you.
Wondered if you could tell me, a couple of years ago, the governor had a task force on child care affordability. And I think a report was done by that. Has that report been made public yet?
You're right that the governor convened a child care availability task force at the end of 2018. I have had the privilege of co-chairing that task force. They have done absolutely amazing work. There is a final report that has been drafted, and we are hoping to have that report released very, very soon.
Thanks, Commissioner, and appreciate your work on the task force. What does very, very soon look like to you?
Soon, just as soon as possible, Assemblyman. I know everyone is very anxious to have the report released. I will say, Assemblyman, and this is not a substitute for a release of the report, but I will say that a number of the things that you've heard me speak about today, right, focusing on limiting family co-pays, childcare deserts, reducing, right, administrative burdens and duplicative things, right, are very reminiscent of the kinds of things in the task force. So although the task force has not released its report, we were very strategic and intentional on bringing forward some of the themes and recommendations in this year's budget proposal.
Okay, I just asked I had a different commissioner, and not you, but answer me in a letter in August saying as expeditiously as possible. And that was last August, and I still don't have an answer on as expeditiously as possible. So very, very soon sounds good. I look forward to reviewing it very, very soon. And hopefully it has some answers dealing with the patchwork of subsidies and payments that we have across New York State. So I represent 2 counties. It's kind of a tri-county area. Constituents work in one county, live in the other, and the patchwork can be very difficult to navigate for providers and for families. Are you doing something about that in this budget, and will the task force report on that?
Yeah. So, not to give too much of a trailer of the task force report, but that sort of idea of consistency across counties, right, as is a theme that is discussed, and there are a specific set of recommendations about that. In the task force report, I think the one thing that is in this year's proposed budget that gets to that is the $40 million investment in, sort of the 20% limit on copays, across the state. So it is one important step forward toward a sort of a statewide standard that applies to all families, regardless of what county they live in.
Thank you, Chairwoman. Thanks, Commissioner.
Of course.
We go to Assemblyman Hevesy for his second round, 5 minutes.
Commissioner, you made it. We're almost done. So thank you so much for hanging in there with us and all of the work that you're doing. I got 3 questions. I'm going to ask them quick in a short amount of time. If I can ask you to keep your answers relatively concise, I'd appreciate it. So the first one, another of my colleagues mentioned that our providers, particularly, well, it doesn't matter. All of our providers have been taking federal money from a variety of different sources, and I am deathly afraid that they're going to be penalized for doing exactly what the governor asked them to do. The governor has been asking us to go after federal money for the better part of a year now. These providers followed that instruction. If you could give us some sort of assurance that their rates are not going to be hurt because they took the federal funds, that would be really important for these providers.
So my quick response is I think I answered that same question earlier on as asked by another member. So again, completely in support of that, just want to make sure that we're not running afoul of any federal rules regarding, double dipping in the federal pot. So
I appreciate it, Commissioner. Thank you. I do.
You're welcome.
Second is MSAR rates. Can you give us a sense of when they're going to be published? Because providers need to make their plans. So I just wanted to get a sense from you where you think those rates are going to be coming out.
Yes. My hope is that the rates will be coming out very soon. They were due out some time ago, and I do understand that that creates some challenges for providers. I will say, however, absent the official publication of the rates, we have been able to message to the providers that in doing their budgets for this year, that they should assume that the rate structure and the improvements we made in the last rate package will hold true for this.
That's great. Okay. Fantastic, Commissioner. And just one last question, and this is the big topic I didn't touch on in my first round, but this is childcare. And I'm not going to, I know, I'm not going to come back at you and ask you for the release of the report. Although I got to be honest, I'm excited for a couple of reasons. One, the word of mouth feedback about that report is it's stellar. And it calls for a wholesale change of the childcare industry, which I think is wonderful. My concern is, since we have a deadline to spend, and by the way, you said 469 million. I thought it was 464. It's 469?
469 million is our official number.
Thank you to the Consolidated Appropriations Act. That's great. So you have that money and you have a deadline to spend it in the next 2 weeks. Regardless of whether we get that task force report out, I would hope that the executive and the legislature could come to agreement on how to spend that one-time lump sum in a way that sets us up to succeed for what the task force report will eventually say. Is that a fair assessment?
Yeah, I think we're all right. I think we're all aligned on the goals here, right? It's a matter of how we get there. I just want to clarify, thank God we don't have to spend it in the next 2 weeks.
No.
2 years. Yeah.
2 years. Yeah, I agreed 100%. But I Commissioner, I've been watching this just for a couple of years. I know you've been doing this for a lifetime. The fact that there is actually a lump sum of federal cash to be used for childcare is a very exciting prospect. And I look forward to working with you, the professionals at OCFS, Division of Budget, and the governor on doing the best we can for the children in New York State. This is a great opportunity for us. I think we could do a lot of good for a lot of kids and families. So I look forward to working with you, and thank you for all your time and testimony today.
Thank you.
Thank you.
Thank you, Assemblyman. Thank you, Commissioner. I think we have, I know we have gone through all of the members. Information has been very helpful. I know that we'll continue to have some offline discussions as we have in the past, and we look forward to some additional funding in the next stimulus package that we'll be discussing, hopefully even more expansion than we're talking about today. So with that, I want to thank you for your participation, and we're ready to
Sorry,
call
I
our.
believe we have one more member. I apologize.
Oh, okay.
Member Farrah Forrest.
Right, I saw her hand up and then it disappeared. So you're with us for another 3 minutes, Commissioner. So we're going to go for 3 minutes to Assemblywoman Forrest.
Thank you so much. Thank you again, Commissioner Poole, for being with us today. I do want to, I know that Chairman Prasad had raised her hand and asked a question about the Summer Youth Employment Program. I know she had requested some information. You said you didn't have it, but I would like to again request that information be forwarded to her, but then also to us in general for social services, because I will have to say that the loss of summer employment this summer had quite an impact on the youth that that is in my district, but also on the employment of vendors, right? Vendors in the community. I do think that if given the opportunity, that the vendors can transition to online. And so online learning, online employment, there's great room for college preparation, career preparation. So please, this information would be very important to our communities, and this information could be shared amongst us all. That's my only small request, and I give back my time, Chairman Weinstein.
Thank you. We'll be sure to get that information, Assemblywoman.
And Commissioner, to the extent that you provide additional information to some of the members, the question, if you could please share it also with myself and Chair Kruger, and we'll make sure that all the members on the call, actually all the members on the committee, receive that information.
Yes,
also,
of course.
Summer youth is something we all care about very much. So now,
okay.
Now I get to say, I'll say good morning to the next commissioner instead of good afternoon. Thank you.
Thank you all.
So now we're going to call the Commissioner in New York State Office Temporary and Disability Services, Malcolm Hine, to join us.
How are you doing?
Good, good. So just a reminder, we have 10 minutes to make a presentation. We're happy for you not to take all the time, and then we'll go to the chairs and then members for questions. So proceed.
Wonderful. Good morning, Chairs Kruger, Weinstein, Prasad, and Rosenthal, and distinguished members of the State Senate and Assembly. I'm Mike Hine, Commissioner of the Office of Temporary and Disability Assistance, or OTDA. I'm pleased to have this opportunity to discuss the 2022 executive budget and the critical work of our agency. As we collectively design solutions to the far-reaching impacts of COVID-19, what is clear is that New York's social safety net has never been more important. OTDA's core mission is to help vulnerable New Yorkers meet their essential needs and advance economically by providing opportunities for stable employment, safe housing, and quality nutrition. This pivotal responsibility is accomplished in conjunction with the state's 58 social service districts and with your support. While New York State has been at the forefront of combating this terrible virus, unfortunately, we remain in the grasp of the global pandemic. Our fight for economic recovery has just begun. At the outset of this pandemic, OTDA took extraordinary steps to reimagine the way we do business. Our agency quickly adapted to support a remote workforce where possible and adjust the office space for those essential employees who needed to continue to report in person. I'm proud to say that even with these never before seen obstacles, OTDA's workforce rose to the challenge in carrying out our agency's core mission while consistently going above and beyond to help our fellow New Yorkers. As you know, unprecedented times have called for unprecedented governmental actions. To that end, we are grateful for both the governor's and the state legislature's timely actions to ensure an effective eviction moratorium that clearly avoided a catastrophic homeless crisis across New York State. I'm happy to share with you that our agency has been tasked with the critical role of overseeing a new federally funded $1.3 billion emergency rental assistance program this year. This initiative will provide desperately needed support for households behind on their rent that have experienced financial hardship as a result of COVID-19 and are at risk of homelessness or housing instability. Those with the lowest incomes will receive priority, including those who are currently unemployed, greatly reducing economic hardships for these families. It's also important to properly set expectations. So while this program will make a huge difference for many families and landlords, more federal funding will likely be required to fully address this pending national crisis. Additionally, under the governor's leadership, we continue to make meaningful progress in our ongoing efforts to ensure that all New Yorkers have access to affordable, safe, and secure housing over the long term. This includes the governor's unprecedented $20 billion 5-year housing plan, which is creating or preserving 100,000 units of affordable housing and creating 6,000 new units of supportive housing. I am pleased to report that the supportive housing component of this commitment has already been achieved and exceeded, and we are on track to meet the governor's goal of creating 20,000 new supportive housing units over 15 years. And we will continue to press forward because we know the need is great. The executive budget also continues historic investments in the Homeless Housing and Assistance Program, or HHAP. This program provides capital grants and loans to expand and improve the supply of permanent supportive, transitional, and emergency housing for individuals experiencing homelessness. HHAP is unique among capital programs in that its specific mission is to serve the most economically disadvantaged among us. Thanks to the governor and the state legislature, funding for this program was doubled last year to $128 million and continues at its highest level ever. Now, I'm pleased to report that yesterday the governor announced that HHAP has awarded over $90 million for 20 projects that, when complete, will serve thousands of individuals in need for many years to come. And in addition to addressing housing needs, OTDA also assists vulnerable individuals and families with the resources they need to put food on the table. Immediately after the onset of the pandemic, New York saw a dramatic increase in households seeking relief from the Supplemental Nutrition Assistance Program, or SNAP. In a program as large as SNAP, a 2 to 3% increase is significant and reflects a profound need. In 2020, we experienced an increase of over 7%. To help meet this need, OTDA aggressively sought federal waivers to ensure New Yorkers could continue to access SNAP while greatly expanding nutrition assistance for families and individuals suddenly experiencing greater need, some for the first time ever. OTDA also quickly acted to secure hundreds of millions of dollars in COVID-specific funding to provide additional supports for New Yorkers facing food insecurity. This was accomplished largely through 2 new programs that provided significant relief for those adversely affected by the pandemic. The Pandemic Electronic Benefits Transfer Program, or PEBT, brought in more than $1 billion in food assistance for more than 2.5 million children who were unable to access free school meals due to COVID-related school closures throughout New York State. And since March, the SNAP Emergency Allotment Program has brought in more than $100 million per month in additional federal aid. The $1.1 billion in supplemental benefits issued through December has ensured that all SNAP households receive their maximum monthly benefit based on household size. In January, the federal government also temporarily increased benefits for all SNAP households by 15%, which will continue through June of this year. Now, as we look forward, OTDA is continuing to work with the United States Department of Agriculture to finalize a plan that will provide a second round of PEBT to New York school children for this current school year. We're also thankful that during such difficult financial times, the executive budget continues steady funding for OTDA's core programs that serve as a lifeline for so many in need. These programs include temporary assistance, the Home Energy Assistance Program, or HEAP, as well as other key areas like child support, shelter inspections, fair hearing, summer youth employment, and refugee assistance. OTDA also proudly administers life-altering disability determinations that result in roughly $1 billion being distributed annually to help disabled New Yorkers make ends meet. Like all of you, we take very seriously our role in helping vulnerable New Yorkers meet their essential needs as they strive to achieve independent financial stability. With the governor's leadership and the leadership of the state Senate and Assembly, New York has achieved so much in this cause. Now, after a year-long battle with COVID-19 that is far from over, and as we face the long road to economic recovery together, the role of human services and your support has never been more important. At OTDA, we are confident that by offering critical assistance, informed by many lessons learned, and by embracing our collective humanity, we will emerge from this moment a better, stronger, and more resilient New York State. I want to thank you for the opportunity to appear before you today, and I welcome any questions or comments you may have.
Thank you. Before we go to the our chair of social services, I see that we've been joined at some point earlier today by Assemblywoman Hindman, Assemblywoman Dickens, and Assemblywoman Hunter. And now we are going to go to Linda Rosenthal, chair of our Social Services Committee, for 10 minutes.
Thank you, Chair Weinstein, Chair Kruger. Hello, Commissioner. It's good to see you in semi-person since we've talked so much on the phone. First, I'd like to say I'm delighted to be the new chair of this committee, and I'm delighted to work with my friend Roxanne Persaud, the chair in the Senate. And I thank Andy Hevesy for his stewardship and strong support here of this committee. I have big shoes to fill, but I aim to fill them with all my colleagues' assistance. So, Commissioner, I have many, many questions for you. Let me first start with the almost $1.3 billion in rental assistance, rent relief that your agency is tasked with distributing. I believe, first off, the aid should flow to the low AMI band renters, hard to reach populations, including gig workers, people who work in the cash economy, and undocumented immigrants. Those are key, as well as mom and pop landlords. I think need to be prioritized before the big landlords, who can get along quite well for a longer time than small landlords. And also require that landlords give tenants longer-term protections against rent hikes and evictions and refusal to renew leases, which happen. What is your view on whether landlords will be the ones to apply in this program with tenant consent, a low AMI band, and how to get the aid to simultaneously the tenants who qualify, but also the smaller landlords?
Again, I think that this is a great question. It's a perfect way for us to kick this off. We're talking about a large amount of money designed to be able to make an enormous difference in the lives of so many New Yorkers who are really up against it and really facing significant rent arrears, facing the possibility of becoming homeless and nowhere else to turn. And so we recognize how serious and important this is. That said, we are awaiting some final federal guidance from the Treasury that will help us in the finalizing of this plan. But to your point, we absolutely believe in a centralized statewide portal. We believe that landlords should be able to participate in as well and apply. Obviously, the way that the federal dollars are structured, they will move through and be attached to the resident. So the client would have to agree and consent, but ultimately providing an opportunity for landlords to participate in the process, we see as very much streamlining it and opening it up and speeding the dollars that would ultimately flow and make a huge difference addressing rent arrears. I would again share with everybody that solving rent arrears is not something new to OTDA. OTDA does this virtually every day. whether they're in emergency situations, we step in and are able to help. This program, we believe, could be one of the most influential parts of helping some of the lowest AMI population find financial stability in a moment of extreme crisis. So we agree that.
Can you provide a little more detail about how the hardship fund for people who are undocumented, and how many people do you believe this money will help?
Again, I think it's a great question. How deep and how profound the need is to be able to solve the rent arrears problem, I think is an important part of calculating that number. We know it's significant. We know it won't be the entirety of the situation. So when it comes to the volume that we're going to see, it's unclear at this point. We've seen what happened with previous iterations of this, but we don't know this total volume. When it comes to your other part of your question, when you were talking about whether or not the federal government did not put forth a citizenship test in this legislation, and we do not see that taking place in New York as well.
Okay, that's great. I'm sure we'll be talking further about this program as the days and weeks go on. But when do you think the money will start flowing?
Well, again, I noted that there's we are awaiting, and we expect it imminently, some guidance from the Treasury. We are working also with the local governments, because I think it's important that everyone be aware of this. While roughly $800 million flowed to the state of the $1.3 billion, $247 million went to New York City, right, and to 23 other local governments, there's an additional $234 million. Those are local governments who opted in, who happen to be have in excess of 200,000 residents. So we're working with all of them as well to put all of this under an umbrella.
Okay. So during COVID, has the state used FEMA funding to de-densify congregate shelters?
The answer is yes.
Okay, and did the state direct social services districts to use FEMA funds? Did you direct them to move people out of congregate shelter?
No, we did not. What happened early on in this, it's okay. What happened early on in this process is we put out clear guidance to all shelter operators and to all districts to make clear exactly what our expectation was when it comes to social distancing, when it came to cleaning, when it came to the whole laundry list of things that we've all heard a million times over, mask wearing and the like. And so we gave detailed protocol in how the shelters must be operated. And as a result, some of them made the decision to make density reduction efforts and utilize FEMA dollars in the process.
Okay, let me ask you a question about FEPS. From what I understand, before families can get the FEPS aid from HRA, they must be sued for eviction. But we don't have evictions allowed right now. And also tenants can't owe more than $9,000. According to state regs, why can you not grant a waiver so that tenants desperate need of help from OTDA and HRA can get it?
Again, another great question. I know it's very popular at this point. Really. I appreciate that. Again, they're thoughtful, and I understand and respect that.
Okay.
While we're looking at FEPS, we are faced with a different challenge. I had such a wonderful answer that I would love to have been able to have a conversation about this with. Okay. We are very much analyzing it. We're working to be able to address it, and we believe that we will be able to address this issue. That said, there is a recent lawsuit that was filed as of yesterday, and because of that, it really limits my ability to be able to have a conversation about this.
Okay, well, I think it's important to get that waiver out so people don't freak out that they can't pay their rent, even though they'd be eligible in other times.
I would also note, I apologize. I would also note that the moratorium that has been put in place has done an extraordinary job of ensuring that those individuals are not negatively impacted in the process.
Yes, absolutely. The Homeless Housing and Assistance Program, it's meant to create 20,000 units over 15 years, but I think that it really needs to be quickened. There are so many people in need of supportive housing, and while that is a noble goal, I think the state has the ability and capacity to speed it up. What's your opinion?
The state has made some extraordinary changes to HHAP, and I couldn't be more proud to be involved in them. If we were having this conversation 3 years ago,
I know, but we're having it now.
would be no. But if we were, the dollars associated would be $64 million. Okay.
Right.
We now find ourselves in a situation where it's $128 million,
Yes.
not just last year, but in the face of all the challenges fiscally that are happening around the state, we still find ourselves with level funding. So it's that doubling of funding for HHAP, and we continue to roll out significant new projects. Again, $90 million in allocations announced just yesterday. We're very active in the process. We have reached out, we issued RFPs. The results have come in. We've had some extraordinary awards. So we're excited about where we're at. Now, we can always utilize more dollars. We recognize that the need for affordable housing is extreme.
Great. I have 25 seconds and a quick question to a larger problem. You've read in the New York Times about Victor Rivera, chief executive of Bronx Parent Housing Network, allegations of sexual abuse, financial misconduct. Was OTDA notified by anyone about these allegations prior to the Times coming out with it? And what is OTDA's oversight responsibility on these shelters?
Sure. I think first and foremost, we have to come and be very clear with this situation. If the former CEO of BPHN in any way, if these allegations, which are horrific, are proven, then he should be prosecuted to the fullest extent of the law. When we look at this situation, it's a contractual agreement between New York City and BPHN, though there are state dollars attached to it. I know that DHS is very active in this process. They're examining the situation. They've told us that they are in the process of looking to replace not just the CEO with a interim person from the agency, but ultimately to replace the CEO with a CEO that reports directly to the city. Those are all notable efforts by the city, but the reality is this. We are launching an investigation into DHS and how they have handled this situation to make sure that there was not anything that was should have been addressed that wasn't. And with that, if we identify anything, we will move forward and make it and address it very aggressively.
Thank you. I'd like to follow up afterwards. But thank you.
Absolutely.
We'll be able to, Linda, you'll have another 5 minutes after all the members have gone for a second. We go to the Senate now for their chair.
Our Chair of Social Services, Roxanne Persaud, 10 minutes.
Thank you, Madam Chair and Commissioner. It's great to see you. You know, it was a pleasure having a conversation with you as usual. I'm just going to touch quickly on the emergency rental assistance that Chair Rosenthal touched on. If a tenant's locality does not cover their 12 months rental arrears or provide prospective payments, will they be able to apply to the state for different payments? And also, will the tenant be provided a choice where they can apply for funding?
I'll answer the second question first. How about that? The goal here is to have all applications flow through a central portal. And so we've had these conversations with New York City. We've had these conversations with all of the districts as well, who have resources that have been allocated to them. And I think it is almost universally embraced that that is an important step in the process to have a central portal, central eligibility determination, and ultimately the ability to move dollars out extremely quickly. And so there's a goal to be able to do that, and we see the state as playing the pivotal part in that process. When it comes to people's ability to address issues that rent arrears that exceed the 12 months, and so make sure that everyone is on the same page. The federal dollars that have been allocated toward this allow for 12 months of rent arrears to be paid, and 3 months of prospective rent as well. So we very much are looking forward to being able to address a large number of issues. If it exceeds that, again, I think we'll have to have bigger conversations about that, about those particular situations where it exceeds both 12 months of arrears and 3 months of prospective rent.
Thank you. Can you tell me, will this program be assisting the foster care population, the ones who are just aging out?
Yeah, I mean, it will apply to anyone who is a renter.
Okay. And will the beneficiaries of this program be required to pay back any money at any time?
No.
Is that guaranteed?
I feel like I should have a longer answer. The answer is no.
Okay, so we're gonna go to summer youth. And you know, we've
Sure.
had this conversation, and
Absolutely.
we'll continue to have this conversation until we have full grasp of, you know, expanding the number of youth that we can employ for the summer. As you know, last year, New York City, there was a debacle with the summer youth program. Are we anticipating any issues this year in the administration of our summer youth program?
We are not. We are working very closely with New York City to make sure that they don't make the same challenges come forward that happened last year. Not sure if everyone is aware of this or not, but we should be clear. Last year, there was a decision by the city early in the pandemic to cancel summer youth employment program. That was a unilateral decision. Ultimately, they followed up with a program that came forward that did not meet what we consider the basic requirements, which is employment and employment experience for individuals. We worked with them to be able to identify where they could improve and get something to us that we could ultimately approve. Unfortunately, what happened then was they released the exact same plan forward, which was troublesome. I would be remiss if I didn't mention the fact that every single municipality in the state of New York, including very large ones that surround the Metro New York area, were able to bring forward a plan that was approvable. So we are continuing to work with New York City to ensure that that doesn't happen, because we understand the critical importance of this program and how it makes a difference in young people's lives.
Okay, because we didn't use the funding last year, what was that money used for?
Well, I think it's more of a conversation going forward on what happens this year from a budgetary perspective, and that should be considered in the scope of the larger budget.
So can I put this out there? So since New York City didn't use their full allocation, can that money be added to this year's money so we can expand the number of slots of summer youth that we offer?
That sounds an awful lot like a question for the Division of Budget.
Thank you. Going to SNAP. You know, recently the governor announced, you know, the auto enrollment for SUNY students, and I think that's going to cover 10,000 students. But there is no conversation about, you know, the City University of New York. They have a large population of students in need also. Is there a conversation that's being had about that population?
Absolutely, and we were very excited. I mean, what you just saw announced from SUNY is likely to positively impact 20,000 individuals. So we're excited about what that can mean, and we firmly believe that working with CUNY, we have the opportunity to be able to make a similar difference right there. Again, SNAP is such an amazing program to be able to stabilize households.
Well, thank you. There is a great need. Does the state have any plans to offer a simplified application for the elderly or disabled? You know, we tend to hear how cumbersome, we know, during this pandemic, we've made modifications, yes. Will these be permanent modifications so that the elderly and disabled are able to apply for benefits easier?
I mean, that really speaks to one of the core goals, which is to be able to limit bureaucracy, make it easier for people who are in need of services, and be a government that is continually evolving. What you speak of is something that I'm glad to be able to say is actually in place right now, a simplified application for seniors to make sure that we can maximize the number of individuals. It also gives me an opportunity to say something that I think is really important for people to know. New York State is a leader when it comes to being able to identify individuals who qualify for SNAP and then ultimately having them move through the process and be able to receive the benefits. And my most recent data that I had put us at number 1 or number 2 in the entire nation, especially for seniors.
Well, thank you. And I just want to make sure we remember, it's not only the senior population we're talking about, we're talking about
Absolutely.
the challenged populations also. Is there any plan to increase funding to food banks? You know, during this, the pandemic has shown us, you know, the great need that our communities have, and many of our food banks are struggling. Is there any conversation around increasing funding to food banks? I know there's a, you know, from the tax returns, you know, there's only $218,000 that's being asked to be transferred to Department of Health to be given to food banks. But is your agency looking at trying to get more money to food banks?
The answer is, as you mentioned earlier, the food banks will be receiving additional dollars this year, just simply by nature of the fact that that portion of the tax returns that relies on New York individuals and their incredible ability to be able to step forward and provide additional dollars when people are in crisis. The money that came forward there ultimately goes to the Department of Health, like you said, and through to food banks. And that's really where the funding stream is for the food banks. We very much are focused on the SNAP portion of it when it comes to nutrition assistance.
Thank you. So can you explain to us the unclaimed child support proposal? Just, you know, the 7-year to the 2-year, taking away the 5-year, because could you explain that entire process?
I sure can. When it comes to unclaimed funds, New York State agencies have one specific model that is utilized. And many of you have experienced this because you've set up and worked with the state comptroller to provide an easy access for your constituents to be able to access unclaimed funds. The problem is there is one outlier to that, and that is unclaimed funds for child support. Again, OTDA is tasked with collection of child support dollars and distribution of. So in this situation, we have come across with significant amount of dollars, and it takes action of the courts for us to be able to move those dollars. And it's so cumbersome that process takes 7 years. Okay, it's inconceivable to me that a young person could need these things, that the parent could need these things so desperately, the custodial parent, and the money's there. And it's difficult for someone to be able to identify and access through the current process. Again, a 7-year process. Transitioning over to operating not like an outlier, but operating just like every other agency in the state would allow this process to turn into a 2-year plan. And we would virtually immediately move over $7 million to be distributed in unclaimed child support that we could all collectively work towards getting those dollars into the hands of the custodial parent who is desperately in need.
Thank you, Commissioner. I'll come back. Thank you.
Okay, I think Ron Kim from the Assembly is the next up. Ron, are you there?
Yeah, I'm here. Hold on.
Okay.
There you go. Thank you. It's good to see you, Commissioner. Thank you for your testimony today.
Thank you.
Give Ron 5 minutes. Yes, thank you. Sorry,
Great.
Ron.
Thank you. Thank you, Chairwoman Kruger. So number of outside studies have shown that there's approximately about $2.2 billion in rental shortfall. Is OTDA keeping a track of some of these studies, or they're doing an internal assessment of what the demand is, or what the market for rental shortfall looks like versus what we're providing in terms of relief?
We're very much aware of those studies that are out there, and there are competing studies that talk about the magnitude of the problem across the state of New York and in the city of New York as well. We know the $1.3 billion is unlikely to be sufficient. We are working with everybody to maximize it and ultimately to be able to work with the lowest AMI population in an attempt to be able to ensure that the individuals who would be impacted the most directly and the most immediately are assisted first. That said, we're also building a program that allows for additional federal dollars to flow through and for potential expansion in the program as well, so we can help more and more New Yorkers in need.
Great. Those are all great things to hear, Commissioner. I'm glad that we're structuring these programs much efficiently and a better way to reach our most vulnerable members. And I know, as you know, DSCR had, I guess, access to the first pot of money under the Emergency Rent Relief Act of $100 million. We had a number of hiccups, and throughout the hearings, the number of our colleagues criticized how the applications were handled. There was lack of transparency. We weren't reaching the people that we want to reach. And I'm just wondering, are we actively sharing best practices notes? Are we learning from, the shortfalls of DSCR, and are we making sure that OTDA is executing in a much better way? And also in terms of the applications, I assume they're overlapping people that are applying for relief. Is there a seamless sharing of notes and data between the agencies?
Commissioner Visnauskas and I have had exactly this conversation, and our teams have worked very closely together because we want to make sure that there's lessons learned here, and we're able to move forward and get these dollars out quickly. We're very focused on, again, having landlord involvement in this process because we see that as an opportunity to be able to make things move more quickly. So sharing those information is critically important. When it comes to someone who has already applied, we're very much looking at a way to do some data matches that will allow us to be able to bring them under this umbrella.
Great, thank you. That's great, Commissioner, thank you. And I just want to reemphasize, and you already mentioned this, that the federal government doesn't have any guidelines around citizenship. And as you know, there's so many of our constituents have been excluded and just suffering through so much pain and trauma. So it's good to hear that our mission, our values are aligned in trying to reach out to the immigrant and undocumented communities as well. Just for my remainder time, I just want to dive into a little bit of supportive housing, if you will. I think the governor in 2016, said he was committed that he would try to build 20,000 units of supportive housing. How many units have been financed to date so far, Commissioner?
I don't have the number right in front of me. Oh, wait, here's the good news about Zoom, guys. I have the ability to be able to look to my right and to my left and have people that are engaged in this tell me the numbers. The answer is 7,000.
7,000. Okay, that's good to know. Okay, thank you. And of the 20,000 units that were committed, 7,000, I guess, how many units are open and occupied by formerly homeless households?
That I can't speak to at this point, but I will find the answer out and we will get back to you.
Okay, Commissioner. And I have a couple of follow-up questions in regards to that as well, and I'll submit them to you directly. Thank you so much for your time, Commissioner.
Thank you.
Thank you. Next for the Senate, Senator May, 5 minutes, the Chair of Aging. Senator May, are you there? Perhaps we will go on and come back to Senator May when we find her again. Senator Sue Serino, are you there?
Yes, Madam Chair. Thank you very much.
You're welcome. 3 minutes for Senator Serino. Thank you.
Thank you. And it's so great to see you, Commissioner Hein.
You as well.
Thank you very much for being here. Last year, I was very happy to see the additional $5 million included in the state budget to address the issue of homelessness among veterans. And I apologize if somebody else had covered this. I was away from the desk for a few minutes. Can you give us an update on whether that funding was ever released? And if so, how it was used?
It was released, and I'm proud to be able to say that it has been fully utilized. I want to be able to make sure that I get you a specific breakdown of how it was utilized, and I'll be more than happy to do that, but I can tell you that it was fully utilized.
Okay, great. Thank you, Commissioner. I'll follow up with you later. I appreciate that.
Well, thank
And
you.
then also I'm always talking about SSI, as you know, we've been trying for years to secure the increase in the state supplement of the SSI payments for individuals in adult care facilities. And as you know, these payments are their primary means for paying for housing, care, and services. And although a bill has passed multiple times, it has been consistently vetoed by the governor. So the SSI pass-through falls in your portion of the budget here, and the current rate is only $41 a day. So last year, I asked you if you thought this was sufficient, but now, especially in light of the COVID pandemic, I'm wondering if you believe that there should be a greater urgency behind the push to increase this allowance.
Again, I don't think there's ever a question about the need. I think the question is really more of a budgetary discussion that needs to be addressed in the confines of the budget in its totality. There's always need. As I think, as Commissioner Poole said beforehand, there's always, we always have need. We wish that it was a limitless pool of resources, but we recognize that that's not the case, and we try to do the best we possibly can to maximize our impact with the dollars that are available.
Thank you, Commissioner. I'm going to keep pushing every year, but
I know.
You know, and I know your heart is in the same place. So thank you very much.
Thank you.
Thank you, Madam Chair.
Thank you. Assembly Member Andrews?
Actually, Assemblyman Anderson we're
Oh,
going
I'm
to.
sorry. Excuse me. I didn't realize you were back.
Thank you, Senator. Yes.
My
Thank you
assignment.
for covering.
Okay, can I be heard?
You can.
Okay, thank you, Chairwoman Weinstein and Chairwoman Kruger, and Commissioner for being here this afternoon. I have a few questions related to housing subsidy. I know that the former Social Services Chair, now the new Social Services Chair, both Rosenthal and Hevesy, have been big on the HSS program, the Home Stability Support Program, which would provide essentially market rate vouchers to families to be able to afford to live in units. Where is the agency on that in terms of your position on it? I know that HRA downstate has taken a position on it. What's OTDA's position on it?
Again, we don't have a position on it. When we're looking at this, we understand the distribution of supplements. We understand what it currently exists in the system. We also understand what supplements are available in New York City as well. But the agency itself does not take a position on this legislation.
That's fine. Next question, Commissioner, for supportive housing. I want to make this is actually a comment, not a question. I think that the state, i.e. your agency, but particularly the executive, is moving incredibly slow on this supportive housing initiative. 15,000 or 20,000 units over 15 years is incredibly slow, and I think the state can do much better given the drastic circumstances that we are in as it relates to supportive housing and the needs for folks for those very critically important wraparound services, so that folks who are either returning home from incarceration, folks who need mental health supports, folks who are leaving facilities that are increasingly closing across the state, need supportive housing, among many other categories and groups. I just want to make that comment that the state is moving incredibly slow on that, and we need to do better on that. Question for you, Commissioner. In terms of fair hearings and negative case actions, are you aware of any fair hearings that are taking place on any social service cash assistance? Obviously, you guys only cover cash assistance related cases. And if so, what is your agency what steps is your agency taking to ensure that there are no negative case actions and fair hearings?
Well, from a fair hearings perspective, we obviously operate that portion of state government, and there has been really a Herculean effort by the team at Fair Hearings to be able to ensure that these critical cases get heard and heard quickly. That said, there was an absolute crush of cases to be able to address. They're working
Wait, hold on. My
through them.
time is, wait, can you just answer on the back end? My time, I just want to get this last question in.
Of course.
In terms of HEAP, have you seen an increase or decrease in the administration of HEAP? What resources does your agency need to thoughtfully execute the HEAP program across the state? I know we've been receiving increases in my district, but I want to hear what the agency is doing overall, just given the context of the pandemic. Thank you.
You're more than welcome. Thank you. When it comes to HEAP, what we did with the HEAP dollars is we were able to have multiple emergency allocations through the course of the year, and we extended the application process. I think we went from the benefits from March 16th of 2020 through August 31st of 2020, rather than closing in the spring. So there's been an extension in the process. Multiple emergency allocations have been made available to people in need. And in addition to that, we were able to provide a cooling component, and we're excited about what this can do for people, obviously facing the challenges of a hot summer, COVID, quarantining. For some individuals, especially seniors, especially individuals with serious medical conditions, the ability to be able to have an air conditioner can be absolutely pivotal. And so we're pleased to be able to have been able to move forward. I would say one other item when it comes to HEAP that I think we should talk about is we have moved to the point where we believe there are dollars available to provide assistance when it comes to utilities, in addition to the $1.3 billion that we'll be looking to work with rent arrears on.
Thank you, Commissioner. Now we go to the Senate.
Thank you. Senator Brian Kavanaugh.
Hi, am I on?
You're on.
All right, forgive me. Too many switches. Thank you, Commissioner. Thank you to all of the chairs who, chairing this very productive hearing. Commissioner, I want to thank you for your comments about the rent relief program. And I was particularly heartened to hear you say that the state does not intend to restrict it with respect to undocumented immigrants. I think that's in response to a colleague's question. I think that's very important, and has been a gap in our work in this area so far. I want to talk to you a little follow-up about some of the questions you've had about homelessness. You testified as to the state's various approaches. Can you talk about the scope of homelessness? Do you have does the state have an overall sense of the numbers of people who are currently homeless, who are so underhoused that they might be at risk of homelessness?
Absolutely. When we're talking about these kinds of numbers, we're talking about, again, they're very large, 92,000 individuals who are homeless statewide. I think that when we have this conversation about that number, and it is a very large number, and it speaks to the importance of affordable housing and other actions that we can take to be able to reduce that number. I think it's also important that we highlight the fact that unlike many states, because of New York's right to housing laws, in excess of 95% of the people who find themselves homeless are sheltered. And I think that's a really important component to make, or a point to be able to make when compared to what happens in many other states, where you see tent cities and extraordinarily troubling sites.
Right. But and in terms of obviously at any given moment there, so that's 90,000, that's a rough census of people who are in shelter facilities. And that includes government facilities and also, churches and other sort of more informal programs?
Correct.
Okay. And what is the scale of units that you can make available to homeless people in a given year at this point?
I'm not sure. Are we talking about shelters, or are we talking about?
I'm talking about permanent housing units. I'm the housing chair, so I do housing. I'm on the social service committee, but I'm trying to understand you mentioned a couple of your programs. We mentioned a few different routes to putting homeless families into permanent housing, including or keeping people in permanent housing. Is there any sense of how all of these things fit together and the overall numbers that are available?
Sure. I think when we complete this most recent round of HHAP, I think you're probably talking somewhere in the area of around 1,100 or 1,200 brand new units in addition to the existing units that are out there.
Per year.
Yes.
Okay, and I
And
see
again,
my
I think that speaks to the, that's just an HHAP. And it speaks to the importance of the 128 million, the doubling of those dollars.
Right, and that's an important program, and I support that program. And I see my time, the clock has run. I will want to follow up just on whether the state has an overall sense of the resources available to place people who are currently homeless into permanent housing, because we mentioned one option that has been on the table was mentioned before, but I think a lot of us are really committed to the notion that we need to do a lot more in that area. But 3 minutes is very quick, and I appreciate your testimony so far. Thanks.
Thank you so much.
Thank you.
Yes. We go to Assemblywoman Reyes.
Thank you, Chairwoman, and thank you, Commissioner Hein, for answering our questions. I have 3 very quick questions. I'll ask them, see if you can answer for me. So I've been working with Senator Prasad on enrolling New York State in the federal restaurant meals program. Just wondering what your thoughts are on the implementation, perhaps the cost of implementing such program that would allow the disabled, seniors, and the homeless population to use their SNAP benefits for prepared meals. Also, I know that given the recent lawsuit on the FEPS program, you may not be able to comment, but just wondering what OTADA's reasoning was behind not waiving the lawsuit requirements for families in New York City, but not for those outside of New York City. And also, given the rise of single adult homelessness across the state, does the state currently fund any rental assistance programs for single adults?
Okay, I'll go as quickly as I can. First off, you've chosen a wonderful senator to partner with. Secondly, when it comes to the hot meals portion of it, I can't give you an exact dollar value of what the cost would be associated with having hot meals or restaurants involved in the process. What I can tell you is there's been an aggressive effort. In fact, New York State was the first in the pilot program for USDA to be able to do online SNAP benefits. We're excited about what that can mean. It means a lot, obviously, to people who are shut-ins, seniors, people with disabilities, and we've seen an absolute explosion, as you can imagine, of this over the course of the last year when it's been operational. It's a pilot program. There are a limited number of participants. USDA, and we are working with USDA because they are the ones that determine whether a retailer can be part of that process, and we're looking to grow it aggressively because we see real value in it. But I will say that that's the avenue that we have at this point. USDA has not approved a restaurant process going forward at this point. So there would be efforts to be able to get USDA to engage in the process.
And my other questions?
I'm sorry, which other ones we were talking about? If I missed one, I apologize.
I had a question on FEPS, on OTADA's position for not waiving the lawsuit requirement for New York City families as opposed to out of New York City families. And then do you have any rental assistance programs for single homeless adults?
Yes, there are rental assistance programs for senior homeless adults.
Single homeless adults.
Yep, single homeless adults. When it comes to the FEPS program you were talking about, again, this is a conversation that I would love to have at this point, but we are limited because of the litigation.
Understood. Thank you.
You're welcome.
Thank you. We'll go back to the Senate now.
Oh, thank you very much. Our next questioner is Rachel May, who gets 5 minutes as the aging chair.
Thank you, Senator Krueger, and hello, Commissioner. I just have one question. This is based on, one of my constituents brought this question to me. She has been on SNAP for a while, and when the supplemental SNAP benefits started to come in last spring, she discovered that she was able to do some really smart purchasing for her family. Like she was able to buy a whole side of beef and keep it for months of good nutrition for her family. And she brought to me a question about how we can make it possible for people on SNAP to plan ahead or to have cooperative buying options or something like that, so that they can use those funds in a long-term way that's more efficient than just week-to-week budget planning.
I don't have a great answer for you at this point, because to be quite frank with you, it's something that we really should explore more about the opportunity to be able to utilize co-ops and additional purchasing power. And that really is driven by where SNAP dollars can be allocated. But I'll explore it.
Thank you. I hope you will, because she
Absolutely.
said all of a sudden her family had way better nutrition and her peace of mind was better. All kinds of things were better because she was able to plan ahead.
I will tell you, it also gives me an opportunity to talk briefly about really how the PEBT program launched as well. That was one of those programs that hundreds of employees of OTDA stepped forward, built a call center, delivered this PEBT program, working with the schools and making sure that we got where we needed to be, ultimately moving $1 billion in aid to 2.5 million kids in a very short window of time. It's one of those silent successes in this whole process.
Great. Thank you very much. That was my only question. I'll give
Sure.
my time back.
Thank you. Assembly.
Yes, we go now to Assemblywoman Lunsford. 3 minutes. Jen, are you there? Lunsford?
I am. Hello.
Okay.
We'll get in the unmute. So thank you, Commissioner. I just have a very quick question. Funding for childcare subsidies has always come in part from TAMF funding. And this year, the TAMF funds going directly to childcare in the budget is dropped by almost $200 million. Can you tell me if you know what are those funds going to? Has there been a surge in public assistance claims? We're just trying to figure out where that money is.
This is really a budgetary action, and I think it's important to highlight this one. While you will see a significant reduction in OTDA's budget when it comes to this, you will see a corresponding increase in OCFS's budget. So it was simply a shift from OTDA to OCFS.
Okay, that's all I have. I cede my time. Thank you.
Thank you.
Okay, we go to the Senate. You're muted, Senator Krueger.
So sorry. I was saying we're on a roll. Senator Bridgeport, 5 minutes. He's the chair of Children and Families. Thank you.
Thank you, Madam Chair. And hello, Commissioner. Don't believe we met yet, but hi. Good to meet you. I'm Senator Bridgeport. I represent a district in central Brooklyn, but I would like to use some time just to talk about something that happened upstate in Rochester. And I want to come back to the question of using FEMA funding to decrease density in congregate shelters. I read an article and I saw a story of the House of Mercy, homeless shelter in Rochester, where Sister Grace, who's the director, has been in the news previously asking for help to open up hotel space to decrease density in her shelter. That did not come, that did not happen. There was a COVID outbreak inside of the homeless shelter. They had to shut down the entire shelter temporarily. And, they've reopened since at limited capacity. But my question is, why hasn't the state done more to direct localities to use these FEMA funds to open up hotels? And what could we be doing more?
I think your question is perfect, although I don't know all the specifics of that particular case. What I will tell you is, by setting out very clear guidelines and working with shelter operators and working with local social service districts, we've been crystal clear about what our expectation is. We also do inspections in that process to make sure that people are living up to what they're supposed to be doing in this process. So again, many districts have chosen to use FEMA dollars specifically for this, for density reduction and for assistance to be able to address exactly what you're talking about. And I will say this, while we have all experienced these tragic losses as a result of COVID-19, and we've seen infection rates rise and fall and rise again, we would say that because of the actions that we have taken within the shelters and with local social service districts, even though we may have additional comorbidities or other issues associated, other risk factors associated with shelter residents, we have not seen a disproportionate number of people who have passed or people with or levels of infection rate across the entirety of the system.
Thank you so much, Commissioner. And just a quick question. A second one is just, I have a question about FHEPS or FEPS, I believe, but do you have a number how many families are on FEPS each year, specifically how many in New York City and outside of New York City?
I don't have the exact number at this point, but we know that there obviously is a significant amount. One of the, again, what I spoke of earlier is the ability to be able to have wonderful folks in the room with me, and they are telling me that the answer is 10,500 in New York City. Individuals on FEPS.
Well, thank you so much. Those are my questions, Commissioner. I really appreciate you taking the time. We'll yield the rest of my time. Thank you.
Pleasure to meet you.
Thank you. Assembly. Assembly? Anybody there? Okay, perhaps not. Let's see if I can.
Hi, this is Jessica Gonzalez Rojas. I think I was up next, but I'm waiting for the chairwoman.
There are lists up, so I'm just quickly trying to get to it. Yes, I think you are next. Thank you.
Thank you so much. Thank you, Commissioner. Very nice to meet you. Also a new assembly
You as well.
from Queens. My question is related to the administration's position on the Section 8 LIFE program, the Housing Access Voucher Program, which is Bill S2804 and 83701. It's a proposal by Senator Kavanaugh and Simbowitz that would create a statewide voucher program that covers 100% of fair market rent and help people receiving public assistance, Social Security income, and people who are undocumented. So can you share your position on the bill and your rationale for that position?
This is obviously a comprehensive question. The challenge that we have is because the fact that it is pending legislation, it's not something that an agency would typically comment on. We understand the importance of the discussion. We understand the issues at hand, but it's not because it's pending legislation, an agency doesn't traditionally take a position.
Okay, well, thank you.
Okay, are you ceding the rest of your time?
Yes, I'll see the rest.
So back to the Senate then.
Okay, thank you. I think I'm next up. Good afternoon.
Senator.
Nice to see you again. Following up on, two different paths that were started down. One about supportive housing. So I think we probably, this entire Hollywood Squares group could agree that we like supportive housing. We see it as a win. We hope that we're moving more quickly on it. With that in mind, the governor has referenced in his budget, in the language bills, the concept of supporting transferring perhaps commercial buildings into supportive housing buildings, at least in the city of New York. So here's my question. Would you agree that's only a good idea if there are some service dollars following those new units? Because if we suddenly add on additional supportive housing, which I very much want us to do, but from a different source with a different time frame, and conceivably with a completely different application process. If we don't have the services in place when we take those buildings over, what we hope to do falls apart. So are you prepared to commit that if the state goes down that road, you're going to have the service dollars to do what we need to do?
Obviously, ESHI funding is pivotal into being able to make a difference in so many of the supportive housing situations. What you're speaking of, though, again, I don't know of any that are scheduled to be online immediately. And again, it's more of an EDC conversation because I know that they're very actively involved in that process and in that
They
initiative.
will come up with supportive. They're not going to come up with service dollars year after year, Mike. Right? We know that.
I fully understand the importance of service dollars following the need for supportive housing. So again, we'll continue to move forward as that initiative evolves.
Okay, thank you. And then there was another, it was a follow-up question, and now I'm completely blanking. I will have to follow up with you separately because I don't remember.
I was going to say, if you reach out anytime and we'll touch base.
Very good. Thank you. I'm giving mine to the assembly.
We go to Assemblywoman Forrest. 3 minutes. Is Farah there?
Hello? Okay.
Hello, Assembly Member.
Yes. Thank you. Commissioner Hines, hello.
Hello.
Hi. Okay. So my question for you is that Biden issued an EO asking the Department of Ag to consider expanding and increasing SNAP benefits. The expansion would increase benefits for low-income students and those receiving the max SNAP benefit. Has the state received any guidance regarding this expansion, and will the state continue to apply for waivers allowing people not to recertify their SNAP benefits?
The answer to your question about the waivers is yes, we will continue to apply for those waivers. We think it's pivotal in the process. And I don't have an answer for you on the other piece, but I will get you an answer.
Okay. And then my second question is regarding the distribution under the rental, the money for the rental assistance. So one article had stated, I was reading this article, that landlords and tenants do concur that a landlord-based application system would be better as far as making sure that the 1.3 billion dollars, that was the number, actually gets to who it needs to get to, which is the landlords, right? Because the tenant is a middleman. If we can just minimize the fact that, you know, we minimize and help increase the chances that rent arrears can be addressed, and that to increase eligibility for people who are non-traditional workers or immigrant families, I think that the landlord application, the landlord being able to apply on behalf of their tenants would be a good idea. What is your take on this? Is this something that OTDA is considering?
Very much so. We agree that in setting up a program like this, that there will be dual entry points. So while there's a single application, we believe that it makes perfect sense to be able to have an opportunity for a tenant, because that would be the appropriate in certain conditions, for a tenant to be able to apply and then work with the landlord. There will also be scenarios where it makes a lot of sense for the landlord to apply and then work with the tenant and work from that perspective in the application. So we see both. So I think we share the desire to have both tenants and landlords involved in the application process.
For my last 10 seconds, do you have any strategies, straight out strategies to increase this application being available to landlords? What's your ideas on accessibility?
One of the goals, I think, is to be able to work with the community-based organizations, working with the obviously the local social service districts as well, and the local governments, all with an eye towards outreach. This is going to be a Herculean effort to make sure that we get outreach where it needs to be, that we get quality applications in, and that we're able to move dollars out quickly. So we absolutely believe that from the administrative dollars that are available to local governments in this process, they should be utilizing them absolutely towards quality outreach and extensive outreach, especially in underserved areas who have been disproportionately negatively impacted by COVID-19.
one last thing, sorry, Chair Weinstein, not to say, but
Now,
also,
as Assemblywoman, we have to move on, but you can send the question in writing.
reach out
Thank you.
directly.
We gave you a little extra time there. Senate, do you have,
We do. We have a second round for our chair, Roxanne Persaud.
Thank you, thank you, thank you. Commissioner, I just have to follow up. I have 4 questions actually, and I want to follow up on the child support discussion that you had just now. Is for the proposal, it's $7 million for a one-time windfall, and of that 7 million, 5 million is going to the federal government and 2.5 to, and about 2.5 to the state. And then after that, it's like about $1 million each year goes to the comptroller, and where the state is keeping a little over $300,000, and we're sending money to the feds. Could you explain all of that?
The dollars that we're talking about are significantly more than those dollars that you were discussing. The $7 million would flow directly to the comptroller's office, ultimately to be distributed. From that point, at any one time, there's a large amount of uncollected. We're talking about numbers that are in the area of $70 or $80 million, and they're at different parts of this process. So we would see a regular flow of dollars to the comptroller's office with for undistributed that would then have the ability to be able to be in the hands of individuals who it should be in.
And could you explain how much of the money that we're sending to comptroller is actually going to the federal government, and why is it that we're holding money that goes to the feds?
We don't think there's any dollars that flow to the federal government in this process.
Okay, can you just check that and send back to us, because that's what I'm being told. So
Absolutely.
thanks for that.
Sure.
Another thing on SNAP benefits, you've done a great job applying for waivers and all of that. Are you still going to apply for any more waivers just to make it easier for New Yorkers to receive SNAP benefits?
We anticipate that we will continue to provide waivers for individuals as much as we possibly can. Obviously, one of the goals in this entire process was making sure that we could limit the number of times an individual would have to go into a social service office. We wanted to make it as easy as possible for the individual facing obviously all the crises that were happening all around us. We also wanted to protect the workforce in local social service districts as well in that process. So we anticipate being able to fully examine that, continue to look at these waivers, and think about this from a public health perspective, first and foremost, and then obviously ease of use and streamlining of the process. I would also share with you that some of the waivers, again, the waivers have forced us to rethink how we do business in certain areas. And so I would expect that some of them will continue for a long period to come, if not permanently.
Well, I'm happy to hear you're thinking of some that are permanent, because I'm thinking of some that should be permanent. So I'm happy to hear. I will continue that conversation.
Sure.
So quickly on Code Blue, the funds are being reduced again. Is there a decrease in the need for shelter beds? Is the current demand being met? Because we're seeing this trend of decrease in housing and homelessness funding.
Obviously, during the Code Blue is subject to the same challenges that we have seen across the board, where you see a 5% reduction within the budget, obviously addressing the huge challenges that are happening, the $15 billion budget gap and the like. What I will say is the allocation that has been made to Code Blue is still sufficient to be able to meet the demands in which districts have come forward over the course of the past year.
Okay, so you're saying that there are districts that with homeless people sleeping on the streets that are not really coming forward? No. Okay,
no, I think that every district is coming forward. Absolutely.
And as you know, we've been pushing for that diaper bill legislation that we're looking to offer supplements, subsidies for diapers to needy families. And the governor has this initiative of distributing the 20 million diapers. What is your agency's role in that?
We don't really have a role in that process, though we understand the desire to be able to make a difference in the lives of young parents who are facing this demand, this added demand that comes with providing for a baby.
Okay, and I hope, that we can come together to get the DIAPA legislation that I have moving forward so that we can assist more families who are desperately in need. So again, Commissioner, it's great seeing you. Thank you for answering my questions, and we will follow up. Thank you.
You as well. Thank you.
Thank
Thank
you.
you.
Assembly?
Yes, we have Assemblywoman Matenis before we go to Assemblywoman Rosenthal. So 3 minutes.
Hi, thank you very much. Thank you for being here. I just wanted to, just hearing some of what was said earlier, I just want to mention that there is, my understanding, 10% set aside in the budget for outreach to be used to communicate with folks. But my question is around conversions of hotel and commercial property to permanent housing in New York. The governor had proposed a plan to convert distressed hotels and commercial space into permanent housing. How much money will be allocated for this proposal? How many units do you estimate could be created? And is the administration planning to use nonprofit developers to convert units into housing?
Again, I think you're asking very valuable questions when it comes to the conversion, but it's not something that's directly tied to OTDA. So I can't really answer those questions. What I can do is say the 10% set aside is actually not just for outreach, it's for all the administration of the program. This program is designed to be very lean, the $1.3 billion one. So the 10% set aside is for all the administration. That means the central portal, any IT associated with that. It means any of the call centers that would be there to be able to set up to make sure that someone who had technology challenges and couldn't apply online could still apply by phone or by mail. It's a whole host of those kinds of, as well as the distribution of funds as well. In addition to all of the outreach that we know is critically important. So there's a lot that falls under that category.
And getting back to just follow up on the question of Assembly Member Forrest Souffrant, there's many more, there's less landlords than they are tenants. They have management offices, so it's easier for them to actually apply. Wouldn't it be easier and faster to make sure that we're getting the money that's needed to our small mom and pop landlords by just targeting them? And this way they would be applying themselves and they would be getting the funds directly themselves. Wouldn't it be a better allocation to just focus on them to be able to apply than have tenants do it who may or may not know or may not be able to get the access, and it would just take longer, I believe.
We really don't view this as an either or. We want to make sure that this is a quilt in the process. And so we fully anticipate that there will be tenants that will want to apply in the process. They'll want to kind of run that whole entire process from start to finish and work with the landlord. We also understand that there are landlords who will want to be able to do this for their tenants. We'll work with organizations. I also think that the outreach that we talk about is absolutely focused on being able to help individuals in lower AMI and be able to assist them. But it's also to be able to help those small mom and pop landlords who may struggle to be able to figure out how to participate in the program. So it's not an either or. We think we can be able to do both.
Thank you.
Thank you. We now go to our Chair of Social Services, Linda Rosenthal, for her second 5 minutes on the clock. Thank you.
Thank you. Hi, Commissioner.
Hello.
Good to talk to you again. I just want to quickly follow up on the Rochester situation because, well, I went to school in Rochester, so I have a personal caring in my heart for them. But really, it seems like they were closed for a month because of the FEMA. They didn't have the FEMA dollars. Now they're back open, but at a reduced capacity. There's a document by the National Low Income Housing Coalition about how to work with FEMA for localities to work with FEMA. Can you look into that particular situation? Rochester is very poor, has a lot of homeless folks, and here's a place that would be open to them, but it seems like there are bureaucratic hurdles. Do you think your department can look into that?
Absolutely. Not only will I look into that from the specific case, I'll also take a look at how that interface is taking place with Monroe County.
Okay, thank you so much.
Sure.
So in New York State, we have 92,000 people who are homeless. It doesn't seem that there's enough rental assistance to help people escape homelessness. So in particular, single adults, can you expand on what is available for them to transition out of shelter or off the street to affordable units or supportive units?
Sure. The dollars that are available, again, present significant challenges, no question about it, but they're through public assistance and through a shelter portion of that as well.
Yeah, I think you said to Senator Kavanaugh there would be 1,200 more units coming online. Who would those be for?
Well, if the units are funded through HHAP, you're talking about folks who are homeless, currently homeless or facing homelessness imminently.
Right, but
so again, and it runs the entire gamut. I apologize. It runs the gamut. There are some dedicated to folks who are homeless veterans, some for individuals, some for seniors, some for families. So there is the broad cross section available in HHAP housing.
You know, in my district, there are 3 hotels with homeless single people in them, mostly men. What is the priority level when you talk about all the eligible populations?
Well, we work with the local social service districts in identifying the individuals to be able to be placed in upcoming housing. Because a lot of times it's also focused on making sure that we've identified the appropriate supports in place as well.
Right. It's really a horrific situation for the people who are homeless. So I hope we can work together to speed up the construction of, as I've said, and some of my colleagues as well, for supportive housing. While others were asking questions, I looked up a Coalition for the Homeless report that showed that the cumulative New York City mortality rate due to COVID was 231 deaths per 100,000. But for sheltered homeless New Yorkers, it was 406 deaths per 100,000 people. So, you know, really, how do we move forward? How do we move forward to turn the tide on homelessness if there are not enough tools in government? What does the administration have a target goal? And I know it's no one should be homeless. That's what we all agree on. But because there's such an overwhelming number, does the administration, you know, have like set benchmarks through the years to reduce the number?
I think what we're finding here is the net effect of significant challenges from an economic perspective for so many individuals, as well as substance use disorder and other challenges, mental health challenges, all coming together in a situation where the cost of housing is expensive, especially in the New York City area. To your point, we are very focused on building affordable housing as quickly as possible with the resources that are available. We understand the importance of this, and that's really a fundamental solution in this process, is making sure in the supply and demand issue that there are actually enough units available to be able to assist people.
Well, there aren't. So what a lot of my colleagues and I think is we need to raise revenue, and a lot of revenue, and we can do that if we tax those who have the means, so that we can stop this. I mean, it's humiliating that one of the richest states in the country has so many people without a home, and I think we in the legislature will look to raise revenue so that we can realize that goal of eliminating homelessness. Thank you for your testimony today.
Thank you.
I think the Senate, I believe you have, we have a few more members now who wish to speak. I believe you have.
We have
Senator
Senator Diane Savino.
Thank you, Senator Krueger. Commissioner, I was away at another meeting and I got back in time. I want to ask you specifically about COVID protection within, especially within HRA and in the income maintenance centers, or whatever we call them these days, the job centers. Many of the workers, particularly the members of the Social Service Employees Union, Local 371, as you know, I have a fondness in my heart for them. They've had some difficulties with HRA because there's been no requirement for clients who are showing up to comply with mask requirements and/or screening. When they've had discussions with HRA and with the city says that they cannot require clients to do that because your agency, particularly OTDA, will not enforce that mask requirement or screening requirement. So I'm asking you, what are you doing? You can't go into a restaurant in New York City without a mask. You can't ride the subway without facing mask requirements. There's a whole host of reasons. The president himself on day one signed a mask, executive order. So what can we do to require clients who are seeking services in the job centers to be compliant with mask and/or screening requirements so that we can reduce, opportunistic infections among people who are seeking services and protect the workforce?
Your point is well taken, but I want to make sure that we're clear about something. There is no question that they have the ability to be able to enforce a mask mandate in that situation.
They say they can't.
Okay?
They say you won't allow them to.
Well, I think that we can clarify that very quickly. So there is no question that they have the ability to enforce a mask mandate. What they do not have the ability to do is deny services. So to be able to identify new pathways to serve individuals and use alternative means, that's fine. But there's no question that they can enforce a mask mandate.
So in the interest of time, perhaps offline, we can have this discussion.
Absolutely.
And we can help HRA develop that offline way to provide the services. But what their response has been is, if someone comes into the center, refuses to comply, they require their staff to provide the services, whether they have a mask or not, whether they will submit themselves to a temperature test. They don't care. They say they can't do anything, that OTDA will not allow them to refuse services under any circumstance. So I think this is a further conversation because this has been going on for months now. And quite honestly, it's just unacceptable. So I look forward to that discussion with you offline. Thank you.
Yeah, Senator.
All right, good seeing you again.
You as well.
We go to our Chair of Veterans Affairs, Dee Dee Barrett, for 5 minutes if needed.
I'll try to talk fast. Thank you, Commissioner. Nice to see you.
You as well.
The Hudson Valley rocks, right?
No question about it.
I just wanted to, I also have been in and out a little bit, so I don't apologize if I'm asking something you've already talked about, but I chair the committee, as you heard, of Veterans Affairs, and want to talk about the homeless veterans money and how that has been working out. Has it been spent? Is there a progress? Is there a program? I know many of those are single moms, the homeless veterans. Do we have outreach that we've been able to do to them? So I got a few questions, but if you could just sort of start with that and
Sure.
And then we can kind of go from there, please.
5 million of the dollars that were allocated specifically to veterans, that $5 million was allocated through HHAP. It was awarded to be able to build housing for veterans specifically within the process. So the answer is there's $5 million that has been awarded.
And are there programs to spend it? Is there a plan to use that? And if so, what is it?
Since it has been allocated to different programs, to specific projects, those projects are now entering one of the phases on its way to completion.
So are they going to existing veteran service organizations or existing housing, or are they going to municipalities? How is that money being allocated?
I'll find out exactly who the allocations went to, and I'll give you the list.
Okay, that would be
Sure.
helpful. I know in Columbia County, we have an extraordinary head of the veterans program here who is committed to not a single veteran ever spending a night homeless, and he's done a great job. I mean, we are a small county, but he's done an amazing job. And one of the programs that he had said he is a big fan of is right over the border in Pittsfield, and I'm wondering if that's something that have looked at, or have you worked, do you work with the Division of Veterans Affairs? There's so many silos here. I'm never quite sure how, we get to where we want to be with this kind of money.
Sure, we definitely do work with others. I'm not familiar with the Pittsfield model. As you know, this is an area that's near and dear to my heart. When I was a former county executive, we built transitional housing for homeless veterans and ended homelessness among the veterans population in my county. So it's something that's near and dear to my heart. I will look into the Pittsfield model to see if there's something there. Again, we don't care where the lessons are learned. We want to make sure that people are served, and if it means we can help more homeless veterans, we want to be able to do that.
Okay, well, thank you. I would look forward to working with you on that, and would love if you could loop back offline and
Sure.
share what you're learning with us. I will see the rest of my time. Thank you.
Thank you. And I believe our last Assembly member on, actually the last questioner, Assemblyman Mamdani for 3 minutes.
Thank you so much, Chairwoman Halim. Sure. Hello, Commissioner. It's nice to meet you.
Hello, how are you doing? Nice to meet you as well.
My name is Zohran Khalil Mamdani. I'm an Assembly member from Astoria in Northwest Queens. So I'm going to follow up a little bit on the line of questioning from my colleagues, Farah Soufran Forrest, Marcella Matenis. And so what I wanted to speak about is rent, tenants, and small landlords, and ask you a question along those lines. So according to national census data, tenants across our state owe about $2.2 billion in back rent. And this is also a racial justice issue, as 48% of Latinx renters and 40% of Black renters owe rent versus a smaller portion of just 20% of white renters. The state does not have enough money in the budget to meet this need. Furthermore, tenants and landlords who are not eligible for federal rent aid could be helped with state investment, however. And so I wanted to ask you a yes or no question, given that I have just 3 minutes, so I'll try and frame it very quickly, which is, will you advocate that additional money from the state, at least $2.2 billion, is included in the state budget for a small landlord hardship fund in order to clear New Yorkers' back rent?
I want to be really clear about this. The $1.3 billion, as you said, we do not see that it's likely to be complete in its being able to address the entirety of this issue. That said, there is looming federal legislation that we hope will pass as soon as possible that will provide additional money into this pool of $1.3 billion that can be very meaningful in being able to address the totality of the problem in the state of New York. So that's something that, again, we are optimistic on.
So would you advocate, I understand that there's the possibility of federal assistance, but given that the state can also take action, and my colleague Linda Rosenthal spoke about the potential for raising revenue here in New York State, something I fundamentally support, would you support the increase of that amount to $2.2 billion from state-fueled financial support?
Thank you, Senator Member. And I appreciate the question, but it really is fundamentally a question about supporting or not supporting pending legislation or potential legislation. And so it's really not a position that as a commissioner of an agency that I would take.
Okay. Well, thank you very much. I appreciate the answer. I will cede my 41 seconds. Maybe, I don't know if Jabari needs that time.
38 seconds. Thank you, Zoran. Thank you, Commissioner. I believe that we have no more questions for you. So we thank you for participating and look forward to having continued discussions about the rental assistance program, which is very near and dear to so many of us.
Thank you so much. Be well.
So now we move on to New York State Office for the Aging, Greg Olson, Acting Director.
Thank you, Chairman Weinstein. Can you hear me okay?
Yes, we're all set. Go ahead.
Okay, outstanding. Well, it's great to be with all of you. I always look forward to spending this time, and I hope all of your families are healthy and well. So again, good afternoon. My name is Greg Olson. I'm the Acting Director of the New York State Office for Aging. Chairpersons Kruger, Weinstein, May, and Kim, and all the distinguished members of the Senate Assembly's Standing Committee. Again, I'm happy to be here. Congratulations to Assemblyman Kim for being the new chair of the Assembly Standing Committee on Aging. I'm honored really to testify on the portions of Governor Cuomo's proposed budget that affect older New Yorkers, as well as to share the incredible work that the network of aging service providers do as they respond to the pandemic. Governor Cuomo and his administration's commitment to older New Yorkers is unprecedented, and New York is viewed as the trailblazer nationally for the work that we're doing to support older adults and their families generally and through the pandemic. Our approach is so much broader than one agency. It is about making New York the healthiest state in the nation through a multi-agency coordinated effort focused on improving physical and behavioral health, implementing preventive health strategies, embedding healthy aging and livability principles into general government operations, implementing age-friendly communities and age-friendly health systems, expanding access to services and training for older LGBTQ individuals, supporting informal caregivers and working caregivers, and much, much more. Utilizing the state's 2019 to 24 prevention agenda as the umbrella and instituting a health across all policies approach, all New York State agencies are incorporating health considerations into our planning, programs, and initiatives. We have been charged and are expected to work together to consider how all our policies further our efforts as the first age-friendly state. This approach is having a significant positive impact on New York's older population. Under the governor's leadership, New York State became the first age-friendly state in the nation in 2018 to receive that award by AARP and the World Health Organization because we rank high in the 8 domains of age-friendly, livable communities, and because we are implementing a comprehensive plan to systematically build age-friendly and smart growth principles into government operations and functions. We are truly leading the nation in our collaborative and thoughtful approach. The FY22 executive budget continues its ongoing commitment to older New Yorkers. It includes continuing the historic $15 million investment contained in the past 2 years enacted budget for older New Yorkers across the state who are awaiting services. It continues the $2.3 million increase to community services for the elderly that was contained in last year's enacted budget. It continues support for the New York Connect systems reforms by providing $27.2 million for statewide operations of these reforms to more easily access long-term care services and supports. It continues the $4 million increase to NORCs and neighborhood NORC programs that was contained in last year's enacted budget. It maintains the $500,000 match that's used to draw down $2 million in federal funds to combat elder abuse and financial exploitation. And it maintains all core funding at last year's level. On the pandemic front, NYSOFA received more than $73 million directly in stimulus funding that we distributed to all counties to support the delivery of services that would meet a variety of needs during the pandemic. In addition to the more than 20 core services that the network provides on a daily basis throughout New York State, the key areas of focus for the network during the pandemic included home delivered meals, shopping and supply delivery, prescription drug delivery, critical transportation to dialysis and cancer treatments, for example, combating social isolation, and elder abuse mitigation and scam prevention. Under the governor's direction, executive orders that were issued provided NYSOFA with the flexibility to offer maximum flexibility to the counties and the community-based providers to make available services in the most flexible way possible so that bureaucracy and rules that don't make sense when you're responding to a pandemic were not barriers to service. The governor included our direct care staff as essential workers to be able to deliver basic needs services. We secured and distributed more than 1.8 million masks, delivered them to older adults 75 and older and their families, those at risk at getting COVID and spreading it. We delivered more than 3,200 cases of hand sanitizer to older adults in their homes and their caregivers and to direct service providers. On a national level, our advocacy efforts insisted in securing almost $1 billion in stimulus funds to support older adults, ensuring a $50 million carve out in HUD stimulus funding to support services in HUD buildings for older adults, and getting counties emergency meals by utilizing our procurement process. Other highlights include working with businesses such as Cisco to deliver millions of meals to older adults, working with Enterprise Rent-A-Car to offer low-cost or no-cost rentals for transportation and food delivery, and Pure Happiness Farms out of Cayuga County to deliver more than 2,000 cases of their nutritious coffee drink to older adults across the state. COVID-19 also strengthened existing partnership with state agencies, working even more closely to meet needs, such as agriculture and markets to access food, the Department of Labor to connect working caregivers to local supports, the Department of Health in all things COVID-related, and the Office of Mental Health in combating social isolation and addressing COVID-related issues such as anxiety and depression. NYSOFA also developed and implemented many pilots and projects to assist older adults during the pandemic. These initiatives led the nation in combating social isolation, which includes our award-winning animatronic pet project. Partnerships with several tech platforms are bringing virtual programming to homes, including the Virtual Senior Center and other platforms to maintain health and wellness and connectivity. NYSOFA has been working with GoGo Grandparent out of California to increase transportation options and economic opportunities for older adults. NYSOFA is launching a multi-county pilot that includes an evidence-based intervention that uses complex analytics to identify caregiver burnout, which is a leading cause of placing an older adult in a higher level of care. NYSOFA has partnered with the New York State Council on the Arts to bring arts programming into the homes of older adults. A project has also been launched in partnership with the Developmental Disabilities Planning Council to better equip and train the Aging Network to work with older adults caring for younger individuals with intellectual and developmental disabilities. NYSOFA is working with the Division of Homeland Security and Emergency Services to bring FEMA resources to the state to continue to meet the nutritional needs of older adults. We have added to our comprehensive assessment tool a screen for social isolation and to a screen for technology capacity and ability. We have partnered with the Department of Health and Haney's to better integrate clinical and community-based care to improve outcomes for older adults under the age-friendly health system priority. Changes to our business model have been made that allow the Aging Network to provide services differently in order to slow the spread of the virus while meeting the needs of older adults, and will continue to be nimble as a network and advance enhancements to improve services to meet expanding demand. The 22 executive budget proposal will continue to help hundreds of thousands of older New Yorkers maintain their independence, support the loved ones who care for them, reduce future Medicaid costs, and further demonstrate why New York is the first age-friendly state in the nation. We will continue to engage state agencies, as we always do, private partners, not-for-profits, and other community-based organizations to serve New York's older population as effectively as possible. And before I conclude, I just want to publicly thank all of the staff at the State Office for the Aging for the amazing work they have done, are doing, and will continue to do, and the network of 59 area agencies on aging, their 1,200 community-based organizations, and the Association on Aging in New York that represents them, because I couldn't be more proud to be a part of this network and the response to try to meet the unique and diverse needs of older adults in the state.
Thank you, Greg. We're going to go to Assemblyman Ron Kim, our new chair of the Aging Committee. 10 minutes on the clock. You're on.
Thank you, Chairwoman Weinstein, Chairman Krueger, and our Dr. Rachel May on the Senate side for your partnership and all your expertise in this space. And let me begin by also thanking the former chair, Harry Bronson, for his tremendous work. Greg, Director Olson, it's good to see you again, and thank you for your testimony today. So let's start off with the hot button stuff that's everyone is talking and thinking about, the nursing homes. I'm sorry. Can you stop? Sorry, can you stop? Olive, stop, please. Okay, you could go. Thank you. Sorry. I'm co-teaching first grade. Sorry. Yeah, so nursing homes. You know, Director Olson, as you know better than most, the best way to keep our older adults healthy is to provide them care and support at their homes and in their communities. The economic, physical, and mental health outcomes and investing programs that you oversee at the State Office for the Aging, like home food delivery programs, social daycares, are far better in terms of leading to positive outcomes than sending our elderly into long-term facilities. And obviously there are clear overlapping services between the State Office for Aging and other state agencies like OTDA and the Department of Health. So my first set of questions are, like, how integrated are the systems between the agencies that serve the same older adults who might be just in that space contemplating where they should go to home, they need more home care, or they should be going to nursing home care? Like, in other words, Director Olson, do you share the same data set across agencies to help make better and informed decisions serving, advising, and directing older adults?
Yeah, I think that's a great question. There's a lot to unpack there. So, in New York State and other states, but I'll obviously only speak to New York, we have a continuum where, you can get a variety of very light types of supports, where it could be information and assistance at the front end, all the way to skilled care at the back end. And I think one of the great things about, New York and the network that we oversee in our partnerships with folks like the health department and others, is to try to provide that information and the supports that you can provide earlier in the community, so that you are maintaining independence or even improving, so that you don't decline to a point where you might need to go to assisted living or an adult home or a nursing home. Those decisions are difficult. They're family decisions, and there's a variety of factors that would lead one, for example, to be frail and cared for in the community, of which we care for, over 75,000 people that have multiple functional limitations, 4 or more chronic conditions, or low income, with our support services versus somebody who may not be able to maintain themselves. So one of the things I think that our network does extremely well is we are organized to be community-based, to leverage other organizations, including local governments across the spectrum. We really believe in person-centered care, asking people what matters, assessing strengths, not just weaknesses, but what can you do, what might you need, how early can we provide it, so that we can delay not only nursing home placement and Medicaid spend down, but you want to try to assist in people reducing their ER visits and hospitalizations, making sure they're going to their doctors regularly and the dentist regularly. And we assess for all of those types of things so that we can intervene earlier and help people maintain their independence.
Thank you, Director. I'm going to transition over to talking about ageism, and this is something that you have brought up and have been focusing on as director to counter the rise of ageism in our state and our country. As you know, the term was coined back in the 1960s, but unlike sexism or racism, there haven't been any institutional effort to confront it in our schools, media, or pop culture. And in fact, we actually went the other way and commercialized ageism by profiting off youth-centric commercials and brands, while our society de-glorifies and even puts down people getting old. And I feel like during this pandemic, we've all been kind of blindsided by ageism. And I believe our cutthroat, the winner-take-all economy treats midlife Asian communities the worst. You're either a glorified, wealthy, or powerful older figure, when if you're poor, and if you're a poor older adult, you're a burden to society, and often referred to as demented or unproductive, and all the other nasty words that are attached to the older population. We know that during recessions, ageism takes center place in causing the most number of suicides among midlife men who have to deal with these sentiments, and they have to wake up one day feeling like they're better off to their families and communities if they're no longer around. But honestly, Mr. Olson, I feel like we sleptwalked into a post-ageist society without recognizing how terrible we view and treat the Asian communities and older adults. So I believe one immediate way to reverse this cultural apathy toward the aging is to give voice to older adults who have been mistreated and ignored. And what better way to honor their lives than to set up some sort of a compensation memorial fund for all those who passed from COVID at long-term facilities and other sites. Would you be willing, Mr. Olson, to work with us in exploring these ideas to combat ageism, and just, if you mind, just sharing a couple of things that you've been doing as an agency to combat ageism as well?
No, and I really appreciate the question, because I think you are absolutely onto something. And this is this is one of the things that we've lived with hundreds of years. We're a young focused, anti-ageist society. People don't want to grow old. We don't talk about death and dying, which is as normal as being born, and people don't plan for it. And part of that is because of the, painting with a broad brush of an older population that they're takers, they don't have anything to contribute. And that just simply isn't the case. So, to your question, what have we been doing? I mean, we've been spending the last decade aggregating data to show that is far from the case. So, I don't want to be over statistically heavy here, but I think it's really important. And what you are talking about is extremely important. We know that 83% of all the wealth in the nation is held by people over the age of 50. They support 90 million jobs, 42% of federal, state, and local tax revenue. They are the #1 givers to philanthropy. They're the #1 volunteer bloc. They're the #1 entrepreneur group. And, if you're going around in the Catskills or the Adirondacks, or you're, shopping somewhere, those are the folks who you'll see every day. We have 1 million volunteers over the age of 55 in New York State that contribute 500 million hours a year at an economic value of $13.8 billion. And they represent across the board pretty much 65% of all the household generated. So the point just being is to the point that you're making, for organizations that, that I work with, but across the spectrum, whether you're working at the Boys and Girls Club, or you're mentoring young kids, or you're delivering home delivered meals, or you're helping with reading, older adults are the ones who are the primary volunteers. And so creating the value of what they really are is important. Now, that doesn't mean that there isn't a block of folks that need a variety of assistance, and that's what we do. And that's what we do collectively. That's what we should do, and that's what we should focus in our attention on. But to your point, to say that they are not valued, I just think is wrong, and the data doesn't bear that out at all.
Just a couple of quick questions before we wrap up. Mr. Olson, do you know the approximate full cost of a full-time resident in a nursing home?
I think the state average is about 137,000. So it's different by region.
Okay. I thought the national average was around 80 to 90,000, but the state average is around 130,000. Okay. Do you know the approximate cost of an elderly receiving care and support at home? Meals and Wheels and other programs that you oversee?
Yeah, so our typical client is, an 83-year-old female, low income, 4 or more chronic conditions, fairly high, daily needs, bathing, dressing, shopping, things of that nature. We do not require to start our services, hence the continuum I talked about. We're able to intervene a little bit earlier and don't require a residence or a physician's note to turn on services. But we can typically keep somebody at home for about $7,000 a year.
Right. Thank you so much. I'll come back for a second round later. Thank you, Mr. Olson.
Thank you. Oops. Thank you very much. Our next is Chair Rachel May.
Yes, thank you, Chair Krueger, and hi, Greg.
Hi, Senator. How are you?
I'm great, thanks. I wanted to follow up on a couple of things that you talked about. I want you to know that I really appreciate the work that you do to try to cost out what it costs to do this upfront work that Chairman Kim was talking about, as opposed to paying the big expenses after the fact of people having to go into nursing homes because the care isn't available for them to stay in their homes. So 2 years ago, the budget included $15 million for getting people off of the ISIP waiting list, and estimated, I think, if I recall right, that saved about $40 million in the budget by keeping some portion of those people out of nursing homes. Have you done that same comparison this year? I know the 15 million is there again. Is there a paired savings for that?
So it's a great question. And again, there's a differentiation between a nursing home client and ours. I think people, if they're absent the services that we're providing, wind up getting to they get worse because they're not receiving services. And so, what you get in a nursing home is skilled care required by a doctor. And we're able to provide non-clinical supports just prior to, having unfortunately to make those tough decisions. But to your point, we're just about the end of our second year where, what my goal was to do an analysis on where we landed after the 2 years for a couple of reasons. First, to see, if there is any unmet need to the counties that were receiving dollars. We had a couple that didn't report them, as you'll remember back when those dollars were first in our executive budget, to see if the folks who receive the services are still on the caseloads. That would help get to some of that outcomes data. But as you know, it's a point in time, and it's a moving target, because some of the folks that I just mentioned, I mean, when you're 83 and you have these very high needs, it's not uncommon for people to die receiving services. And, I got to be honest, to me, that is a successful outcome. That's how I want to die, at my home, surrounded by my family, hopefully managing my pain with the types of services that we provide. But we are going to do an analysis after the 2 years of full implementation so that we can see, if you turned on a particular service for Mr. Smith in August of 2019, is he still on the program? We are able to determine how long people stay on our programs. And outside of short term, about 25% of them stay on a program just because they have an immediate need for maybe, home delivered meal or what have you. But many are able to remain on the program between 3 and 6 years, depending on, what their conditions are. So that's an analysis we absolutely will do, because those outcomes are critical to understand.
Okay, great. Yeah, thanks. So the advocates are saying that 15 million isn't going to come close to getting people off the waiting list this year. Do you has the waiting list gotten longer? And what do you think is an appropriate amount to get them off?
Yes, yeah, I don't know the exact amount. I've seen what's been reported by the counties to the association. It's complicated in that there, of course, has been additional need. I think, the two previous commissioners, had talked about the same type of thing. I mean, we're in the middle of a pandemic. It has very heavily impacted our population. We had the strongest stay-at-home guidance that Governor Cuomo put forth in Matilda's law. So we did see a really large increase, particularly in meals and in the beginning with supply delivery, transportation, things of that nature. But we've also received a direct infusion of cash into the agency from the stimulus that went out to the counties to address those. We're expecting another $9.3 million in the coming weeks. We were notified of that from the stimulus that just passed. And then, of course, the president's new stimulus plan will bring hundreds of millions of more dollars in. So, that's something that we are looking to. The lists that I saw were as of October 2020, and that was like 3 months ago. So those are always a moving target. There's absolutely some need out there. And again, Senator, you know how this network works. Not having access to a particular service does not mean that there aren't other things that we can do, like connecting to veterans, because we assess for veteran status. Trying to get additional SNAP benefits or HEAP benefits, or putting other types of community programs around folks if you're not able to access an aid, for example. So it's never the end of this story. We just, try to do the best we can with what we have. And one of the things, again, not to take all your time, but one of the things that's really important at this time is the Older Americans Act modernization program that I'm putting forth and have some interest with our U.S. senators. And the reason being is no different than what the governor has talked about giving New York State being the biggest giver to the federal government and the least amount coming back. That's how we are. We get of our total budgets, federal, state, and local, 15% of what we do as a job comes from the federal government. And what that means is the governor, all of you in this body, and the counties every single year increase resources to try to meet these needs. It is long past time that we not only fix the antiquated nature of the Older Americans Act, but get the investments that we are due with the population growing and all the new things that have been added to our portfolio in the last 20 years.
Okay, great. All right, I'm going to try to be quick with my remaining questions. One of them is also about the workforce. So I've been hearing that there just aren't enough people to provide the care in the home that people want. And I know you're familiar, I'm sure you saw the CUNY report that came out yesterday that said if we invest up front $4 billion in paying people more to do home care, the return on that investment would be almost twice that amount. But it's not clear to me how much of that would be internalized to the state budget and how much of that is more just general benefit to society. So is that something you're looking into to see if we can actually make a good case in the state budget for paying home care workers more?
Well, I would be interested in reading that report. I didn't see it this morning, but you know, there has been an impact on the home care and personal care industry through COVID. You know, we had a lot of clients who, you know, had other sources to help them. They were worried about people bringing COVID into their homes, but we've also saw a reduction in the number of personal care aides and home care workers through this pandemic as well, not to mention through our network. You know, as you know, many of the folks that provide services or help deliver and make meals and do a lot of other things were older themselves. So that is the workforce is definitely a challenge, not only within the personal care environment, but also within the overall infrastructure. And again, that is part of the Older Americans Act modernization plan that I'm pushing to really professionalize. I mean, it's already a very professional network, but I don't know how you know, we're in 2020 and we're living in a 1965 structure that expects us to rely exclusively on volunteers who do amazing jobs, but have changed over the last 20 years. That just seems really backwards to me. But I'll take.
Okay, I'm going to interrupt you because I have a couple other questions.
So sorry.
You mentioned in your statement about caregiver burnout as a real problem and something that drives people into nursing homes because their family can't keep taking care of them. And yet the budget includes a reduction in respite care funding, which would help people who are giving care to get, you know, time off or hire, you know, other people to do the work. Why would there be that reduction in respite care funding in the budget?
There's no reduction in respite care in our budget. I'm not sure what that you're necessarily referring to. You know, we have over 76,000 caregiving and respite providers in New York State that you can access. Anybody in the state can access in our New York Connects database. One of the most important projects we are launching is our partnership with the Department of Labor, because what caregivers don't usually do is self-identify. We have many people who are working caregivers, and working with businesses and their HR departments to help self-identify and to link folks with those resources is absolutely critical. We're also piloting a project out of Washington called T-Care, which does exactly that, as you referenced earlier in my testimony. Use expanded analytics to really prevent the type of burnout, which then leads to you know, people just saying, I just can't do this anymore. So you know, we are not reducing any of our respite and caregiver programs. We have unlimited flexibility under the federal disaster declaration and our state executive order to allow our dollars to be used to provide services that are needed locally based on local decisions.
Okay, great. Thanks. I'll have another question.
Sure, Senator.
I appreciate it.
Thank you. Assembly.
We go to Assemblyman Jones, 3 minutes.
Hello.
Hey, Assemblyman, how are you?
Hey, how you doing, Mr. Olson? How you been? Good to see you again.
Yourself? Yeah,
good,
you as well.
Good. First of all, I have to, you know, thank you for everything you do, and can't wait to see you back in the North Country soon when things get normalized here. But there are a couple of questions that I have, but I will put a plug in first. We're talking about our most vulnerable populations and our seniors, and you know, isolation, or the social isolation that they're you know, that they're incurring now, especially during this pandemic. We know that these times have been tough on everyone, but more so on our senior populations and our people that have been in their homes for many months now. So I will say technology getting technology to our seniors, having them able to use that technology. I'm going to put in a plug for a program that's worked very well in my district, Older Adult Technologies, OATS. It's been great. I'd like to see the governor just put that in the budget, and I'd like to see that go statewide as well, because it has been used so appropriately. There's no better program that I've been able to be a part of in my district that has worked well. So when we're talking about social isolation, let's look into that. You talked about new money, and I want you to answer at the end because I have only a minute and a half left. You said 9.3 million or 9.3 billion coming back to.
Boy, I wish it was billion, but it's
million. Okay. And could you tell me, because I'm a county person, you know me from my county days, I think we utilize our Office of the Aging, our local Office of the Aging so well. It's just that the county puts up so much money into that. Could you give me a breakdown of federal, state, and local funds that go to our counties?
Yeah, so thank you, Assemblyman, and I look forward to coming back up in your neck of the woods as well. So first on the isolation, and then I'll answer your question. I absolutely agree with you. We have to be very careful that, for those individuals that have technological capacity, that have access to broadband, that we can teach how to use it. Technology is going to be a really important solution to help stay connected. But we have to remember there's a lot of people, and I know you know this in your area and in a lot of areas around the state, that don't have access to that or won't be able to use it. And so old school ways to combat social isolation still need to be embedded. You probably saw yesterday, OATS announced a partnership with AARP, so I am hoping that that's expanded. And we have a variety of other platforms that we're rolling out. But on your question, this goes right into what I was saying before. So, we receive 15% of our funding from the feds. The way that it works, as you know, is the federal funds, our state funds, and our local funds all kind of work together to provide consistent services. It's not one or the other. They make up the whole. So we get about, $77 million from the federal government. The governor, the legislature, year in and year out, invest about $160 million in the agency, and then the counties put in $275 million through local match and overmatch. And the overmatch is, I think, where we're struggling right now because of the state and local budget problems that hopefully the next stimulus bill will address, so that those services that are needed are not reduced.
Okay, thank you.
Thank you.
Thank you. Sue Serino, Ranker on Aging. Are you there, Sue?
Yep. Hi, Chairwoman, sorry. I'm here. Thank you very much. And thank you, Greg, for being here. Greatly
Sure, Senator,
appreciate
good to see you.
So as I said, we are really thrilled about the 15 million for the CSC that was included in the executive's proposal. But given the additional challenges brought on by the pandemic, do you still think that the 15 million commitment will be enough going forward to meet the demand for these critically important services, or do we need to see an increase?
Yeah, so the 15 million was based on, again, the folks that we brought onto the caseload a couple of years ago. Again, those ebb and flow. So as folks come off for whatever reason, there's a variety of reasons, there'll be dollars there. We have, as I mentioned, a fairly substantial amount of stimulus money that comes with great flexibility. So, a lot of that has helped to address the increased demand. We have another 9.3 million coming, and then depending on what happens with the federal, the next round, the 1.9 trillion proposal that President Biden put out, that will be helpful as well. I think what we're trying to assess now is exactly where we are, because these, as you know from your time, working with us, they are always point in time. But we have had a demand. It's been sharp. We've had to utilize other state agencies and county departments, and our AAAs have just been amazing in terms of leveraging those. So I think what will wind up happening is this is the start of the process. You guys will all be involved in your normal budget making process. I think what we're trying to do is get a handle on where we are as of February 2021, as opposed to the numbers that we received in the fall. But yeah, demand is increasing, and we're doing the best that we can, both as a state, county agencies, and our subcontractors, to assist. I'm also, as I mentioned, working with DISHES and DOB to bring FEMA support to the upstate counties, to bridge the gap if stimulus funding runs out, that we'll continue to be able to provide nutrition services to the 65 plus. So I think there's a lot of opportunities that are still unknown yet.
And I kind of figured with the increase in the cases too. And last year I thought that I asked you if you thought that we had enough ombudsmen operating in the state, and whether you thought we needed to do more to incentivize volunteers in this program. And I also asked if your agency would need additional funding to do so. So in light of the pandemic, what would be your assessment of this program today? And should we be making greater investment to bolster the program?
Yeah, so I think that, there's been some additional stimulus dollars that have come in to support the ombudsman. Again, as I mentioned earlier, some of the volunteers, we've had a decrease in volunteers. That's not unique to LitCop. That's across the board because, as you know, Senator, in your work with aging, many of our programs and services rely on volunteers, and many of them are in the at-risk category. Again, I don't mean to keep beating the Older Americans Act modernization proposal to death, but these are the types of things that really need to be addressed at the federal level. We can't be relying on volunteers to be a core part of our workforce. We need a workforce investment. The volunteers, Claudette, her team, have done an amazing job. So we are working with the health department and others on a 5-point plan. Number one, there was $1 million that went out to increase technology so that there could be more virtual visits for nursing home residents. Publicizing the long-term care ombudsman program, that we're still operational, even though the model had changed. Utilizing additional resources for involuntary discharges to help with the appeals process. And then the two final things I think are directly to your question. We need to expand significantly the volunteer recruitment, and I think we are working towards that, and hopefully bringing in a younger cadre. This isn't something that college kids couldn't do, that we couldn't think about doing with social work students and others, and developing a reimagined work group with health department and AARP and other stakeholders on the changes that we really need to make this program successful, because we only get $1 million in general support from the federal government, with the expectation we have to run a statewide program that covers 160,000 nursing home beds.
Oh, thank you so much for that information, Greg. And I just have one last thing. Do you think that New York Connects could play a role with the vaccine rollout, since it's been, so difficult for the seniors?
Yeah, so it already is. And this is again, so proud of the network. I mean, I learned a couple of days ago, Schenectady County has 10,000 people on their list. The counties are part of the local county government structure. So the offices for the aging are involved. They're part of their EOCs. They're taking calls. They're setting up lines. They're helping older adults who, need help because of technology or phone, make appointments, provide transportation. They reached out. They have lists ready. So when the vaccines come in, which are in very, very short supply, they can get those in the arms. So New York Connects on the state level, is routing those questions to the local county offices for the aging. They're handling them within their organizational infrastructure, and it's a little bit different. And then folks can call in directly, but many of the counties are developing their own 800 numbers, their own websites. We are capitalizing on the state 800 number and website. So there is a comprehensive effort for the population that we oversee to make sure we identify who needs help, how to get them the help, and then when the vaccines come in, get them in the arms.
What can we do to improve that too, Gregor? Do you have any ideas for that?
Increase the vaccination supply.
Yeah, for sure. That for sure. Well, thank you very much. I appreciate you being here today.
Sure,
No more
Senator,
time
thank
right
you.
now. Thank you.
Commissioner, yes, Director. So we have a couple of other Assembly members, but I questions that really just follow up with Senator Serino's comments. Has your office been involved with the governor's office in looking at how to provide vaccines to people, seniors who are basically homebound?
Yeah, so certainly this issue has come up. So there's a variety, not only within our agency, of individuals who are not going to be able to go to a bricks and mortar. And so, having a mobile strategy certainly needs to be on the table. I do know some counties that have already begun to do things like that. Albany County is one. They posted it the other day that they have a partnership with their EMS emergency, their volunteers to do those types of things. So I think it's getting through, having the number of vaccines and getting through the priority list. There's 7+, or was it yesterday said 10 million people in this 1A, 1B category. So yeah, definitely those are things that are being discussed because we have a variety of folks that aren't going to be able to get to their pharmacy or their doctor or some other bricks and mortar place to get their vaccine.
I guess my question is more directed at you, not what a particular county is doing. Are you advocating for the governor's office to set up such a program, particularly for New York City, where there are so many homebound seniors? So I would, if you're not, I would urge you to raise this issue with the governor's office. They have not, a number of members have raised it, and we have not gotten a plan in place. So I think you are certainly a very strong advocate for that. And at the same time, I would urge you, if you're not also urging the governor's office to deal with, you talked about caregivers. So there are many family caregivers. They're taking care of of a homebound, basically a homebound senior. Again, relating to vaccines, many of them do not, of these family caregivers are not now eligible under any of the categories to receive a vaccine themselves. However, obviously we would want them to be protected both for their own health so they can continue to provide caregiving services, but also to make sure that the person they are caring for doesn't come down with COVID. So I would also ask you to advocate on behalf of all of the volunteer caregivers that save our state millions and millions of dollars of providing services, to find a way for them to become eligible for vaccines, so that not only do we protect the homebound senior, but we protect the family member who may not otherwise be eligible from receiving COVID.
Thank you.
Thank you. Senate, do you have any?
Hi. Greg, I don't have a question. I have a statement, I guess. So,
okay. Hi,
Rachel,
Senator.
nice to see you again. And you've been with the state a while now, haven't you? How many years?
I have. It's kind of crazy. Yes.
Yes, because I feel like you're one of the ones who is consistent. And Rachel May had paid you a compliment before we got to the hearing today that you're someone who does his homework and has data and information available. And I think that is crucial because, we talk about the aging. It's 30 years in people's lives. People are living a lot longer. And so it's a huge percentage of New Yorkers' lives. And we don't put a lot of money by any measure into the programs they need. And I think we all need more data to continue to come out from you and the government to remind us of the many, many issues where government can make a difference if we don't forget what a crucial role we can play in people's lives. And it's a hard assignment, Greg, because it's very broad. It's harassment and discrimination in the workforce for people who are remaining in the workforce or hope to. But in today's world, if they lose their job by the time they're 55, the chances of them getting back in are damn hard. And the workforce does discriminate. And it's people, as you described, in their later years being too frail to be able to take care of themselves. I know for me, the worst thing that ever happens in my office is when it's a Friday and some very elderly, frail person shows up or nowadays calls to say, they've maxed out their savings on rent. They went as far as they could. Happily, there's a moratorium at the moment, but the landlord is evicting them because they don't have the money to stay where they're living. And where do elderly people who are desperately poor go? They end up going into our nursing homes, whether they should be there or not. because frankly, a fear that if they went into our homeless shelters, they would just die really quickly. And I just think we don't know enough, or we don't understand enough as legislators about what an incredibly broad universe of issues we should be thinking about and coming up with ideas for. And of course, I would like the ideas also, thank you. But I just think it's crucial that we all sort of get pushed to remember how big a percentage of New York State falls into the category that you're supposed to be responsible for. And you're just too small and too underfunded an organization to imagine you're doing it all, but you can help educate us about what more we need to do. So that was my little lecture at the moment. Thank you.
Yes, Senator, and I think, you know, what you're saying is that aging is not one agency. I mean, older people touch every facet of life, and that's kind of the point that you're making, and I agree with you.
Thank you. I think that is it for the Senate.
Okay, so then we go to Assemblywoman Rosenthal, Chair of our Social Services Committee, 5 minutes.
Okay, thank you very much. Hello, good to meet you.
You as well, Assemblywoman. How are you?
Good, thank you. You know, a lot of my district has seniors, and my grandmother was a big influence in my life and all of her friends too. So I care particularly about the plight of seniors, and I see that there is such a need for more funding in terms of home care, home delivery of services. Until the Older American Act is you know, is updated and fortified, what other revenue options are there to raise funds to help this population?
Yep, so there's a couple different things that we're working on. So again, your county offices for the aging for, I don't know if you're one necessarily county, I have to look at your district, or you cross borders.
It's the Upper West Side and parts of Hell's Kitchen in Manhattan.
Okay, so you're under DFTA. So, you know, we have a couple of different things that aren't going to reach necessarily the lower income, but may. So we authorized the ability to create a private pay model for individuals that can afford these types of services that are in very, very high demand, but are low cost, high yield. I only raise that because any additional revenue that comes from those goes directly to target individuals who are low income. I think one of the most promising things that we've been working on over the last couple of years is our business acumen projects. When we talk about age-friendly health systems, or working to address social determinants of health and value-based payments. I think the value of what the counties and the community-based organizations in our office did during this pandemic was a real eye-opener for health systems. And so we've had a lot of conversations with several regarding what it is we do, how we go about doing it, the cost for what we do, and how that's beneficial to them. So I believe that's going to lead to some very positive contractual relationships that will expand significantly the service provision and be able to serve a lot more people. The health department doesn't get enough credit for the amount of things that they fund. So back to Senator Krueger's point on this isn't just about aging, but on caregiving and respite services and supports alone, they put $25 million in a year. So I think that there's things like that. But the bottom line is that we are very, very heavily underfunded on the federal side, and I'm making that my priority this year in addition to everything else we do to get that type of attention because the timing is right.
Much like Senator Krueger, when we were in the office every Friday, that was the time when seniors came feeling most desperate. And I have seniors who don't even have a phone, so they had to use my phone in the office. Mm-hmm. And I think so many are not connected with programs that could possibly assist them. So that's one thing. But I also know there's great loneliness for seniors. And particularly now during COVID, when you can't go to the senior center and you can't get lunch with your friends at the senior center. Are there new programs that maybe you in conjunction with other departments are creating so that they could be, or are you leaving it to the local community organizations? You know, like Zoom talks or phone calls,
Yes.
like that.
So all of those things, Assemblywoman, are happening. I could tell you, DFTA has made over 3 million wellness calls since the pandemic started alone. And that's happening all across the state. So the Zoom calls, the lunch and learns, I've done a bunch of those in various counties. We implemented our animatronic pet project, which showed significant reduction in social isolation after a year. We are bringing virtual platforms like out of New York City, Self Help's Virtual Senior Center, Get Set Up is a California company we're working with, where we're launching to bring those tech solutions into the home. But as I mentioned earlier, and you said so eloquently, there are people that they can't afford the equipment, don't know how to use it, possibly can't be trained, don't have access to broadband. So those personal, calls and or emails or things of that nature, those have ramped up significantly. And I think what our network does so well is to prioritize who really needs those and who doesn't. If you had a caregiver who was able to work from home during this pandemic, they were maybe able to spend a little bit more time with their loved one. But there are people who live alone that don't have anybody and can't go to the center, as you're talking about, or not going to social adult day anymore. So yeah, all of those types of things have been ramped up exponentially. And then of course, and I don't mean to take all of your time, Office of Mental Health put out that 800 number. They had over 7,500 volunteers to take those calls. Those things are still happening. So there's a multi-agency, multi-network approach to really try to combat isolation, because we're going to be in this, unfortunately, probably for another 9 to 10 months.
One last thing, please feel free to call on any of us to help you in DC to push for that. I know the aging chair is anxious to get that done as well. Thank you.
Well, I will definitely take you all up on that, because you all have those connections, and this is the time. I've been doing this 29 years, and we've never had an opportunity like we do right now, and it's time to get out of 1965 and get into the 21st century. So thank you so much.
Thank you.
Thank you. Senator Rachel May for her second round for 5 minutes as chair.
Thank you very much. So first of all, I want to say, I hope you're going to enlist us in helping with doing the advocacy with the federal government to make those changes that you're talking about, because I think I agree with you, they're really important. I didn't get a chance to ask about the Ombudsman program. I know Senator Serino asked, but and we just passed through Aging Committee this morning my bill to beef up the Ombudsman program, but I know it's a federally mandated program. Do we get federal funds for it? And were there any additional funds in the pandemic context for that?
Yes, so we do get federal funds, a little over $1 million. We get some state funds, we get some funds from the health department, and then we use some of our internal funds to supplement. We got $1 million through the CARES Act to add to that, and some of those dollars are being targeted for recruitment and retention. I think I mentioned to you last year, Senator, we were pilot testing the stipend for LitCop workers and volunteers to see if that had a behavior change in terms of being able to recruit and retain, and we had really positive outcomes in terms of folks spending more time, doing more work, being more invested. So I think that there's some things that we can learn not only from LitCop but the HICAP program and other things of that nature. There was some dollars that came out of the Civil Monetary Fund, $1 million I mentioned earlier, that we didn't administer but went out to the nursing homes to be able to upgrade and buy technology equipment to better connect folks. So we're around 5.2 million right now. There are CARES Act dollars. The 9.3 million that I mentioned that we're expecting any time was just for nutrition support. There were some additions in the stimulus that just passed a couple of weeks ago that will probably bring some additional resources. And then of course, elder justice issues, of which LitCop is a part of at the national level, I believe are included in the 1.9 trillion stimulus that President Biden has put forth. So I am hopeful that there will be, some stopgap dollars to help us while, everybody's trying to figure out how to address the significant budget deficit, which again, I'm hopeful will be helped out through the Biden plan.
Okay, great. And then just to come back, I asked about respite care before, and you said there were no cuts, but the way the budget works, as you know, the executive budget cuts out things that were added by the legislature the year before, and then it's up to us to have to add them back. And respite care is one of those. Elder abuse, the elder abuse work that Lifespan does, it's up to the legislature to add that back in, and we may have to, pull something else out in order to do that. This dance that we do year after year, I think, is so disingenuous and so hypocritical. And when, the leaders of executive agencies come up and brag about how much work we're doing on elder abuse, and then, cut things out of the budget that we have to add back in, it's very frustrating, and it's hard to do the right kind of messaging about this when there's, they give it away, take it back, give it away, take it back. So anyway, that's just an editorial comment, but I do want to say one other thing which just came across my radar screen, which there's a pretty explosive new report out about one nursing home where they were administering hydroxychloroquine to COVID patients. And I'm wondering, I know you haven't read that, but is this the kind of thing that the Ombudsman program can be used to kind of nip in the bud, or do we need some other ways of really getting rapid intervention in nursing homes?
Well, it certainly is. I mean, that's distressing to say the least if that's what's happening. And I can't imagine there won't be some action in the health department involvement in, injecting people with hydrochloroquine. I mean, we know all about the efficacy of that, and there is none. In terms of LitCop, yeah, I mean, that's really things that they would, traditionally, if folks knew about this happening in the home, that would be reported to the long-term care ombudsman, either paid staff or volunteers, and that would rise to a level where we would immediately refer that to the health department, because they would want to know that. I mean, that's to me just outrageous. So that is the role. I mean, our folks work with the residents, the families, the residents' councils, and the administration and staff of the facilities to try to solve problems. When they rise to a level of a systems issue or a real quality of care issue, they get reported immediately, because then, that's not what our role is. Then it goes to that next level.
Okay, great. Thank you very much.
Thank
Sure,
you.
thanks.
Thank you, Assembly.
We go, yes, thank you. We go to our Agent Chair Ron Kim for 5 minutes, this second round to finish.
Right. Thank you. I just want to also just underscore the importance of what Chairwoman Weinstein has said about the homebound older adults and getting our vaccination plan for them. I represent a district in a region that do not have any vaccination sites, and we have a ton of seniors that are just calling, worried about how do we get the vaccines. We have a group of primary physicians and nonprofits and community groups that have ideas and suggestions on how to get this done. Greg, if we can set up a call with them and follow up, that'd be great. I also want to take a moment to address and continue my talk about ageism earlier, and address the ageist language that has recently been coming out of the executive office. On January 29th, 2020, in response to Attorney General Tish James' bombshell report that the state has undercounted nursing home deaths by almost 50%, Governor Cuomo responded by saying the following: look, whether a person died in a hospital or died in a nursing home, it's the people died. People died. I was in a hospital. I got transferred to a nursing home, and my father died. My father was in a nursing home, got transferred to a hospital. My father died. People died, but who cares? 33%, 28% died in a hospital, died in a nursing home. They died. Those are the words of our executive on that day. By now, I think we all understand how language matters when it comes to not just racism and sexism, but also ageism. So moving forward, Director, I believe every commissioner and public officer in the state of New York, including the governor, should receive mandatory training on ageism and ageist language. So, Director, would you be open to collaborating and working with me in putting together the nation's first public sector guidelines around anti-ageist culture and language?
You know, I think that that is important. Language does matter. When I first came to this agency, we scrubbed elderly, senior citizen, and senior from every publication and told folks that they couldn't use those terms, not because I made them bad, but it elicits a negative response. And we talk about older adults, older individuals. I did not interpret the governor's statement to be ageist. I interpreted it as somebody who is very frustrated with the pandemic and the toll that it's taken on New Yorkers. And, you know, the fact that people's behaviors and not wearing masks and not doing the things that they were supposed to do. We saw, you know, again, pictures from Super Bowl yesterday of people partying it up with no masks on and drinking, and how we continue to try to perpetuate the right protocols for people to take. And having spikes that are killing people. So that's how I interpreted that personally. But I would absolutely be willing to work with you on some training guidelines that could be available to all individuals to not only understand the contributions, but ageist language and how detrimental that is.
Sure. Thank you, Greg. I mean, I think, you know, you have to an extent defend the executive, but I think many of us walked away listening to the tone and how he delivered. Maybe it wasn't intentional, but the outcome obviously was very detrimental because he has a national platform, and for him to be on the national stage and be caught saying words like "who cares where they died," it almost helps normalize the dehumanization of our elderly population. And I'm not trying to pick a fight here with the governor. I'm just trying to recognize how important it is that we get this right and we change the way we address and talk about our older adults, especially when you have the spotlight on you. And I hope you and I can work together to work on that manual in the near future. Thank you. Thank you, Director Olson.
Thank you, Assemblyman.
So I think, Director Olson, that is it for questions from our colleagues. So we thank you for being here and look forward to your continued advocacy on behalf of our older citizens.
Well,
our
thank you.
active adults and both our homebound adults.
You know, I love coming here to talk to you guys because I think what this network does is amazing. So thanks for your time and your great questions today, and I look forward to working with you all.
Thank you very much, Greg.
Thank you.
Great. So we've, before we go on to the Deputy Director of Veterans Services, we've been joined by Assemblyman Ashby, who is the ranker on the Veterans Affairs Committee. And now I'd like to introduce Joel Evans, New York State Division of Veterans Services. There is 10 minutes for you to make your presentation and hopefully not read, and then there'll be some questions from our colleagues. Thank you.
Thank you. Do you hear me well? Chair Weinstein, Chair Krueger, and distinguished members of the Senate and Assembly, thank you for the opportunity to address you today. I am Joel Evans, a veteran who served for 23 years in the United States Navy, retiring as a Chief Petty Officer. I joined the New York State Division of Veterans Services on November 1st, 2007. Since 2013, I have served as our agency's Executive Deputy Director. The core mission of our agency is the same as it was at our agency's inception 76 years ago, to advocate for all of New York's veterans, service members, and their families, connecting them with the benefits and resources earned by virtue of their military service. Our agency's Veterans Benefits Advisors represent veterans, service members, and their families in the preparation, presentation, and prosecution of claims and appeals for financial, medical, educational, and vocational benefits before the United States Department of Veteran Affairs, commonly called the VA. This representation brought in a total of $780 million in new and recurring tax-free VA financial benefits for New York's veterans, service members, and their families during the past year. Additionally, our Veterans Education Bureau has approved 2001 facilities in New York to receive GI Bill funds. These programs brought $590 million in federal funding into New York in 2020, paving a path for veterans and their dependents to receive a high-quality education from our state's colleges, universities, and vocational programs. Yet while our core mission remains the same as it was when the agency was established, we also know the crucial aspects of our mission have evolved with the changing times. Today, New York is home to a diverse population of more than 737,000 veterans. The largest cohort of this population are veterans who served during the Vietnam War era. We take pride in developing strategies tailored to meet their needs and to serve these veterans where they are, from our field offices across the state to the places where they reside. Over the past year, the division has also strengthened partnerships with organizations serving traditionally underrepresented veterans, improving our cultural competency to better serve and advocate on behalf of historically marginalized veterans. This includes our representation of veterans who receive bad paper discharges rooted in anti-LGBTQ+ policies, racism, mental health-based discrimination, retaliation for reporting sexual assault, and other unjust circumstances. New York's recently enacted Restoration of Honor Act is a key pillar of this work, as is our representation of veterans in discharge-related cases before the VA and the Department of Defense. The COVID-19 pandemic has also forced the agency to reinvent and improve itself. We met this challenge in several ways: by purchasing the technology necessary to represent veterans and submit their cases to the VA completely virtually, conducting virtual hearings before the Board of Veterans Appeals, providing training online rather than in person, establishing protocols to conduct entirely virtual appointments with clients, and reaching out to tens of thousands of veterans through email buddy checks. These measures ensured the uninterrupted delivery of the division's services to veterans, service members, and their families throughout these difficult times. Knowing that providing support to our veterans takes a village, the division shared these resources with our partners in county and municipal governments, as well as not-for-profit veteran service organizations. Free of charge, we accredited 69 local and not-for-profit veteran service officers under the state's power of attorney during 2020. We shared with them free access to our case management software so they could file claims electronically once remote work became the norm. We provided free access to county and city veteran service agencies for every training we delivered. We signed a new memorandum of agreement with the American Legion Department of New York so that completing our annual training will now satisfy the continuing education requirements for veteran service officers to keep their Legion accreditation as well. Veterans confront food insecurity at above average rates, a problem that COVID-19 only made worse. Thanks to Governor Cuomo's COVID-19 Philanthropic Fund and the Nourish New York program, we partnered with the HelloFresh Corporation and several community-based organizations to provide more than 300,000 healthy meals to veterans and military families in New York facing food insecurity during the pandemic, an effort that remains ongoing and successful. For some veterans, COVID-19 has also exacerbated mental health conditions, increasing their risk of suicide. Our agency has focused on this issue through our participation in the Governor's Challenge to Prevent Suicide Among Veterans, service members, and their families. And over the past year, New York has become the first state in the nation to commit to training every veteran service officer on the use of the Columbia Protocol, a highly effective suicide prevention risk assessment tool that will help them to support that will help veteran service officers identify individuals experiencing mental health emergencies and connect them to support services. We are also proud to be the first state in the nation to form a partnership between our state's Bar Association and the Psych Armor online training organization to enhance military cultural competency for our state's attorneys, including gatekeeper suicide prevention training and training on the mental health impacts of in-service traumas that military members may experience. As part of his State of the State agenda for 2021, Governor Cuomo also announced that he will direct state agencies to ask their clients whether they or their immediate family members have served in the military. This initiative will facilitate new connections between veterans, service members, and their families and vital resources. This new campaign will help the state reach veterans and service members who may not self-identify as such because of stigma or trauma linking them with the state and federal benefits, programs, and services that they have earned. The governor's budget also seeks to increase access to veteran treatment courts by permitting the transfer of a case from a traditional criminal court in one county to a veterans treatment court in an adjoining county. This will connect more at-risk veterans in our justice system with the life-changing services that these courts provide. The division appreciates the continued support of Governor Cuomo and his administration addressing the needs faced by our veterans, service members, and their families. Our work helps provide better lives for the brave New Yorkers who have served our state and nation, and our dedicated staff will continue to represent New York veterans, service members, and their families zealously, inclusively, and effectively, and will help them adapt to and overcome the challenges of this ever-changing world. I thank you for your support of this agency's work, and I will look forward to any questions you may have.
Thank you. Assemblywoman Barrett, do you have questions?
Yes, I certainly
Go
do.
ahead.
Thank you, Deputy Executive Director, and thank you for your service. Thank you for being here today. You know, I have great respect for all the work that your agency is doing, that your team is doing, but I continue to have concerns about, you know, the priority that this administration puts on veterans services, veterans. Again, you have been without a director of your division since June. There has been, you know, I'm sure you're doing a wonderful job, but I'm guessing that you need the help and support, and we certainly need the gravitas of a director, especially as you've talked about all the challenges in this COVID time. Dwyer funding, nowhere in the budget. You know, it's supposedly an OMH, but that, you know, she didn't really know anything about it, the commissioner there. It's an extraordinary program that we all know works very well. It's still only available to about half of our counties, but nowhere in the budget. And, you know, I'm just wondering how you're feeling about that. Would you support the Dwyer funding going directly to the division, being under its responsibility rather than OMH to get some more of a commitment to it from there? Thank you.
Thank you for your question. I understand that there may be a concern with a director not being in the seat at this moment. I've been with the agency, like I said, for 13 years, and I've been the acting executive deputy director now. I mean the executive deputy director since 2013. And there has been continuity of service. And I am proud to say that we have a strong leadership team in our organization, and we are able to adapt and overcome situations just as missing a director for a moment. And as you can see with what I have read in the testimony, we have accomplished a lot of things in 2020 amid a COVID crisis. The funds that we brought into the state with the work of our staff was $40 million more than what was brought in 2019. So we have a good chemistry in the agency to continue doing the work until the governor finds a suitable director for the agency. And so I don't think there should be so much concern about a director not being there. as long as we're still maintaining the ship afloat, as I would say. As far as the Dwyer program, and of course, you already said it falls under OMH, and OMH is the agency responsible for giving you the answers that you are looking for.
Would you support a switch from that funding stream in OMH to directly be part of the division's responsibility?
Well, if that were to happen, of course we would roll with it and work it. But at the current time, I don't see any switch happening.
I see. Let me ask you about the Article 7 language. I know you commented about the Veterans Treatment Courts, which we all know are a good thing. Could you just explain a little bit more to me how this Article 7 changes what's going on now and what's entailed in that? It was a little unclear in the governor's language in his budget.
So the veteran treatment courts, we have approximately 36 veteran treatment courts right now, and they're in those counties. And we have veterans in counties that do not have a veteran treatment court. So what this proposed expansion does is it allows a veteran in a non-treatment court county have their case transferred over to a veterans treatment court.
I see. So it just expands what certain counties that have the courts who they can hear in their courts, or makes adjacent counties veterans eligible to go to a neighboring county's veterans treatment court. And it doesn't change the kinds of cases that they would take or any other things. It just really expands access.
It expands the access, and it's only fair that a veteran in a location that doesn't have a treatment court could go into this life-changing situation of being under the veteran treatment court process. It's a very intense process, and it takes a lot for the veteran to complete the program, and it meets the actual goal of rehabilitation. So giving the opportunity to veterans where there is not a veteran treatment court to go ahead and transfer to a location where there is one is a win-win situation for those veterans.
And is there money in your budget to do this so that the costs are covered, or are the counties going to be responsible?
As far as the funds, that's nothing that comes out of us, as far as I'm aware of. It's just a matter of the counties communicating with the cases.
I see. So there is no direct funding for any of these veterans treatment courts in your division budget?
No, ma'am.
Okay. And another one of the governor's recommendations was saving $79,000 by transitioning the hotline, the helpline, from the Human Services Center to directly to the veterans benefit advisors. How is that going to be implemented, and how are you going to do outreach to ensure that veterans get to where they need to be? And is that funded in the budget?
Yeah, so what we're actually doing is we are going away from what we call the call center, and it's actually going to be managed by our staff. We used to run this years ago, where if somebody calls our 800 number, one of our staff members will actually answer the phone in that region, and it will provide direct access to the veteran or the family member, instead of being transferred from one operator to another staff member and so forth. So, and in actuality, the shifting of the model is actually going to be less expensive to operate. So we actually will be able to support this.
And you'll save money. And will it be as available? Is it the same? Is it a 24/7 availability? It before and after?
Well, the 24/7 is not really a 24/7, because if after hours it goes to a voicemail, but the next day we'll answer the phone calls. And right now our call center also goes to a voicemail after hours.
So it's the same services will be provided in
The same,
under.
correct. The same services will be provided, and it'll be just streamlined straight to the regional location.
I see. And then you mentioned, and I'm, was very proud to be the sponsor of the Restoration of Honor, and very proud of New York leading on this. Do you have you identified certain resources in this year's budget that would help implement this measure? Is there, have there been costs that you've recognized and that have gone into this year's budget to make sure that those that we're doing the best for these veterans as we can?
The Restoration of Honor Act is going perfect. Implementation has gone smoothly. As of this moment, we've had 25 applications submitted, and of those 25, 12 awards, Restoration of Honor awards have been provided. The others are still pending documentation from the federal government. There's delays in the federal government in getting personnel records, and so that's the only delay. There has not been any denials, and with our current budget, we've been able to manage the program, and we're doing great work with outreach for the program and getting other people to submit for their applications. And another great thing that has happened with the Restoration of Honor is that these applicants, we've been able to also help them with getting further federal benefits and even VA healthcare benefits as well.
That's wonderful. That's very encouraging to hear. I mean, I think that talk about an opportunity to really change lives, and thank you for your work on that. And I'm really glad to hear that people are reaching out and that your outreach has been effective. I think that covers what I have to ask at the moment. So thank you again for your work and for your service. And I'll see the remaining few seconds here. Thank you.
Thank you.
Thank you. Thank you. So we go to the Senate now.
Thank you. And 10 minutes on the clock for Veterans Chair John Brooks.
Thank you, Madam Chair, and thank you, Executive Director, for joining us today. As my partner in the Assembly has said, I too am concerned that the Director's position remains open. I heard your response, but I think we have almost 750,000 veterans in this state. And I think we can do a better job in addressing their concerns. It's great to see that you are expanding the court program. I think that's been exceptionally successful and very much welcomed. I think the fact that the courts can take into consideration what our veterans have been through in some cases and help turn their lives around, I think is a very important consideration. I am very, very concerned with the practice year after year after year of cutting the guts out of the veterans program each year, and we have to scramble to put the money back. Clearly, the Dwyer program in particular has been an outstanding program, exceptionally successful, a peer-to-peer program where veterans are talking to other individuals who have been through the same circumstances, and they are comfortable. We need to continue to make that program grow. We should not now, at this point in time with the budget, be putting together appeals to put money into the budget. We should be talking about increasing those funds. I think it is really shameful, the budget process that we go through with so many of these good programs that are helping our veterans are being stripped out, and we have to go backwards to put the money back in. We should be in this budget process talking about expanding the services to our benefits. We know that the veterans from the Vietnam War are showing more and more need. We should be expanding and developing and discussing programs to help them out. We still need to look at housing. One of the issues I'd like to see us look more at in my area of the state, at least, there's a large number of zombie houses that can be recovered and made available to veterans. We should be looking at those kinds of programs. One of the things we have to spend more time looking at is veterans who are coming to the end of their time in active duty and helping and assisting them in advance to know what benefits are available to them, what educational benefits, what housing, et cetera. We've got to do a better job of preparing our veterans as they enter back into civilian life. The military has changed. The military has changed greatly. We're in a situation where citizen soldiers, the reservists, the guardsmen, they are in a situation where they're in civilian life, and then suddenly they're in a hostile situation, and they come back to civilian life. And that is something we need to recognize, how dramatic that change is. And I think we need to do some work to assist those things. It's been suggested to me by someone in the teaching profession that one of the things we should be doing is making sure that the schools are aware of those situations where one of the parents are in the reserves, where they may be activated. The school should know about that, because if something happens in the area where your parent is, and you hear some bulletin on the news, and when you come to school that day, your mind is elsewhere. You're worried about your parent in that other location. Teachers should be aware of those students that are in decisions so they can look for signs that they need some assistance, or maybe some counseling as to what might be going on. So, you know, I think our Veterans Committee in both houses are committed to helping the people who have served this country. I think we're concerned that we've got to do more for those veterans. And I think we've got to recognize the mental aspects that people are going through, the deterioration in health that we've seen in terms of our Vietnam veterans, and the emotional strains that some people do experience from transitioning in and out of civilian life to veterans. So, like we both said, we think that the chair position should be filled. That's critical. But I'd like you to explain where you think the veterans programs should be going in dealing with not only the problems that we're seeing now, but the challenges we have in retaining people in the National Guard, the challenges we have in making sure people are getting the right housing, and recognizing that I believe that all of the funding associated with the veterans should be under the veterans budget. It is difficult to an extent for us to chase all the money that's been put in different departments. You were asked about the Dwyer money, and the response was, well, you got to check with another department. That's an unacceptable response. The mission of this department, the Veterans Agency, is to serve the needs of the veteran. We should be on top of every aspect of the services and the fundings we're providing for the veterans. So I'd like you to talk about what changes you think need to take place to deliver more and better services to our veterans.
So, thank you for the question. We are doing great service for our veterans. As a matter of fact, you mentioned the service members that are getting out of service at this current time. We're running, there's a pilot program that's going on right now where they're in contact, this is happening in Suffolk County, where they're in contact with the veterans service organizations in Suffolk County, and they're helping them transition into the civilian world, let's say. So that's a pilot program that is going on right now. It's a promising program. It's something that probably should have happened a long time ago. I myself remember when I was just retired in 2007, and so many questions and so many things that I didn't know. And if all those questions are answered before I retire, whether 6 months or a year before I retire, where placement for a job and home and where I'm going to live and so forth, how's my family going to be taken care of? If all those situations are addressed prior to separation or retirement, it will be very beneficial for the veterans. So that's one program that I think is very productive. The Dwyer program, our agency has veterans benefits advisors in those regions that have Dwyer programs supporting the program. They help provide veterans benefits counseling. So we are involved with many of the Dwyer chapters, even though the Dwyer program is not under the Division of Veteran Services.
So my question to you is, does it belong under the Division of Veterans and Services?
Well, it's something that other people will have to decide if it belongs or not. That's not for me to decide.
Well, I think that says a lot. This is a successful program, one of the most successful going. And, for us to sit and discuss veterans benefits, we should be discussing those benefits with your department, your agency, not other agencies. I'm aware of the program in Suffolk, and Tom does a great job in so many things that he provides. But we have to expand those programs. That's a good experiment. I mean, in Long Island, in Suffolk, there's a lot more job opportunities in other regions in the state. And when we have to recognize that we have a better or greater obligation, perhaps, to those who live in remote areas where the opportunities are less. We've got to help those people more. And it frightens me that we accept this pass off of 750,000 people who have served this country, some of them injured, some of them with problems when they discharge from service, some of them in search of something to do. And instead of having, if you will, one shop shopping, we're handing things off. The Dwyer program should be embraced and expanded all over the state.
Senator Brooks, I'm going to actually cut you off now. You've gone over a minute. I apologize.
I'm sorry, Liz. Well,
Okay.
thank you, Mr. Director. But
you actually can have another 5 minutes at the end if you like, as the chair, or you can
Okay,
follow the executive.
Thank you, Madam Chair.
Director
Thank you.
separately. Thank you. Sorry, Assembly.
No problem. We're going to go to Assemblyman Ashby, the ranker on Veterans Affairs, 5 minutes.
Thank you, Madam Chair. Thank you, Chief Petty Officer, now Executive Deputy Director. It's great to be with you today. I want to thank my colleague, Chair Barrett, for her hard work. And she already asked many of the questions that I had regarding some of the legal programs and new legislation that's gone into place. And Chair Brooks was kind of getting into some of the issues that I wanted to discuss. So it's a good segue. I think a lot of the programs that have come up and that we've developed in the last couple of years are incredible programs, and they have the ability to impact a lot of people in very good ways. But it seems like the department really doesn't have the necessary resources to really grasp some of these programs and take off and run with them, as evidenced by not having a director for an extended period of time. I mean, do you get the sense that, your division is being overlooked or neglected in some ways?
Not necessarily. No, not at all. We are part of we are not neglected or overlooked at all. We are well taken care of. We have good people in our agency, and we get the job done. So some of the programs that don't belong to the agency, the ideas of shifting them over to us, well, we would need people that would have that expertise to also manage those programs. So it's not a matter of that we can't do it. It's just a matter of where like you said, what would the resources be?
Yeah, I think you should be credited as being a good NCO too, and having a can-do attitude with that, and not really seeing maybe some of the potential that we have here. A lot of constituents, veterans that I have, and really throughout the state, have come to me in the last several months, in particular about the vet centers being closed throughout the state, and I know that New York is not alone in this, and not having the ability to really connect with the veterans and their families who are utilizing these their resources. And even like we're doing right now through Zoom, virtually those resources are not available. Have you heard similar things in your organization and in your position? And are there measures or steps that can be taken within the division to help stem this?
So the vet centers, of course, they're not managed by us, but we do have veterans benefits advisors that cover some of these vet centers. And our agency, for example, we have had some of our advisors meet at the vet centers in, right now it can't be outside because of the cold, but during the heat of the pandemic and so forth, where our advisors were meeting with the veterans and providing veterans benefits at the vet center, but not inside because, of course, the restrictions that were in place. So we still stay in contact with the veterans that need support from the vet centers. So I know it's tough when they can't go and have this support there, but our agency, one thing that we were able to do with the forced remote work from home, we were ready almost at the gun of the work from home. So all our veterans benefits advisors could actually assist any veteran anywhere in the state virtually, and we could file a claim for them without them even having to see a sheet of paper, and it gets submitted straight to the VA. So we still are able to provide a valuable service for the veterans amid the closures in the pandemic.
I think that's great to hear in terms of being able to register for benefits, but really my primary concern was the delivering of services at those vet centers, primarily for behavioral health, to both the veterans and their families. And I know that my time is about to expire. I think that by elevating the division to a fully fledged state agency and giving the director a seat at the table as during budget negotiations, we would resolve a lot of these issues that we're discussing right now. And I hope that we could come to a consensus on the future. Thank you.
Thank you.
Thank you. We'll go to the Senate.
Thank you very much. Oops, sorry. And our Chair of Aging, Senator May, has some questions. I thought she was here with some questions. Senator May, are you still here?
I don't believe she's with us at the moment.
Okay, so she may have had to get off. So I apologize. I don't believe I see any other senators' hands, but I do have one question, if I might. Can you tell me how your office works with the city's Office of Veterans Affairs And how do things get coordinated or not if they don't?
So with the New York City, this past year, we strengthened our partnerships with many county and non-for-profits. 69 individuals got accredited to be able to file claims through the VA using our power of attorney, and that includes staff from New York City. And we provide training for the New York City staff, and we have a great working relationship with the New York City DVS.
Great, great. And is it true that I know that my VA, I'm sorry, I represent Manhattan, so I have the 23rd Street VA, and I know that that hospital has been providing vaccines to veterans. Is that true statewide?
The VAs are, if they're not providing yet, the VA medical centers are getting prepared to. I know that, like you said, the one in Manhattan already is. I'm not sure if every single one in the state is, but I know that they are getting ready to be converted as such.
I wanted to say it out loud just in case my colleagues might not all know that they should remember the VA hospitals when in search of vaccines for older constituents who may be veterans, because I was surprised to discover it when, frankly, a friend who's a 92-year-old veteran said, "Don't worry, Liz, you don't have to find me the vaccine. I found it myself at the VA." I was like, "Oh, that's great." So I want everybody to know that that might be out there as an option. So thank you very much for your work.
Thank you.
Assembly.
Yes, so we have a number of Assembly members, so we'll, unless Senator May returns with the question, we'll go through them. As Assemblyman Kim, for 5 minutes.
Thank you, Chairwoman. Thank you, Director Evans, for your testimony today and for your service. You know, I come from a family full of veterans. My dad was a Vietnam vet. My older uncle passed away last year, was a U.S. Army captain, and my younger uncle was a Navy SEAL. So I was the only first male not to go to the military. So I caught a lot of slack from those men when I was growing up. But I share that story because when I hear of our veteran communities suffering in any kind of way, it hurts me very deeply. And when I read this article, and this was brought up last panel of a nursing home in Queens that has been giving out, administering experimental drugs, hydroxychloroquine and azithromycin, I think, to a dozen or more veterans at a veteran nursing home. Were you informed or aware our veterans were being treated with these drugs in our state-run nursing homes?
No, I was not.
Are you, and I hope that you will be part of the discussion, Mr. Evans, with the Department of Health moving forward, because and I know the previous speakers have talked about doing a full investigation and holding some of these sites accountable. But in light of some of the blanket immunity that was given out last year to the sites, I do not know whether these families will be able to properly have any recourse, which is why I think we need to re-examine our legal immunity that was handed to the sites to make sure that they have some retroactive justice. And when you hear about the stories of the veterans, they only found out weeks later, you know, when they got the receipts and their medical reports of their loved ones who passed away were being administered these drugs. That's the only way they found out without the family's permission. So I think there's a lot of digging we have to do collectively because these veterans and our older adults do not deserve to die alone in pain in these type of settings. And the least we could do is go back and find the truth and give them justice. And I hope you can be a partner in achieving those goals, Mr. Evans.
Thank you.
Thank you.
So we're gonna go to Assemblywoman Hunter, who I know has to run conference in a few moments.
Hi, good afternoon, Deputy Director. Thank you so much for being here today. Just quickly, I know I just have a few moments and I don't necessarily have some questions for you, but just to convey some concerns. I, along with my fellow veterans, have significant concerns along with the chair of the Veteran Services Committee. It remains very difficult, being a veteran. We've heard mention that there's almost 750,000 of veterans in New York State, and it becomes very, very difficult when, around every corner we hear, people say, thank you for your service. And then we turn around and have to squabble over little pockets of money for programs that help so many people desperately in need. And it just concerns me that every year, instead of standing on, our thanks for all of those who, contributed to this country, we have to, squabble over money for the Dwyer Foundation. We are squabbling over money for the Veteran Services, the vet centers, and squabbling over money relative to the money that goes to Boys State and now Girls State. And I just feel like we need to do so much better for our veterans. So, as a state, when we stand on saying thank you, for your service, that needs to equal coming forward immediately, instead of us asking to contribute the money back, to making sure that that money is already there and we're asking for more money. There's a desperate need right now for mental health services like never before. And of course, it's not just with veterans, it's across, our country because of what's going on with the pandemic and remote learning. So I am just imploring you that as we go through this budgetary process, that we put every strong foot forward to make sure that we're putting the necessary funding in place for veterans. So when folks come forward and say thank you, it is backed by money and our commitment to do what we said we would do and honor the people who served our country. So I just wanted to be on the record saying that today, Deputy Director. Thank you.
Thank you.
Thank you. Now we go to Assemblyman Lawler.
Thank you, Chairwoman. Thank you, Director. And I do want to echo the comments and sentiments of my esteemed colleague from Syracuse. She's absolutely correct. I think, frankly, we fall very short as a state, despite your efforts, and I appreciate your efforts and your work. It's not you, it's our state. We do not put enough in terms of resources behind helping our veterans. This pandemic has been especially enlightening to that point. I can tell you in my district, I have numerous American Legions and VFW halls, and they have done a phenomenal job throughout this pandemic trying to help their fellow veterans, trying to make sure they have food on their table, trying to make sure that they are getting the attention and resources they need, many of whom are elderly and stuck in their homes during this pandemic. And they've really done a phenomenal job stepping up to the plate. But I think we need to do more. The fact that the governor has sat on the funding for the Joseph Dwyer program is an absolute embarrassment and totally unacceptable. In my district, Bridges is responsible for administering the peer-to-peer program. They have had to rely on the county to, basically advance the money with nothing from the state in well over a year. And I don't know in what universe the governor thinks that's acceptable to our veterans, but it's not. And I certainly hope you will convey that message to him. I know many of my colleagues have expressed that in letters, in their own comments today. But it's really unacceptable. And I do hope that funding is released immediately. I would also ask that if there are any grants or programs by which you can help our American Legions and our VFW halls. Many of them are in desperate need of repair or need additional funding to help run their operations. If there's ways that your agency can help with that, that's something that would be greatly appreciated as well.
Thank you.
Thanks.
Thank you. So now we go to Assemblywoman Raj Kumar. Jennifer, are you here? There she is. Okay.
Hello. Thank you, Chairman Weinstein, and thank you, Mr. Evans, for your service to our country and for your service to all veterans as a state government leader. My borough of Queens has the most veterans of any borough in the city, about 28% of the city's veterans. So I'm especially appreciative of your work. And I have two questions for you this afternoon. My first question is on veterans treatment courts, which you spoke about. I know they focus on rehabilitation and treatment over punishment, which is exactly what all our courageous veterans deserve, a second chance. So I want to ask you if you can give me more details for how we can create statewide access to veterans treatment courts. What are the financial pathways and budgetary requirements needed to expand access to these courts across the state? And my second question is on the Restoration of Honor Act, which, as you mentioned, allows veterans with bad paper discharges due to PTSD, traumatic brain injury, or sexual trauma to apply for veterans benefits. Can you talk more about the specific resources you plan to commit to further this legislation's goals? And have you coordinated with other state agencies, such as the DMV or parks, that control state veterans benefits? Thank you for your time today and your testimony, and you can always count on me as a true partner on services to help our veterans.
Thank you. On your first question, I'll have to get back to you with a more detailed answer. But on your second question with the Restoration of Honor, we are engaged with multiple state agencies because the benefit that the veteran gets are benefits that other agencies provide. So once the award is given, the veteran actually has a list of about 50 or so benefits that they'll have access to. And we already are in partnership with the other agencies. We had training and discussions, and they know what to expect when they see a veteran come in and maybe want at the DMV, the V on their license plate. Or if they go to their tax assessor and they want to do their property tax exemption, they know what paperwork to look for and so forth. And if there's any problems, the veterans that have been awarded know to contact us, and then we do follow up to make sure that everybody follows the guidelines that are set. Thank you very much.
Thank you. So we go now to Assemblywoman Buttonshaw.
Thank you, Chair, and thank you for the opportunity to speak. Deputy Director, thank you for your work with our veterans. As a daughter of a veteran, I understand the importance. Chair Barrett provided an overview that I concur with as she talked about so many issues that we see. And I do appreciate your experience working with our veterans. However, I feel it is important that we do have a director in that position, and whether it's you or whoever it may be. As you reviewed the executive branch's elimination of 1.9 million of funding that I find unacceptable for the community initiatives, can you tell me what you think this will do to our state veterans if that elimination remains? And my second question is regarding the status of the development of the state's veteran cemetery.
Okay, so could you, what, the 1.9 million you're referring to, can you tell me which ones are you referring to there?
The community initiatives, that was in the executive budget that talks about the New York State Defenders Association, Defense Program, Paths for Veterans, looking at the SAGE Veterans Project that had a loss, and the Vietnam Veterans of America New York's Council.
Okay, understood. I'll, on the question of the state cemetery, we are, of course, moving forward with this, trying to get a state cemetery going. We're right now waiting for the chapter amendment to be approved and signed. And once that gets done, everything starts moving. So that's the only thing we're waiting on right now to get started. As far as the line items that you mentioned on the funds, I will have to get back and see what actually is going on in that area.
Okay. I just, again, as many of my colleagues have stated, the importance of ensuring that you have the revenue to move forward to meet the needs of our veterans that have clearly have those needs. And I just wanted to confirm. So I look forward to hearing from you. Thank you.
Thank you.
We now go to Assemblyman Walzak.
Thanks very much. Appreciate the opportunity. I represent Northern New York and Fort Drum. We have obviously a very high veteran population. One of the sad stories I think of our region is the veterans that choose to leave New York State. So if you don't know Fort Drum in the Army, it sort of has this reputation, sir, as well, the young soldiers, it's not the place that they want to be stationed. They'd rather be somewhere warm, you know, a lot of times with a college very close by, maybe a beach. But the Army sends them up to Fort Drum. But what people will find and what families find is that it is a great place to raise a family. We have a great school system here in New York. Many veterans think about retiring in our area until they see that the options for employment, the options for a business climate or for taxation are unpalatable compared to all of the other places for veterans to retire. So I just wondered if you could speak to that for a moment.
As far as retention of people in Fort Drum area?
Yes, sir.
I could tell you personally, it is a wonderful area, and I know individuals that have decided to make that area, that region, home. As a matter of fact, we have good advisors there in our agency, and of what they tell me of the region, they tell me it's great. And I know some people that have moved from elsewhere just to return back to Fort Drum. So in Fort Drum, we do have a Veterans Benefits Advisor inside Fort Drum that helps the veterans with benefits, whether they're staying in Fort Drum or whether they're going somewhere else. So our Veterans Benefits Advisors are able to tell them to probably help out in retention to the Watertown area of the benefits that New York has to offer for them.
I hate to cut you off, sir. I only have 50 seconds left, and I do want to make a couple of points and ask you another question. Do you think you should be a cabinet level position? It sounds like there's so many members that have supported the cause of veterans today. I think your position should be elevated to a cabinet level. What do you think? Yes or no?
Well, if I'm not mistaken, the veterans right now is a cabinet level position.
Okay. I would just use my last 30 seconds, and I appreciate your testimony here today and all that you do for veterans in New York State to advocate for Clear Path for Vets. They're an amazing organization. Project Healing Waters and the Service Dog, opportunities that are out of that organization are phenomenal. Vets Peer-to-Peer is saving lives every single day through Joseph Dwyer funding. and helmet to hard hats really helps us retain some of the veteran talent here in New York. So the $1.9 million cut that the governor had in this budget for veterans is beyond the pale to me. Appreciate the time, and thank you, Chairwoman and sir.
Thank you.
Thank you. We have one final round from John Brooks, Chair of the Veterans Committee. Need to unmute. There you go. Nope. Try again, John. To unmute.
Okay, that should do it, I hope.
Yes, it does.
Okay, thank you, Madam Chair. And Mr. Evans, thank you for being here today. You know, I think for a lot of us, this is important, and our hearts are into this, and we're concerned that we do the right things for our veterans. Assemblyman Lawler got into an area I just wanted to bring up very briefly, and so many of the veterans organizations that we belong to are struggling to maintain their buildings, and many of them are closing down. Many of these buildings, I know the Legion Hall next to mine was used for early voting in this last election. What can we do to help the various veterans organizations get funds needed to maintain these buildings? They provide such an asset to the community for meetings and other things, but it's very difficult for them to raise funds. We've tried to pass a bill to allow a form of gambling to help them out, but you know, it's critical that we maintain these locations, and it's you know, all of us who are veterans, we kind of form a group, and that's a place, that's home, that's a place to meet. So is there anything that you can see, or a way you can see, that we can get some of the needed funding to these organizations to help them maintain those buildings?
I know the value of the VFW and American Legion halls, and they provide more services than people can imagine, right, in the communities. So probably getting together with the leaders of the halls and seeing creative ways that we could probably help them out. So if a hall was able to be used for early voting, how about doing something different where you could probably get veterans to do different activities or family members, so that it could also bring some traffic in it or so forth. But it'll be a good opportunity to sit down and talk to some of the leaders of the halls with our agency and see what we could come up with as far as pathways and show support to those important halls.
Yeah, if you can give them that kind of assistance, I think it would be very helpful, because they're trying. There's so many restrictions when they start to charge fees from a tax standpoint and the rest. But I think it's a shame if we're going to lose those facilities. And you know, anything we do there, I think is great help. And I thank you for what you do. I mean, I came on a little hard, but you know, we owe these guys a lot, and we can do better than we're doing. So I appreciate what you do, and I think all of us that are involved in both houses of the legislature appreciate what our veterans have done to us and what our reservists are doing for us. So thank you very much for your service.
I want to thank you for the support that you always provide us. Thank you.
Thank you very much. We appreciate you being with us here today. And we are now, for people following on the scorecard, going to start our first panel of non-governmental invitees.
Madam Chair.
I believe we have the Ways and Means ranker, Mr. Ra.
Oh,
with a question.
I apologize, Mr. Ra. I did not see a hand up. Please.
Yes, I put it up late because Mr. Ashby just had an additional follow-up question, and since he already went, I am going to ask it on his behalf.
Certainly.
Good afternoon, Mr. Deputy Director. I just have a follow-up to what Mr. Ashby had mentioned earlier, as well as Mr. Walczyk, with regard to you know, the level of the department. And I certainly understand. I think we all think it's obviously an important department, but there seems to be an idea that if it was elevated to a full, separate department, that there might be, funding available federally, that, enhanced federal funding that the department could apply for. My understanding from our ranker is that this is something they did in Connecticut, and it was able to improve the services that the department was able to provide to their state's veterans.
I will look into that and see what we could do about that.
Yeah, I think it's definitely something worth looking into. I think it helps enhance the ability for grants and things like that. So thank you, and thank you for your service to our country and all of the veterans in New York State. Especially during these very very trying times. So thank you for being here this afternoon. Thank you very much.
So now I will politely thank you very much and excuse you for the afternoon, and start to call as a panel the next 5 witnesses. And so the rules change a little bit, everybody, for the rest of the hearing. For the panels we're going to go through, each individual testifying gets 3 minutes to testify, which means don't even try to read your testimony. You've given it to all of us. We are all qualified readers, and you are supposed to highlight. I saw that hand, Assembly Member. You are supposed to prioritize your bullet points in your 3 minutes. Then we, the legislators, only get 3 minutes each to ask the panel and get our answers. So it's a little bit like speed dating. That's how I describe it every day of our budget hearings, as we try to now move a large number of people through. But please know, your testimony is available for every legislator to see and for the public to read online. Even if you didn't get into the slots to testify today, you can still submit your written testimony, which will go up online for everybody to review in moving forward with our efforts during the budget process. Because I know for certain hearings like tomorrow's, we had to turn away as many people as we could accept because there were so many people asking to testify. So I'm going to just start now. I'll list you in order and then you'll start rolling in. The New York State Kinship Navigator, Ryan Johnson. The Prevent Child Abuse New York organization, Jen O'Connor. The Families Together in New York, Paige Pierce. The Northern Rivers Family of Services, William Getman. The New York State Network for Youth Success, Trudy Morgan. And do we have Ryan with us?
I am here.
Number 2, Jennifer O'Connor will not be here.
And no Jennifer O'Connor. Thank you, moderator. Please start, Ryan.
Thank you very much, Chairperson. Good afternoon. Thank you for the opportunity to speak on behalf of the kinship community today. The term kinship care refers to family members, often grandparents and other close relatives or family friends, who take on the full-time care of children when they are not able to be cared for by their parents. In New York State, there are an estimated 195,000 children being raised by kinship caregivers. Most of these children, about 188,000 of them, are being raised outside of foster care and therefore have limited access to resources. I am here today on behalf of those caregivers who have been asked to step up in times of crisis to raise children that they were not expecting to raise and who need support. I'm here for the 72-year-old grandfather who is caring for his disabled wife and who in 2016 was asked by Child Protective Services to take on 3 of his grandchildren, all under the age of 6 at the time when his daughter got caught up in the opioid epidemic. 5 years later, he still has all 3 children in his home, and he was only connected to kinship services 3 weeks ago. I'm here for the 56-year-old widow who back in April was called by her niece, who was incarcerated and facing removal by CPS, and asked if she would drive across the state to pick up a newborn from a hospital, and who, with only 5 days' notice, prepared to take on the responsibility that most parents get 9 months to prepare for. As a result, Deanne has had to rack up thousands of dollars in credit card debt to pay for the expenses of an unexpected child. These are not abnormal cases. This is what we work with every day. Over the last decade, much of the policy focus around kinship care has been around children living with relatives who are made foster parents, and little attention has been paid to kinship caregivers who are caring for children outside of foster care. As a result, fewer resources have been allocated to this population to help sustain families in need. In New York, funding for kinship services has fluctuated over the past decade, but since 2016, the legislature has funded kinship services at a total of $2.5 million. This funds 14 localized case management programs and a statewide kinship navigator. Last year, the kinship budget line was cut by $950,000, leaving OCFS with the option to cut the services or to find other funding. Thankfully, they found funding to continue the programs for 1 year. I'm here to ask the legislature to choose to prioritize these families by restoring the funds lost last year. These programs are here to help kinship families navigate the complex system of benefits and services that they are eligible for, and they help stabilize families for a fraction of the cost of foster care. During the pandemic, these programs provided valuable resources like giving away hundreds of tablets, increasing access to food, and assistance with benefits. In the Consolidated Appropriations Act, the federal government incentivized states to invest in kinship services by offering a 100% match of any dollars spent on kinship care during the COVID-19 pandemic. This would double the resources available to these programs, but the state needs to commit to funding these programs first. We're asking for $1.9 million for the local kinship programs and $100,000 for the kinship navigator. Thank you.
Thank you very much. Next up, Paige Pierce.
Thank you, Senator. Hi, my name's Paige Pierce. I'm the CEO of Families Together in New York State. We represent families and youth with lived experience in the mental health, addiction, child welfare, juvenile justice, developmental disability, special education systems. Our board and staff are made up primarily of family members and youth, myself included, who have lived experience in these systems. Like most advocates you'll hear from today and throughout your hearings these weeks, I want to talk to you about the effects of the pandemic on our children and families and the need to invest in the emotional wellness of children and families overall. But my role is different in that I'm speaking not as a provider or even as an advocate, but as the collective voice of the families and youth who are directly affected by the decisions you make in these committees here in Albany. Before the pandemic, we used to say our families are multi-stressed, and that's now compounded by the amount of stress that our families are facing, but also the number of stressed families and youth, causing more trauma and more adverse childhood experiences than ever before. And that speaks to the social determinants of health that you heard Greg Olson talk about earlier. I feel compelled also to just talk about the racial inequities because it's directly related to all of these issues that we talk about and can't be ignored. Each year at these hearings, and especially this year, I'm heartened to hear legislators and commissioners that are repeating some of the messages that we as family members have been saying for years. And we're so glad to know that we have allies in you. I heard Assemblyman Hevesy talk about that we might have a different read on how much money we have, but either way, it's about the priorities. Thank you for saying that. Senator Krueger talking about teen depression and suicide and the recognition that Human Services Committee and the Office of Children and Family Services play a role, not just the Office of Mental Health, in everyone's emotional wellness. Senator Brisport talking about the resources that are available by raising revenue to make the necessary investments. Thank you. And Commissioner Poole, when talking about that it's a good thing to be downsizing our facilities and that it's not a reflection of poor services, but rather it's a good thing that we're closing facilities. We want to thank you for acknowledging the absolutely critical importance of making these investments. It's taken a worldwide pandemic to draw attention to what oppression looks like and the importance of everyone's wellness. And if ever there was a year to finally make these investments, this is our year.
Thank you. I was surprised there were a few seconds left. Northern Rivers Family of Services, William Getman. I think your mute is on.
I'm muted. Let's try this again. Thank you, Senator. Thank you, Chair Weinstein and members of the legislature. First off, I want to thank you for your public service today, because like everyone in New York, you're making a real difference. Northern Rivers is a human service agency across New York State. We serve 18,000 children, adults, and families every year. Our 1,400 person workforce provides mental health services, child welfare services, and education services. We provide residential care, clinic care, and outpatient services. I'm here today on behalf of the 4.1 million children across New York State. You've heard through your hearings the awful impacts of COVID-19 upon mental health, poverty, income, suicide, stress, depression, and substance abuse. These conditions are awful, and together we must fight them. Yet the governor's budget proposes a 5% reduction in child protective services, child preventive services, foster care services, adoption subsidies, and kinship programs. How can we, in this time of increased need, additional stress, and trauma, cut services that protect children and keep families together? As Assemblyman Hevesy pointed out earlier today, the roles of foster care will go up if we cut preventive services, and families will end up going into emergency rooms. I call on you today to reject the governor's 5% reduction. During the pandemic, thousands and thousands of direct care workers came to work every day. They left their homes, they left their families, they came to care about our kids. Kids in foster care who couldn't go home on a home visit on Christmas, kids who have been quarantined. These are staff making $14 an hour, and yet we call on them as essential workers. We made them come to work. We asked them to take on the risks of the science. Yet there's no COLA in the budget. Why can't we provide people caring for our kids more than $14 an hour when we pay people who deliver us coffee the same amount? Turning to juvenile justice, we support the closure of the 4 OCFS facilities. Yet we encourage you to create a reinvestment fund to allow for the transition of young people back to their communities, the provision of safe services in the community, and early intervention services. Lastly, we want to comment on the marijuana proposals as revenue. We encourage you to look at policies that in fact care for our communities that have been impacted. Think about the impact on marijuana on young people's brains up to the age of 26, and provide prevention services. And finally, I will add that the raise the age provisions in the governor's budget creates undue stress upon private agencies, and we ask for a short-term fix to that. In closing, thank you for your service. Thank you for what you do for the care of kids and families. And when this COVID epidemic is over, I invite you to come and meet the first responders on our campus in Albany. Thank you very much. Be safe and make New York strong.
Thank you very much. And last on this panel, Trudy Morgan.
Good afternoon, and thank you for allowing me to testify today. My name is Trudy Morgan, and I'm the Policy Director at the New York State Network for Youth Success. In the wake of COVID-19, after school, summer and extended learning programs are crucial in helping young people and their families. These programs provide services and support that promote resilience, provide protective factors, and elevate assets that can help overcome the effects of trauma adversity. Even in spite of program disruptions caused by COVID-19, the vulnerability of the after-school and childcare infrastructure, and the limited resources to work with after-school programs, many driven by passion and commitment, continue to meet critical needs to adapt high-quality after-school programs to support youth and their families. But these programs have been hit hard by the pandemic too. Following school closures, many programs had had to transition into new spaces to operate. They've had to cover additional cost of lower staff ratios, longer hours, and enhanced protocols for cleaning and equipment. Many have had to close or bear the brunt of running their programs at unsustainable levels due to unexecuted contracts, delayed payments, and guidance. The need to rebuild the current after-school infrastructure, which was fragile before the pandemic, towards a more robust system is paramount at this time. I'd like to focus on 3 main acts today, as our full budget priorities are detailed in the written testimony. Firstly, we asked the state to make no cuts to after-school funds this budget season. And this includes restoring the $5 million in the Advantage After-School program and the $2.2 million in the Youth Development program. Secondly, we ask that the state directs $250,000 in quality funds to sustain the mobilization and coordination of school age childcare programs, many of which are after-school programs. Without these funds, New York truly will have no statewide support specified for SAC providers at a time when it is most needed towards recovery. And then thirdly, we urge you to dedicate a quarter of revenue from adult use cannabis, if it is legalized, to increase access to affordable, high-quality expanded learning programs. Alaska, which recently allocated 12.5% of revenue from the legalization of adult use cannabis to after school, data shows that youth who participated in programs just twice a week were 40% less likely to use marijuana. Leveraging cannabis revenue is an intentional investment in a portfolio of work around prevention for young people. And New York State, which is a leader in the after-school field, cannot miss the opportunity to do the same. In conclusion, I want to note that the network also supports the Win and Begin in New York agenda. Thank you.
Thank you.
Thank you. So, yes, we have Assemblyman Ra, I believe, to ask a question. Oh, it was the other panel. I'm sorry. Okay, so then I don't, well, we do have our chair, Andrew Hevesy, to ask a
Thank you,
question.
Madam Chair. I'm a lot more fun than Ed Ra anyway, so.
Not sure.
Okay, so thank you to all of those who testified. There was one omitted from your panel, Jen O'Connor, who couldn't be here for personal reasons, but I would encourage all of my colleagues to read their Prevent Child Abuse's testimony. It's very informative about ACEs and trauma. And I do have questions for each of you, but I got to go quick. So I'm just going to ask them, and maybe Helene will give the panelists a second to answer. So for Ryan, my friend, first, I'm not done with uncapped reimbursement. We'll come back to that. But the question for you is, wouldn't it make sense, since the Consolidated Appropriations Act does 100% federal match, that now is the time to really invest in kinship program? That's a leading question. But before you answer, let me get my other questions, Helene, if I can. Yeah, I think this is the quickest and best way to do it, so I apologize. Ms. Pierce, for you, thank you for your testimony. You have some recommendations, particularly about preventative services here, that are really interesting, targeting them towards specific populations, and then also, well, you know what, if you could use some time to talk more about what we should do with preventative services. I am against those cuts, but if there's a way we can, you know, be more robust, particularly now during COVID, that would be very helpful. Let's see, Mr. Getman, I'm sorry to have to do this way, my friends. So Mr. Getman, I am with you about, first of all, thank you for all the work you do at Northern Rivers. And, you know, I agree in rejecting the 5% reduction. I didn't have time to ask the commissioner about your proposal to reinvest the closures money into a funding stream. So if you could elaborate on that, that would be great. Look at this, Helene, I've got some time left. And one more, if I can. From Ms. Morgan, I will tell you last.
They need to answer also.
Within that time? No.
Yes.
Okay.
Yes.
So, Ms. Morgan, just want to tell you that we will be fighting to restore all the cuts, particularly to the Advantage program. It was wrong of the governor to cut that and leave the other money for after school. I'm done. You've got a minute. Good luck.
Briefly, thank you so much. It would be amazing if the state wanted to invest more money, because yes, there is a 100% match. The state of Ohio invested $8 million in its kinship navigation program. So that would be a great bar to try to hit.
Thank you.
Mr. Getman, do you want to answer the?
$22 million of the savings, if reinvested into communities like the mental health reinvestment, will make sure our communities are safe. Potentially, we could use that to drop some federal Families First money, and it is a good transition, so we don't have to reopen facilities.
So I think, look at that.
I'll just say that, you know, an ounce of prevention is worth a pound of cure. And we know that there's a lot of work that can be done to help prevent some of the more costly things on the other end of the stream, if we can address early.
Thank you.
Thank you. Helene, I just have one question, if I might.
Go for it.
Thank you. And for Ryan. And don't take it wrong, but I'm getting older. So I was working with families in kinship foster care back in the early 90s. And we were all saying if we could only explain to them why it's such a better option for them and their children, their grandchildren, very often it was grandchildren or nieces and nephews, rather than trying to go it alone. And there'd be all these reasons that the government agencies really wouldn't want to let them on kinship foster care because it costs us more money, for example. I feel like we've got it backwards. We should make people have to take kinship foster care. And I know you're going to tell me there's risks with that, but it's infuriating that there are generations of children who were raised with no money in the house, with their grandparents trying to hold on to apartments they could barely afford before they were suddenly grandparents who were being parent guardians, and that we're letting ourselves off the hook by just making it sound too complicated to try to get kinship foster care, and hence they don't. What do you think of my idea of like making it a requirement?
I think there's benefit to having family choice in the direction of custody that they go. OCFS has incentivized counties to use more kin as foster parents. They've offered waivers of some non-safety standards, so making it easier for a kinship caregiver to become a foster parent. They've encouraged counties who aren't using that waiver to go ahead and start doing it. They've given guidance recently on the emergency certification process, meaning when a kinship caregiver is identified and potentially could become a foster parent, they make it so that they can become a foster parent right away and go through training after. So OCFS has done a lot to try to make the pathway to foster care easier. And frankly, 40% of our foster care in New York State is kinship foster care. So about 7,400 children are in kinship foster care. I'm here today on behalf of the kids that don't make it into kinship foster care. In the written testimony, there is a cost study analysis that the Kinship Navigator did. You know, it costs a lot of money to have a kid be in foster care. You can offer supports because there are financial incentives that are available for kinship caregivers who don't make it into foster care. It's about $430 per month for one child in your home that you can get through public assistance. If you can robustly fund the support services that we have already started, these little seeds around the state, there's 14 of them in the Kinship Navigator, everybody could have access to the supports that matter to them and ensure that they get that financial assistance. Currently, only 15% of eligible children get the financial assistance.
And that's what frustrates me. I'm not trying to say, don't let grandparents raise their grandkids. I'm saying make it that the government has to help them get the kinship services, because grandparents are going to be better caregivers. They love these kids, right? Families, most of the time, going to be a better option, and government knows that. So we're just trying to make it too complicated for people to actually get the resources that they need and they deserve to raise these correctly. And I'm taking up too much time. I'm done. Thank you, Helene.
But if we cut 5% from local government, we can't do that, Senator. They're going to have less people to do the work and less preventive services.
Fair enough.
We go to Assemblywoman Burns for 3 minutes.
Some of my questions were answered. Thank you very much, though. I appreciate it.
Oh, okay. So thank you. We are no more questions for this panel. So we're going to move on to panel B, which is Schuyler Center for Analysis and Advocacy, Dee Dee Hill, Policy Director, Council of Family and Child Care Agencies, Kathleen Brady Stephen, President CEO, Early Care and Learning Center, Meredith Chimento, and Daycare Council of New York, Gregory Bender, Director of Public Policy. So if I see they're all here, so why don't we start in that order with Dee Dee Hill first?
Good afternoon. Thank you to the chairs and members of the respective committees for this opportunity. Thank you for all that you do for New York and for your stamina today. For almost 150 years, Schuyler Center has been advocating to strengthen public systems that serve low-income and disenfranchised New Yorkers, particularly children and families. I just want to start with a general observation about this executive budget. Much of this budget, and particularly the 5% across the board cuts, are really deaf to the reality that this pandemic has not impacted all New Yorkers equally. It's hit low-income communities, communities of color, immigrant communities, and our families with children disproportionately hard. But we think that there is time and real opportunity to craft a final enacted budget that centers our children and all the communities hardest hit by the pandemic. So first, I want to touch on an issue largely unmentioned in the executive budget, and that's the issue of child poverty, which has surged since the pandemic hit New York. We urge New York to make a public binding commitment to cut child poverty in half by 2030 and dedicate significant funds this year to set New York on a path to meeting that target. We urge the legislature and the governor to include the Child Poverty Reduction Act, which is Senate Bill 2755, Assembly Bill 1160 in the final enacted budget. And this is so we can ensure that child poverty is the first issue the state tackles in our recovery efforts. In the area of child welfare, there are also real opportunities particularly in the area of family strengthening and prevention as New York begins to implement the Federal Family First Prevention Services Act. Unfortunately, as Bill Getman already mentioned, the executive budget proposes a 5% reduction in preventive, protective, independent living, adoption, and aftercare services at exactly the time New York should be bolstering these services. We urge the legislature to reject this proposal. Also of concern is the proposed cut to foster care. The executive budget proposes $11.2 million in cuts, and this is on top of a $62 million cut that was imposed in 2017. This is not the time to be cutting foster care. We do want to, there are a few good points. We welcome and support the executive budget's proposal to expand the Family Assessment Response Program statewide. This is good for families. Also applaud and support the level funding for the Family First Transition Fund. Shifting, am I done? Okay, thanks.
Yeah. I just want to warn everybody to keep an eye on the clock. The numbers go down to 0, but then we start to go up if you're going over. So we're not giving you extra time, it just shows how much time you're going over. So next, Council of Family and Child Care Agencies.
Thank you. Hello, my name is Kathleen Brady-Stepien. I am the president and CEO of the Council on Family and Child Caring Agencies, or CAFCA. We are a statewide membership association, and we have as our members the more than 100 child welfare nonprofit organizations in the state. New York State's commitment to state funding of preventive services that provide support to families has been far and away the best in the country. And for that reason, it is deeply disappointing that there is a 5% proposed cut in this executive budget to reduce that state commitment to counties down to 59% reimbursement. There is also a proposed elimination in the executive budget of the Community Optional Preventive Services, or COPS program, which provides primary prevention. If we are truly committed as a state to racial justice and equity, we would be investing more in prevention and primary prevention, not less, because families of color are disproportionately represented in our child welfare system. Especially given the increased family and community needs we have seen due to COVID and the fact that we will be transitioning into the Federal Family First Act implementation this fall, we need to do everything possible together to strengthen the front end of our system in prevention. So we're asking for your support in rejecting the executive's proposed 5% cuts to prevention and rejecting the elimination of the primary prevention program, COPS. In our foster care programs, we need your support in asking for the state to release the MSAR rates. We're now more than halfway through the fiscal year and providers still do not have their rates. And additionally, I can't state strongly enough that we need for our providers to be held harmless from having any of the federal COVID-19 relief aid they were able to access, such as the Paycheck Protection Program, from having a negative future impact on their state set rates. And finally, we were very concerned to see language included in the executive budget briefing book this year that stated New York State would not adhere to its original agreed upon terms with the foster care agencies that partnered with the state to become Raise the Age providers over the past few years. Providers were not given any prior notice that the state would change the financing structure of this program, and they're now at a less than 60-day notice on it. If there is no change made to this decision, providers will be forced to make difficult decisions to close down capacity. We're asking for your help in including language in your One House budgets to support these programs in making sure the state fully executes its original agreement with them to pay based on capacity to September of this year. We truly believe that if we can go ahead based on the original terms agreed to with the state, we have an opportunity to partner with the state to preserve and to transform essential residential capacity for our children and youth with higher acuity, which are the needs we'll see for our system under the Family First Act implementation changes ahead. Thank you.
Thank you. Early Care and Learning Council.
Hello, I'm Meredith Chimeno, Executive Director of the Early Care and Learning Council, the membership agency for the 35 child care resource and referral agencies in New York. CCR&Rs and child care businesses have been a critical component of reopening the economy and moving New York forward during the pandemic. Deemed essential businesses, child care remained open with decreased enrollment, increased risk, and additional expenses to operate. CARES funding was set up to assist child care providers during the pandemic, yet the staggering loss of revenue, increased costs for cleaning, and rising fixed costs have forced programs to permanently close. Today in a meeting with Senator Hinchey, I listened to a 26-year group family provider reference that she saves for rainy days, not rainy months. Childcare was at a tipping point prior to the pandemic. It has now fallen over. Small businesses, predominantly owned by women of color, have exhausted their life savings to continue to care for our children. ECLC supports the increased investment of $15 million to support infant toddler resource centers. CCR&Rs employ infant toddler specialists, mental health consultants, which work to eliminate the suspension and expulsion of Black and brown children in childcare. Across the nation, over 250 preschoolers are suspended each day, and Black students are suspended and expelled at 3 times a greater rate than white students. We must do better to equip our providers with the appropriate techniques to help our children thrive. Currently, there are only 58 infant toddler specialists and 28 mental health consultants tasked with serving the 18,000 regulated programs in New York State. Additionally, we request $4 million to implement a technical assistance and business support initiative, TABS, which would focus primarily on family and group family providers to provide ongoing support and technical assistance. Each CCR&R would employ an individual whose sole role would be to ensure that businesses operate in the green. They are equipped to ensure that their life savings are not destroyed, that they do not incur considerable credit card debt, rather that they operate as a business that is profitable. As evidenced by the quality of many CARES applications, we became aware that this is a critical need. Child care providers work 12-hour days, and throughout the pandemic, were then asked to add additional hours submitting complex applications and tracking receipts. The TABS initiative would assist the programs not only with the next round of CARES funding, it will help ensure that the child care system does not entirely collapse. CCR&Rs cannot continue to support the providers in the way that is necessary, as they have been flat funded like others for over 10 years. During the pandemic, CCR&Rs worked 7 days a week for months straight to support the CARES process. While the financial support received through the administration of the CARES funding did begin to cover while it did not begin to cover the costs associated with the increased staffing, we must do better in supporting not only our providers, but the early childhood community that is responsible for ensuring that all children have a safe, quality, and affordable early childhood experience. Thank you.
Thank you. And now Daycare Council.
Thank you so much for the opportunity to testify. My name is Gregory Brender, and I'm here on behalf of Daycare Council. We represent child care programs in New York City. and we are part of the Empire State Campaign for Childcare and Winning Beginning in New York and support their ask. As Meredith and others have pointed out, the challenges that childcare providers have faced during the pandemic are unprecedented. At the same time, I think the pandemic has really laid bare just how essential childcare is. Childcare programs have opened emergency childcare centers, and family childcare homes have stayed open through the pandemic to make sure that essential workers were able to go to work. We know that the economy cannot come back and that businesses cannot reopen if we do not build back childcare better. Therefore, we support the asks that we've laid out around with the Empire State Campaign for Childcare, which includes making no cuts to 2020 funding in childcare, providing counties with $370 million to make the childcare subsidy system more equitable by eliminating unfair eligibility variations across counties and communities, and prioritizing those families with the greatest need. Committing to eliminate expulsions and suspensions in childcare and pre-K. These are things that disproportionately impact children of color, and we want to set a statewide prohibition on these suspensions and expulsions and invest in the services that will support most vulnerable children, and investing $100 million to increase workforce compensation to a fair wage and improve childcare quality. The childcare workers are often not recognized as educators. They do not receive the same pay, benefits, or pensions as staff in public schools. And with the increased recognition of how important childcare is to reopening the economy, we want to see meaningful progress made statewide on ensuring that the compensation and support for childcare staff is equitable. Thank you so much for considering this and for all of your work on behalf of childcare and families. We are happy to answer any questions.
So we go to Assemblyman Hevesy for a speed round.
A speed round. I'm going to do it differently this time. So first, thank you all for your testimony. By the way, Meredith, hi. Yeah, there you go. Sorry, I had to do that one. So instead of asking you questions about things that I agree with you completely, I'm just going to take a second to explain, if I can, why I agree with you. I believe that for all policymakers, the number one enemy should be childhood trauma, adverse childhood experiences. If you attack childhood trauma, you can take a bite out of the worst societal problems, from homelessness, recidivism and criminal justice, kids failing out of school, alcohol and substance abuse, generational poverty. I can keep going. That's where the smart policy is. And I am disappointed in the governor's budget because we have just come through one of the worst crises in the history of New York State for kids. And if you ask any member, Senate or Assembly, tell me about how the kids in your districts are doing right now post-COVID, the answer is going to be pretty rough. So then we come to the budget, and we know that 325,000 kids are now newly near the poverty level. We know that 4,000 kids had their parents or caregivers die, and that a good portion of them, I think it's 23%, are going to head into foster care. We know about the racial inequality in all of our systems. And so what's the government response? How are we going to help these kids? How do we come to the rescue? Where's the cavalry? And then we see the executive budget. We're cutting preventative services. We're cutting foster care. We're cutting, we're consolidating programs. We're doing everything you should not be doing to respond to this. And I don't want to make this adversarial with the governor, but the public policy that has been proposed in the executive budget does two things that are absolutely non-starters for me. Number one, more kids are going to get hurt because of this. There's no way to explain your way out of it. I know that more kids are going to get abused, and I'll debate anybody. I won't do it in the minute I have left, but I'll debate anybody who wants to argue that cuts to preventative services aren't going to lead to more kids getting abused. That's number one. So I'd ask all my colleagues, stand shoulder to shoulder with me. We're going to be against child abuse. And then the second thing, for some of my other colleagues, I'm trying to get my more conservative colleagues on board here as well. From a fiscal perspective, this is remarkably bad government, because every kid who gets traumatized, and there's going to be tens of thousands, maybe hundreds of thousands of them, they're going to require more expensive services, period. So from a full-on budget perspective, we are hurting ourselves killing ourselves in the out years. And I know we're myopic as politicians, that we only look to the problems right in front of us. And unfortunately, that's the signal we're getting from the executive, but it's the responsibility of the legislature to be long-term thinkers. We don't want to hurt our kids, and we don't want to cost ourselves more money in the future, which is why all of the things in the first two panels that they're advocating for are right. And I'm right on time. How about that, Helene? Thank you, everybody.
Yes, so I didn't get your question, but
There was none.
we do have a question, I believe, from Assemblyman Ra.
Thank you, Chair. Kathleen, I have just a question. I was reading your written remarks, and I just was wondering if you can elaborate regarding the hold harmless and the impact taking that away will have on capacity in general, and also I had mentioned to Commissioner Poole this morning, whether the department was looking at the impact it could also have with the 853 schools, who obviously, you mentioned in your remarks that they got the funding for the capacity, but that was an additional cost. So what the impact is from both of those perspectives.
Thank you, Assemblyman Ra. And as always, thank you for your support of our 853 schools. So the 853 schools and the Special Act school districts were a critical component of the Raise the Age program. The original request for applications out from OCFS made it clear that the hold harmless for the 3 years would be only for the residential capacity and not for the tuition for 853 schools and Special Act school districts. It also, the state would not provide the hold harmless on the Medicaid and health cost side. So these providers went into this with, eyes wide open, saying, okay, we acknowledge, there will be potential impacts on the 853 school side and the special education tuition. And on the health side, however, we're going to have this 3-year hold harmless period from the state, which is not due to expire until September of this year. And indeed, we read the executive budget briefing book to say the state is going to go back on that commitment to providers and instead is going to make this change effective April 1. I am concerned, to your question, Assemblyman Ra, about the impact on capacity because absent any further guidance or discussion with the state, if these providers were simply to wait until April 1, and there's no change made to this decision, they don't really have a choice but to make the hard decision to perhaps close down that capacity. So what we'd really like to do is hold to the original timeline to September of this year and use the next 6 months that affords us to have that discussion with the state about what we need to do to transform the system for the Family First Act capacity.
All right, thank you. Even better than have a seat. I left 30 seconds.
Okay, we're not giving it to him. So I believe that's it for this panel. Thank you all for being here with us. So we're going to move on now to panel C. UJA Federation of New York, Ariel Savransky, New Pride Agenda, Cynthia Dans, Catholic Charities Community Service, Beatrice Diaz Tavares, and Human Services Council, Gabrielle Andrade. And if we could start with Ariel.
Great. Good afternoon. My name is Ariel Savransky, and I'm a policy and advocacy advisor at UJA Federation. UJA is one of the nation's largest local philanthropies. Our mission is to fight poverty, connect people to their communities, and respond to crises both locally and around the world. Thank you for the opportunity to testify and for all the work you do on behalf of our human services agencies. I'm just going to highlight 3 specific areas from my much longer testimony. First, supporting New York's nonprofit human services providers. Over the past 11 months, the pandemic has impacted the lives of all New Yorkers, particularly those living in poverty, and our network of human services partners has been on the front lines supporting these New Yorkers. However, the pandemic has exacerbated the fiscal challenges these partners face. We urge the state to honor state contracts and pay for services already delivered to residents and communities, and to recognize human services workers as essential and utilize a portion of any federal aid received to fund emergency pay for the services they provide to their communities. Next, Holocaust survivors. New York is home to nearly 40,000 Holocaust survivors, 40% of whom are living in poverty. Thank you for providing $450,000 to support services for Holocaust survivors in last year's budget, but more must be done. The pandemic has been particularly painful for survivors, many of whom already suffer from post-traumatic stress, anxiety, and other mental health complications. Additionally, as survivors age, their needs become more complex. We ask that the state invest $2.5 million in FY22 to fund care, services, and resources for Holocaust survivors living in poverty. And last, food insecurity. As I know you are all aware, rates of food insecurity have almost doubled in New York State over the last year, with more people relying on emergency food programs, food pantries, and other emergency food services. Food pantries report having to turn people away, reduce the amount of food distributed per person, or limit their hours of operation because they lack resources. In order to meet this increased need, UJ urges the state to increase funding for the Hunger Prevention and Nutrition Assistance Program by $16 million. As is, the current funding does not allow pantries to meet the standards established by the state, which requires that pantries distribute a total of 9 meals per guest. Increased funding will result in compliance and the ability to meet increased demand. Next, maintain the executive budget proposal to increase funding for the Nourish New York program by $25 million. So far, this program has been hugely successful, funding the purchase of 17 million pounds of food and benefiting over 1 million households and 4,000 farms. And last, maintain funding for the Nutrition Education and Outreach program. With many New Yorkers now eligible for SNAP, this program will ensure that New Yorkers actually access the benefits they need. Thank you for the opportunity to testify.
Thank you. Now, new Pride agenda, Cynthia Dams. Wait, Cynthia, you have to unmute yourself, I believe. I don't know that we can do it for you.
There we go. Hi,
Okay.
Cynthia Demise. Nice to see you all. Nice to see you, particularly Assemblymember Weinstein. Nice to see you well. Senator Liz Krueger and all members of the panel. A pleasure, really. My name is Cynthia Demise. I'm one of the founders of the New Pride Agenda. The New Pride Agenda is totally focused on transgender, non-conforming, non-binary communities, people of color, people of poverty, people that that meet at the intersection of Black and Brown identities. I am just an acting project director as a volunteer to help launch us. We hope to hire an executive director representative of the community soon. Item number one, just 3 items. Item number one, we are part of your community. We are your brothers, your sisters, your kids, your friends, families of friends, friends of families. We are you in the queer community. So we ask that as you pay attention to the safety net, for everyone experiences difficulties regarding affordable housing and homeless and food insecurity and income inequity, we too, our community, is part of that community. And we ask you to recognize and support us within that community. We go on record as also being supportive of additional tax increases as needed, because it is important that poverty is addressed in New York State, statewide. Now, who is New Pride Agenda? We began only a year and a half ago. We are advocacy, education, and support, just those functions. We work very hard as soon as Agenda came out to encourage mandated training. The governor put that in the budget last year for 340,000 state employees. We worked very hard to get Walking While Trans in the executive budget. It was in this year, and God bless the legislature. We cried and we cheered with our trans leaders when you passed Walking While Trans last week. We began 20 virtual town halls statewide, and while the first 2 months focused on COVID, the other 10 months are entirely focused on human service needs. And that is all the items all of my fellow panelists have addressed. What do we ask in a very narrow perspective? You kindly gave us $50,000 last year through OCFS for a downstate community organizer, Ahmed Mohammed. He's done tremendous work. We ask support for that and additional $50,000 for an upstate organizer out of upstate of Western New York. We need to hear and amplify needs of upstate. So if we did so much with one, imagine what we could do with 2 full-time employees. Thank you. Thank you all for your kindness and friendship and support. Thank you very much.
Thank you, Cynthia. Catholic Charities Community Services.
Thank you for the opportunity to testify on behalf of the Catholic Charities of the Archdiocese of New York, a federation of 90 contracting agencies and providers of social services. I am Beatrice Diaz-Taveras, Executive Director for Catholic Charities Community Services, one of these 90 human service agencies. I want to take my time and really focus in on some of the items that we want to bring to your attention. The first one is the contract withholding and rate adjustments. As you know, the initial threat of 20% contract withholding presented a significant operational challenges for our Catholic Charities agencies. While the reductions of these withholdings is now 5%, this is in one sense a relief, but it still remains contingent on federal assistance and our agencies are hurting. We are advocating for an annual 3% increase to contracts, amounts, and rates for the next 5 years, which would help ensure that New Yorkers are able to access the services they need as we defeat and recover from COVID-19 pandemic. The human service agencies were the front workers in this pandemic, and I think that needs to be recognized. We do support the governor's inclusion of the $250 million in the executive budget for affordable and homeless housing capital plan. And in addition, we also support the $128 million for the homeless housing and assistance program, much needed housing for all our communities. Catholic Charities also urges New York State to preserve the Liberty Defense Project and the Pro Bono Project with a continued $10.8 million funding to ensure all immigrant New Yorkers access to free, quality legal counsel. We also support the federal stimulus legislation, which has yielded significant investment and expanded access to emergency food assistance program, which my colleague just mentioned. But we really do recognize that these expansions are necessary, although they come from federal funding. And we do want to continue advocacy for this expansion of these programs. The food insecurity in our communities is very large. We also want to talk about mental health for children. The COVID-19 pandemic continues to have an effect on child mental health, and the state action to allow expanded availability on telehealth has been welcome, but maybe it should be made permanent. Right now, we receive month-to-month notification that it is continued. Let's expand it and make it permanent. And I see I have 16 seconds, so disaster case management. If FEMA authorizes submission, we do think that New York State should apply for disaster case management. It will help all those families who are suffering from COVID right now. Thank you. That's my testimony. And thank you for serving on New York State.
Thank you. Thank you. Now the Human Services Council.
Good afternoon, and thank you, Assemblymember Weinstein and Senator Krueger, for this opportunity to speak today about the human services sector. I also want to thank the committee chairs and the New York State Legislature Committee members on human services. My name is Gabriela Andrade, and I'm the Policy and Organizing Strategist at the Human Services Council, HSE, a membership organization representing over 170 human services providers in New York City. HSE serves our membership as a coordinating body, advocate, and intermediary between the human services sector and government. We take on this work so that our members can focus on running their organizations and providing critical direct services support to New Yorkers. Unfortunately, state budget cuts have impacted the human services sector. Since June of last year, the state has withheld 20% of contract payments while demanding providers to do 100% of the work, putting vital organizations in financial peril. Now, for fiscal year 22, the 5% withholding of payments on human services contracts comes at an immense cost and deep harm to the state's most marginalized communities and neighborhoods. The nonprofit human services sector employs over 200,000 workers only in New York City and has seen a net loss of 44,000 jobs since February 2020, with no job rebound in sight. This is especially devastating because New York City's human services workforce is comprised of 82% women and 80% people of color, making providers a vital employer in communities of color who continue to be the hardest hit by COVID-19. The state must pay all nonprofit contracts immediately, register late contracts, and put a hold to this 5% withholding on state contracts so New York residents who need critical health, mental health, domestic violence, housing, nutrition, and early childhood education services, to name a few, do not lose access to critical liveness of support, nor suffer any more profound economic and social harm. The state must also allocate funds in the fiscal year 22 budget for emergency pay for human services workers. The need for human services increased exponentially during the pandemic as residents from across the states struggle with economic uncertainty. Human services workers must be recognized as essential workers so they can receive emergency pay for the crucial work to combat COVID-19 or their communities. Finally, the state must invest in our communities by enacting sensible revenue raising policies, such as the ultra-millionaire tax and the Pio de Terra tax, so that we can overcome, as a state, the budget deficit. By raising revenue, the state will be able to invest in the human services sector to help stabilize communities ravaged by the COVID-19 and structural racism. Thank you for providing me this opportunity to testify. We value our partnership with the state legislature and know that you stand with us. Thanks.
Thank you. I did not, oh, we do have Assemblywoman Linda Rosenthal for 3 minutes.
Hi, I wanted to introduce myself to some of you. I'm Linda Rosenthal. I represent the Upper West Side, parts of Hell's Kitchen, and I'm the new chair of Social Services. So all your testimony was very interesting to me in that role. I see Cynthia Demise, who I last saw maybe a year ago out on the street in my neighborhood and her neighborhood. So hi again. I wonder if all of you could give some examples about how the 5% cut is affecting the work of not-for-profits, human services agencies. I know it would be really a dramatic cut. So maybe each of you could present like one example of how people would not have access to certain programs that are life-saving or life-enhancing. And Ariel, if you could start.
Sure. I mean, I think in general, just UJ as an umbrella agency, what we've been hearing from our nonprofit partners, and this isn't a secret, but we know that, in general, our human services contracts are often late. They often don't cover the full cost of a program. So to cut them even further just means that our partners have to find other ways to fund these critical programs that they're often still running as a result of the pandemic. So we have child care programs, we have mental health programs that are really struggling, food pantries that UJ has stepped in numerous cases to make sure that our food pantries have access to the resources they need to be able to serve the increased need. So, in general, it's really a system-wide problem, but those programs are some of the examples that we've been hearing.
Okay, thank you. Gabriela?
Yeah, so one of the examples I can think of right now is we were talking with our state partners from the mental health sector, and they were telling us how now with all these withholdings, there were already people on waiting list to get some services, to get mental health services, and now with the withholdings, the lines, like the waiting list is even longer. And it happens with all services, right? There were already people waiting to get many of these services, either like childcare, to get housing services. But now with the withholding, the numbers and the waiting, it's even longer. Mm-hmm. And we're in a crisis, we're in the middle of the pandemic. So like, what are people supposed to do, right? So yeah, that's one example I can think of right now.
Okay, thank you. And Beatrice, you have a few seconds, I'm sorry.
5% might not seem like much, but when our budgets are so tight, 5% is a lot. So you're talking about we have to scale down our workforce. That's why the waiting lists are longer, because we just can't hire. Also, we still have to pay our rent, and that is going up. We still have to pay our heating costs, and this winter has been a little bit more harder than last winter. So all our oil bills, all our gas bill, all of that is going up. And the 5% cut is just not feasible for us to absorb. But still, we have to provide 100% of the service. We can't forget that. So
Thank you. Feel free, members of the panel, to share some additional examples of your life with myself and Senator Krueger. Will make sure to distribute to all of the members. So I want to. I don't see any other questions from the Assembly or Senate. So I think we're going to move on to the next panel, Panel D, which is New York State Veterans Defense Program. Roy Deal, Lieutenant Colonel, U.S. Army retired. Justice for Vets, Clyde Tate, and New York State Council of Veterans Organizations, Kirby Hannon. So you can go in that order with Roy Deal first.
All right. Well, thank you very much. I appreciate being able to speak before you all today, courtesy of all this technology. Veterans Defense Program appreciates the 2020 legislative ads that provided a total of $720,000 of funding for our program statewide. Of course, with COVID affecting the state funds, we were only able to get by through the year thanks to lending. So we had to borrow a lot to make up for pay. I understand we're starting to have some funds trickle in. But also we were able to make use of technology to continue to serve our clients. So over the year, we had about 200 new cases. Again, we're dealing with the full gamut from child support all the way to second-degree murder. We're not restricted just to veterans treatment court cases and misdemeanors. We had 50 cases that were still continuing from prior years. And most of our clients, according to the information we're able to put together, some 80 to 90% of our clients are suffering from some kind of physical, mental, or emotional disability that they incurred in the line of duty while serving the country in one of the armed forces. In most of these cases, the conditions that they suffer from contributed a great deal to the reasons they're now involved in the justice system. What we're doing is we're helping their defense counsel understand who their client is in terms of their military service and what got them there, which then helps inform the prosecution, which otherwise wouldn't know and probably wouldn't care. Again, there are exceptions, but by and large, we're really letting the light flow in on these things. So without our help, more vets would end up in jail, fewer would be in treatment court, and we've calculated that the state would have had about $83 million more expenses just to jail these poor guys who needed help, not punishment. We're asking for 2021 for renewal of the $500,000 that the legislature and Senate, the Assembly and the Senate have together contributed for our statewide operations, and renewal of the $220,000 state sponsorship of our Long Island office. What we're doing is valuable also in helping defense counsel in general learn about their clients who are military veterans, so that again, not just if they have a client, but so they can deal with their clients overall, the whole population better. So I'll yield the extra 9 seconds of my time.
Okay, Clyde Tate, Major General, U.S. Army retired.
Thank you very much. I'm Clyde J. Tate, the second 31-year veteran of the United States Army, last serving as the Deputy Judge Advocate General. Thank all of you for your time, and I'm impressed by your resilience, having been watching you all day long. Well done. As proud as I am of my own service, I have even greater pride in my father's service. I'm an Army brat. He served 36 years as a combat infantryman, 2 tours in Vietnam, And the country, by and large, made a choice when he returned, he and his fellow soldiers, and that was to turn their back on those veterans and to turn their backs on those veterans' needs in a hope, I suppose, that we could just forget about the war. Well, that's not a very good choice to make. And I think now we have another choice presented to us that I outlined in my written statement that I would urge New York to pursue, a choice that takes into consideration the unique needs of our veterans, their unique experiences, and when they do intersect with the criminal justice system and law enforcement, that they're placed in a system in veterans treatment courts that respond to and are well attuned to their unique and experiences. I was still on active duty when I visited Judge Russell's court in Buffalo, and I walked away from that experience believing that veterans treatment courts represented the government, the courts, and the community at their absolute finest. Veterans treatment courts restore lives. They don't just restore them, they at times save lives. They restore hope. They save money for the state. They, at the same time, in doing all of that, they still provide for accountability and safety in the community. Now, the 400 plus veterans treatment courts in the country, as well as many thousands of vets and their family members served by those courts, owe their success to what really started in Buffalo, New York in 2008 with Judge Russell and the veterans treatment courts. New York now has the opportunity to take the next step and do what I've not seen done in any other jurisdiction, in any other state, and that is place a veterans treatment court within reach of every single veteran in your state. You have that opportunity with this initiative that's on your plate now, and I urge you to give favorable consideration to and support for that. This is yet another opportunity for New York to not just say thanks to a veteran for his or her service, but in fact to take action that shows that you recognize the value of their service, their sacrifice, and the contribution and the impact of that service on some of them. So again, thank you for your time today, and I ask your support for and favorable consideration of that transfer initiative that allows courts to transfer from a county that doesn't have a veterans treatment court to a county that does. Thank you very much for your time.
Kirby, please now.
Thank you very much. Thank you, Assemblywoman Weinstein. So I'm here to talk about the Dwyer program, and I've been doing that for about the last 8 years, and you've all listened, and all I can do is thank you for being here today, and thank you for being there all those 8 years, because it's got an understanding now, and it's got funding. Could always use more, but nonetheless, here's where we are. But what I want to do is try to discuss today very quickly, how does it work with VTC, Veterans Treatment Court, and VDP, Veterans Defense Program? The mentors from the ground up. It starts at the post level. It works in a peer-to-peer way. It's much like AA. All you have to do is go to the Y6 Vet website, Y6Vet website, and you can see all the programs that are offered to vets. It's brilliant. It's a Hudson Valley program. It's brilliant. It's also daunting, and I don't mean that in a critical way. It's daunting in that the mentor then needs to come into play, needs to work with the veteran and work their way through that type of a website, find the right service for the right and the right program for the right veteran. So that's how it works at that level. The mentor then, if they're good at what they do, they get chosen or they make themselves available to the Veterans Treatment Court. They become a mentor and they go into the court with the veteran and get the court to understand maybe some of the extenuating circumstances that the veteran is experiencing. And in a way, the mentor, the judge, the public defender in some cases, they become one. And the Veterans Treatment Court does a great job of connecting with the veteran mentors at the local level. And that needs to be emphasized as we move along. Finally, the mentor at the VDP level, it's the more serious offense, usually felonies. By the way, this program offers hope to all veterans. So this is important because when the veteran gets to the point where he or she thinks, and it's mostly he's in this case, that there's no other recourse, then VDP is there, and they're in hundreds of courts you know, representing probably a couple hundred vets a year, maybe more. But it's the number of courts that becomes important because they educate the court system on some of these stressors. And really, in conclusion, what I really want to do is say that we want to make sure that the Veterans Defense always includes people who know what a tunnel rat was in the Vietnam era, my era, or you know, where Kandahar is on the map, and what stresses may have occurred there. So there you go. You got my 5 seconds. Get crazy.
Okay. Thank you all for being testifying. We have a couple questioners. So Veterans Chair, Assemblywoman Dee Dee Barrett.
Thank you, Chair, and thank you, gentlemen, so much for being here. Thank you for your service. Thank you for what you do every day. And thank you for explaining what this Article 7 really will do. And Kirby, thanks for wrapping it all up with the other two gentlemen. I've had a hard time kind of getting a real understanding of this. And I really appreciate your endorsement and your clarity in you know, in really sharing what the impact will be. And I you know, sounds like it's all a good thing. I just want to get, you know, sort of open up the possibility of, is there something more that we should be doing at this point? Are we reaching, you know, all just by opening it up to a neighboring county, are we reaching everybody, or are there still gaps here that we're not addressing? And then obviously in the Dwyer funds, it's kind of the same question. There's only, I think, 25 counties plus New York City that are covered by Dwyer funds, even when we get it. And obviously we know that this year was not, we didn't even see it fully distributed. So I just love your thoughts, since the three of you are here, to on how we might be doing this even more effectively and expansively to cover all of our veterans in New York State.
Madam Chair?
Yes.
Assemblywoman Barrett, yeah, there is something I think that I think we looked at today, and that was the testimony of Joel Evans from DVS. And one of the things I think that that DVS would embrace, which may get the Dwyer program closer to the veteran service officer within DVS, is to maybe require, however it may happen, get the veteran service officer through in DVS, and also the VFW's veteran service officers and others, to take the accreditation course that OMH has, so that the peer-to-peer counseling that goes on would be more informed. And even if it happens at a two-step level or whatever it might be, that way, I think the questions that came up regarding OMH and DVS and whether the program should be in one place or the other and that sort of thing, maybe that could be addressed in a step-by-step fashion. And I think the first step could easily be that the VSOs, veteran service officers, who are very, very knowledgeable anyway, would become more inculcated in the OMH accreditation peer-to-peer program, take it online, et cetera. I don't think there's any cost involved. There you go. That's my thought.
Okay, thank you.
Yeah, I just wanted to kick in that the success of a VTC depends a great deal on whether or not it's supported by the district attorney. A lot of district attorneys just do not appreciate treatment courts in general and appear to have zero regard for veterans, I'm sorry to say. So without that support, well, there's just only so much you can do. Places where it's successful, it's got the support.
Could they sabotage this in a county if that were their attitude?
I believe very much so. Sabotage is a deliberate, negative word, but nonetheless, the bill as is requires the consent of the receiving attorney. If district attorney, if the attorney general in the receiving county doesn't like their VTC anyway, then the likelihood they're going to accept someone from outside of the county, it's kind of nugatory.
In 10 seconds, this initiative fills one of the biggest gaps you have, which is a group of veterans in your state not otherwise having access to a veterans treatment court. And this fills that enormous gap in a very manageable way. Thank you very much.
Thank you.
Thank you. So I don't see any other questioners, so thank you all for the work you do, and call on the next panel, which is New York.
Raise his hand. He didn't have it on the computer. Yes, Senator Brooke.
Senator Brooke.
Thank you, Madam Chairs. I just want to thank the three of you for this work that you're doing and the service to our veterans. Major General, we don't ever want to have a vet come back home and experience what your dad did so many years ago. I think it's terrific what we're doing in the court area, the ability to cut this program back if someone doesn't want to accept something, but something we have to take a look and make sure we don't allow that to happen. Kirby, you've been there forever and a day on the Dwyer program, which is greatly successful, and working with these folks to do that. I think you guys are part of the bright lights in how we're trying to help the veterans. And hopefully these programs are going to be accepted across the state. Our veterans will get an opportunity for a better swing at the bat when they get into the court system. And I just want to thank the three of you for what you're doing, both now, after your time in the service, and while you were on active duty. And just want to say thank you so very much. Thanks.
Thanks, sir.
Celine, now we have one more assembly member and one more senator.
Right. So we go to Assemblyman Jake Ashby, rather, our ranker on veterans, past 3 minutes.
Thank you, Madam Chair, and thank you, gentlemen, for being here today. Thank you for your testimony. In terms of being able to build on this program and really make it sustainable, have you seen examples in other states that you feel like we could be doing here in New York that would help? And it's a question for all of you.
You know, part of what we do at Justice for Vets is training and technical assistance across the country. What you are undertaking, and at least what you are considering, is honestly one of a kind in making this a statewide program to which all of your veterans benefit, and a way for you to fulfill the obligation to all of the veterans in your state, not just the select few whose judges have seen fit to implement a court. Are there other programs to emulate? I'm certain that there are, but your 36 veterans treatment courts, especially those that incorporate mentors, that incorporate all the right community players, all of the right VSOs, you're doing it absolutely right. We can always, everyone can always get better, but you are absolutely on a solid foundation. I think this initiative will help sort of take you to the next level, help you go statewide, and then you just continue to get better. With each little bit of success, you'll build on that to have statewide success. But again, if they visit Judge Russell, if they visit the court in Rochester that I visited, they'll see how it's done and how it's done well. Thank you for your question.
I have to add that our Veterans Defense Program still is relatively unique in the nation. So where there are VTCs elsewhere in the country, it seems that each defense office stands pretty much on its own devices. So here in New York, we're able to provide a consistent, available statewide service to all of the courts, all the county defenders, including the counsel that veterans might hire privately because they don't qualify for a public defender. So we're helping everyone connect with that service experience, regardless. Again, New York is in the lead in that, and I hope we stay that way.
Oh, the Dwyer program, same way. It's unique, and you know, you're to be recognized for it. The feds are just catching up with it, and they haven't yet. And thank you very much.
Thank you all.
And thank you. Now to the Senate.
We have Senator Sue Serino.
Thank you, Madam Chairwoman, and thank you all so much for your service. And the Dwyer program, I know how valuable it's been in our district. I share the district with Assemblywoman Dee Dee Barrett. And we've had tremendous results. I always say you get the most bang for your buck with those dollars, and I would really love to see it go statewide. Very encouraging about the veterans treatment courts. I know my guys in my area would really love to see it come to us. And then I just have a question about like the VFWs and the American Legions. They've always struggled, and now through the pandemic, they've really hit hard. Do you guys have any idea of like what kind of a role that the state could play? Would it be through grants, you know, getting younger people involved? That's always been an issue that we've been working on, because we really need to make sure that they survive this pandemic.
I think I'd like to answer that because I'm also the legislative advocate for the VFW as a volunteer. And honestly, you know, veterans have been self-funding their programs for 50 years, and we do need some attention to charity gaming. I think that grants and a program to direct posts to grants is an important initiative. And I know that Senator Brooks has brought that up from time to time, and that's something that perhaps we could do. Also, too, though, let the posts do their own self-funding because, as I said, it's something that they've been doing and doing well for a long time.
Thank you, Kirby. And I just want to say thank you to Senator Brooks, too. He's always been such a champion for our veterans. I appreciate all of his hard work. So thank you, everyone.
Thank you.
Thank you. I believe that there are no more, yes, there are no more questions. So I just want to join in thanking you for your service and for being here today and helping provide us with some information. We're going to now move on to Panel E, New York Statewide Senior Action Council, Gail Myers. The Association on Aging in New York, Rebecca Trevi. Services and Advocacy for Gay, Lesbian, Bisexual, Transgender Elders, SAGE, Melissa Squires. Live on New York, Caitlin Andrews, and National Federation of Blind New York State, Raymond Wayne. So Gail, if we could start with you, that'd be great.
Thank you. Thank you on behalf of New York Statewide Senior Action Council and also to the staff behind the scenes who make virtual testifying very easy for us today. I want to start out by saying that if the pandemic taught us anything, it's the need to make sure that the infrastructure of our public health and community-based services must be strong. And we urge you to move away from austerity budgeting. That has been what we have seen for the past decade. You really need to invest in services. They have been withering due to flat or cut budget funding for years. Raise the revenue to do that. We're all behind you. Like your own constituent services, Statewide Patients' Rights Helpline has been responding to an extraordinary amount of concerns during the past year, and we have worked hard to address those. Thank you for increasing our budget last year. We are distressed, however, that NYSOFA still has not contracted with us for any of the 2021 appropriation for these services. So we would like to ask you to reappropriate that money from last year moving forward and ask you once again to add legislative funds to the budget of $200,000 to support our Patients' Rights Helpline program. Regarding services that are offered through the State Office for Aging, we urge you to increase funding to meet need. And what I want to particularly stress for you is that over the years, the cost of living adjustment has been deferred. Now, that happens in other agencies too, but in the mental hygiene agencies and the health agencies, they are getting hard cash for the minimum wage increase, and NYSOFA services have not gotten that. So there's disparity there. We wanted to stress that there's a home care worker shortage. There are several proposals to address that we hope you include: the Home Care Jobs Innovation Fund, the Invest in Care Act, and the Fair Pay for Home Care Act. And we want to make sure that those apply to ISIP as well. We have extensive testimony on the Ombudsman program and on the improvements needed to long-term care. I will just remind you that the controller found that there was only half the number of local staff needed for the Ombudsman program to meet the minimum standards, and that about a third of facilities had not been visited by an Ombudsman, and that has only gotten worse since the pandemic. In terms of improvements to long-term care, thank you for allowing us to testify last summer. We particularly want you to look at the governor's budget narrative on enhancing nursing home quality of care and get some specifics that are related to the language he will be proposing in regulations. Lastly, two lastlies, we recommend that you increase the Medicare Savings Program to 200% of the federal poverty level, and that you expand the EPIC program by supporting Senator May's bill, Senate 4603. Thank you.
You're on mute, Helene.
I realize that is Rebecca. It's time for you to go speak.
Hi, thank you so much. And I want to say thank you to all Senate and Assembly members, especially to Senator May, who chairs the Aging Committee, as well as our new chair in the Assembly, Assemblyman Kim. Thank you all so much. My name is Becky Prevey. I'm the Executive Director of the Association on Aging in New York State, and I represent the 59 offices for the aging throughout New York State, who work with a variety of about 1,200 subcontractors to provide services. I want to say first and foremost, I could not be more proud of what this network has done through this pandemic. I think all of you have seen it in your districts. And I think our relationship with all of you, as well as the New York State Office for the Aging, could not be a more positive one. So thank all of you. I have submitted extensive written testimony, which I'm not going to go through, but I wanted to highlight a couple things. First and foremost, we serve about 1.3 million older New Yorkers each year and their families and caregivers. And we do that in a variety of ways, from our most intense programs for home care services to wellness programs and volunteer opportunities. New York State is unique. We're fourth in the nation as far as the 60+ population, and we really have an extensive public-private partnership across New York State to provide services. We've also seen a huge impact in this population of service providers as well as older New Yorkers themselves through the COVID-19 pandemic. I wanted to start by touching base on the unmet need or the waitlist information that was referenced earlier today. We do have extensive waitlists throughout New York State, and those continue to grow. And it's something that we really take a look at from a Medicaid standpoint. So currently we have thousands of older New Yorkers waiting for a variety of services, whether it be home delivered meals, home care services, just to kind of name a few. And what we know from our own data is that these are non-Medicaid eligible individuals. So we looked at what happened to someone that's on a wait list in New York State, and we found that about 10% of anybody on a wait list goes directly to a skilled nursing facility, and another 6% spend down to MLTC or community-based Medicaid coverage. What that means, as all of you are very well aware, is that the predominant payer source at a skilled nursing facility is on the Medicaid dollar. To clean up our current wait list, we would be looking at an investment of about $27 million for the state, which would book against about $60 million just in skilled nursing facility state share Medicaid coverage. So really wanted to highlight that. I also wanted to talk about COVID-19 and the massive impact we've seen across the state. We've seen a 70 to 90% increase in our core services and the demand for those services that are absolutely life-sustaining. And we still aren't able to get our direct workforce vaccinated in a priority. So one of the things I wanted to raise to you, for legislative priorities, we are looking for the investment in our unmet need. We're also looking to restore the funding for Lifespan of Greater Rochester and their elder abuse prevention program. We're also asking for a $5 million increase in our ombudsman program. We've talked at length today about the need for investments into the ombudsman program, as well as a $5 million investment into technology services as we really try to broach the digital divide in the older population. Thank you.
Melissa now.
Great. So my name is Melissa Suarez. Thank you for having this hearing today. I'm the SAGE Senior Government Relations Strategist. SAGE is the first and largest organization in the country dedicated to improving the lives of LGBT elders. We provide services and programs for LGBT older people in New York City and throughout the state with our affiliates in Long Island, Hudson Valley, Syracuse, and Rochester. As this state continues to age, LGBT elders are a significant part of that growing population. More often, it seems invisible, disconnected from services, and severely isolated. LGBT elders are twice as likely to live alone, half as likely to be partnered, and more than 4 times less likely to have kids. LGBT older people need to rely more heavily on community services as they age. And now we have the pandemic. So not LGBT elders are really living in the epicenter of it, not only in their age, but because of high levels of underlying health issues like HIV and diabetes, high levels of poverty, food and housing insecurity, low access to healthcare and supportive services, isolation, and thin support networks. All of these are made even worse for transgender elders and LGBT older people of color. SAGE provides comprehensive services with our housing. We currently have housing in Brooklyn and the Bronx. There are 145 units at our Stonewall House in Brooklyn, and 83 units are now opening up in East Crotona in the Bronx. Both have set aside for formerly homeless. Both buildings are anchored by large SAGE centers. The one in the Bronx will be the largest SAGE center in New York City with over 10,000 square feet. And since the pandemic, we have transferred all of our services to virtual and telephonic formats. We've been able to offer more than 100 virtual SAGE Center programs every week, attracting hundreds of LGBT allies and elders. They range from yoga to Spanish to discussion groups. I almost want to quit my job so I could learn Spanish at SAGE. Of course, we also have our SAGE Vet program. Thanks to Restoration of Honor, it's made our ability to reach out and access our LGBT veterans throughout the state more robust. A lot of our elder veterans are not getting their federal benefits. They rely on state, shifting what should be a federal expense to a state expense. SAGE Vets provides crucial support and saves money and funding from the benefits that are entitled. We've developed new programming. Wow. Well, I wanted to ask for a restoration of support. There's $100,000 for our comprehensive care, $200,000 for support for general services and expenses, and for our SAGE Vet program, $150,000 to continue the crucial outreach and benefits of connection to LGBT older veterans. Thanks for the chance to testify today.
Next, we go to Live on New York, Caitlin Andrews.
Hi, thank you for having me here today. My name is Caitlin Andrews, and I'm the Director of Public Policy at Live on New York. Live on New York's members include more than 100 community-based organizations, including SAGE, who you just heard from, that provide core services to older adults throughout the state, including senior centers, home-delivered meals, affordable senior housing, NORCs, home care, and more. We believe that aging creates momentum that drives our state forward, that older adults power local economies, political systems, and our communities. Unfortunately, despite older New Yorkers being an asset to our state, they have not been invested in as such. Our executive budget allocates NYSOFA a small fraction of our overall budget, only $271 million. That's $3.12 million less than last fiscal year, all amidst a global pandemic in which seniors have been the hardest hit. It's true, the pandemic highlighted disparities and inequities in our communities, and it's particularly true among Black and Brown older adults, who are 5 times more likely to be hospitalized due to COVID in comparison to white peers, and twice as likely to die from the virus. There's a lot of work that needs to be done, and part of this can be done by investing in supports that we know work. There are currently 11,000 older adults that are languishing on waiting lists for services that deter the need for higher levels of care in settings that prove particularly vulnerable to the virus. It's time to address this and fund New York State Office for the Aging's community-based services to reduce waiting lists. This will take an investment to the tune of $27 million to fully address the waiting lists. They're real, they're not going away. While federal stimulus might play a role, it's a Band-Aid. The trajectory of waiting lists is not new. These services have been seeing an increase in demand year after year, partially due to demographic growth. And this demand will exist long after the pandemic. We need state funding in place for the long-term demand for these programs, as well as not to exacerbate the stress of COVID by forcing an older adult to choose between an institutional setting that proved vulnerable or to go without the care that they need. The good news By making these investments, we will reduce Medicaid spending. We're all looking for that answer to reduce Medicaid spending, and here it is. By just a 1% increase in meal service, the state would find a savings of about $11 million in Medicaid by an independent research firm that found that. That proves that waiting for services costs more than the service itself. This is our main funding request, but I'd love to highlight 3 other restorative asks that we would love to see happen this year. 1, restore $200,000 in historically legislative funding for Live on New York's RISE program. 2, restore $340,000 in funding for Lifespan's New York State Coalition on Elder Abuse. And 3, restore $325,000 in historically legislative funding for NORCS. Thank you.
Thank you. And now, National Federation of the Blind of New York State, Raymond Wayne.
Can you hear me? Can you see me?
Yes, yes, we can hear and see you. Thank you.
Thank you for the opportunity to testify, and thank you for the technical assistance. Tell me if I'm too loud. I'm Ray Wayne, National Federation of the Blind of New York State. We are a nationwide organization of blind people. I'm here today on behalf of a particular subgroup of seniors, and that is seniors who are beginning to lose their sight. And as the baby boomer generation ages, we're going to have more of those. Now, there's not a lot of training opportunities available for seniors losing sight. They need to learn how to do things non-visually that they spent most of their lives doing visually, like cooking, shopping, using public transportation, using technology. The Commission for the Blind gets some funding from the feds and the state, but it's not nearly enough, and I can't tell you how many seniors are just not getting any training. And the worst case scenario is that some of these seniors end up in nursing homes when the only real significant disability they have is vision loss, and it costs more than $70,000 a year for the state to maintain one person in a nursing home. And we've heard, today, and we all know today, and we all know how dangerous and unpleasant nursing homes can be. So we want to avoid that. So we're asking for additional annual funding of $5 million to the Commission for the Blind to provide more, I'm sorry about that, that's my computer, to provide more training opportunities to this population. This is going to pay for itself because you won't have seniors going into nursing homes just because their eyesight isn't so good. You'll have them staying in their communities, participating in their communities, and having a much better quality of life. Thank you.
Thank you. A number of members would like to ask questions. So first we go to Chair of our Aging Committee, Assemblyman Kim.
Thank you, Chairwoman Weinstein. And thank you all for your advocacy and your hard work. And it's good to see you, some of you again. And I look forward to working with you closely and collaborating and having a good partnership with you moving forward. Today, in real time, Governor Cuomo came out and said that he is reallocating the federally earmarked vaccinations that were supposed to go to nursing homes, tens of thousands of vaccines. I've heard in recent days through our local administrators and pharmacists who have witnessed throwing away doses because it became administratively very difficult to administer the shots at these long-term facilities. I don't think that's still a reason why we should be diverting these vaccines. Have you heard anything from your ombuds people or your networks about difficulties administering vaccines at nursing homes and long-term facilities? And if so, what do we need to do better to get this done? For anyone.
Well, I can jump in. We've heard a few things. Part of it is that for the residents in the facilities, they didn't feel that they had enough education and information. A lot of populations are very concerned about being the test case on the vaccine, and more education would have been helpful for the residents. On the other hand, we're also noting that there's a significant population, a percentage, excuse me, of the workers in those facilities that are not opting to have the vaccine. I think education would work there as well, but we are not paying enough attention to the reasons that people are saying no. It has been a problem once these vaccines that are in cold storage are taken out, that they need to be using them quickly. And it would seem that perhaps there's the opportunity to say if there's leftover vaccine that is about to not be shelf stable any longer, that there needs to get a way to get those vaccines to the state sites or to other pharmacies to distribute, because nobody wants them thrown out. Thank you.
And I would echo what Gail just shared and just add that we actually still have providers within the senior service network that still are not eligible for the vaccine. We need really clear guidance to make sure that home delivered meal providers, the deliverers, the cooks, the volunteers can get vaccinated, and we don't currently have that.
Yeah, I appreciate that, and I look forward to working with my chair in the Senate to push for all those workers and the homebound seniors as well, to make sure, older adults as well, to make sure they get their shots as quickly as possible. Thank you, Chairwoman Weinstein.
Thank you. We go to the Senate now. I believe our Senator May, Aging Chair, has a question.
Sorry,
Go ahead.
I was on mute. Yes, Rachel May. Thank you.
All right, thank you. First, I just want to thank Mr. Wayne for bringing up the vision loss issue and how that's a driver of putting people in nursing homes who don't need to be there. We need to be paying attention to this and a number of other factors that are easily, or maybe not that easily, but are addressable in other ways than having people go into congregate care like that.
Right.
I have a question for several of you who talked about the need for getting more people off the waiting list, and that the waiting lists are longer than the 15 million that is dollars would cover that NYSOFA has budgeted. And I'm wondering, the 27 million is in addition to the 15. I just want to clarify, right? It's not.
Correct.
It's not. And are there enough providers, enough workers, home care workers and meal deliverers and that sort of thing to actually provide the care if we came up with the money?
So thank you, Senator May. It's Becky. And just to kind of tie into that, the 15 million that we received for 3 budget cycles in a row, those are services that have been turned on to the people that were previously on the wait list. This is new individuals coming on our wait list, which makes sense considering the nature of our population is aging, right? So that's the answer to number one. Number two is, so the way our network is structured is we had the flexibility to target these dollars to people that were waitlisted for services. And you raise a really good issue. We've championed the home care workforce crisis for years. We're really hoping to gain some traction, especially with some of the reports that have been published this year, because it absolutely is a barrier for our network to be able to provide services. But again, if we have flexibility with these funding streams, we can increase services that someone maybe waiting for, well, if we can't find a home health aide to fill it, could we, provide social adult day respite in an in-person setting, or could we look to provide enhanced services in other areas? So, we have just been kind of stigmatized by our funding historically, and this really just speaks to the fact that the sooner we can intervene on an individual, and Caitlin referenced this with, the millions of dollars in cost savings just for a home delivered meal. If we can wrap those services around an individual prior to that crisis point, we absolutely can save healthcare dollars. So even though the two issues are absolutely intertwined and we want to address them, that shouldn't be a hindrance for us to getting the investment necessary to support older New Yorkers.
Okay. I have a number of other things, but I know where you all are. I know how to reach you all. I just wanted to mention to Melissa that we did pass Senator Hoylman's bill today that expanded the concept of the greatest social need for funding to include LGBTQ individuals and people with HIV. So that's good news today.
That's wonderful. Thank you so much for great news.
Thank you.
Thank you. We go to Assemblyman Billy Jones for a question.
Hi, I'm in between this and conference, and I believe most of my questions have already been answered. The waiting list, definitely we have to provide funding for that, the unmet needs. My question was going to be, what are the actual needs of our older people, of our senior population, our communities? You have all answered that so well. I do have one other point that was brought up. The chair brought it up before, and that's the vaccination rollout for our seniors. And I wanted to touch on for our senior volunteers. I think that is huge. We have enough trouble recruiting volunteers now for our senior programs. We need to get them vaccinated. And I know there's an issue in a couple of my counties that they're not eligible for the vaccination. Are we seeing that on a statewide basis? I didn't catch that before.
Absolutely, Assemblyman. And you raised a really good point. And so collectively, all of the advocates and those on the call today, we have all reached out numerous times to try and make sure that our staff who are delivering home delivered meals on a daily basis to the most vulnerable individuals, to our case managers who have to respond to crisis situations and are in people's homes. And many counties do not have the flexibility within their local public health department to deem that individual an essential worker. And so we've been asked by most of the counties to actually get a written directive stating that these individuals are eligible for the vaccination. And to date, we have not been able to do so, which has led in some parts of the state for volunteers to actually cease providing services for the network. So it's been a major barrier. The second point that I would like to raise that we have seen across New York State is really huge difficulties with vaccinating homebound older people that don't have access to internet. They don't have broadband. They may not have technology services available. Some of the pharmacies are requiring that you actually create a profile and then log back in to sign up for the vaccine. And so collectively, the AAAs across the state have tens of thousands of people they have on lists that they're ready to enroll in pharmacy vaccinations, but there's not been a clear-cut, concise way to do it. And so our network has really just tried to get the word out that we're here to assist. We're trying to make sure we alleviate any public fear with vaccines, and really just want to look to partner with pharmacies and other institutions to make sure that we're going to reach the most vulnerable of the population.
Yeah, because that's what I'm getting in my office as well. A lot of our senior population, they're intimidated with the sign-up process as well, going online. And I have to put another plug. I know Chair Kim's going to get sick of me putting in these plugs for senior technologies, but I will again, because it is so vitally important. But thank you all for your advocacy on behalf of our seniors in New York State. This is extremely important work that you're doing. So thank you. And we will do whatever we can to restore that funding and add to the funding that is so necessary for our senior population. So thank you.
Thank you. So now we go back to the Senate. I believe you have another senator. Senator.
Oh, I'm so sorry.
Yeah, Senator Serino.
Thank you, Madam Chair. And thank you to everyone that's here today and for all of your advocacy for our seniors. And Caitlin, thank you for really shining the light on the scope of the problem today. Really appreciate that. Becky, how you doing? Earlier, good. Earlier today, I asked Commissioner Olson about the increase in the calls that they're seeing in New York Connects and their experience with helping seniors access the vaccines, right? That's been a huge issue. He talked about the various roles that the AAAs are playing. And I wonder if you could speak to that just anecdotally, like are all the offices for the aging handling it differently? And what's working, what isn't, and what do you think the state can do in this budget that would be helpful?
So you raise a wonderful question, Senator, and it's something, so the rollout of the vaccination distribution plan has been different based on where you are in the state. I can tell you that our lives have been completely encompassed with vaccine questions and issues for the past 3+ weeks. And you know, we have a tight-knit network. We have 59 area agencies on aging throughout the state. We have 59 of them that have stood up to this charge. The difficulties that we're seeing are obviously there's not enough vaccines. I think everybody is very well versed in that. But the secondary issue is we have the young 60+ population that may be very able to get online, but we're serving, 80, 85, 90-year-olds who, number one, are very hesitant to do anything online. Number two, don't have access to the internet. And number three, don't have transportation. They physically can't get out of their homes to get to vaccination sites. On top of that, we have seen a disparity based on what pharmacies are enrolled in what districts. And I can tell you, I mentioned this before, just while we've been on this Zoom today, I've had about 15 emails from directors reaching out regarding vaccination distribution issues. And what I would like to see from the state is a coordinated statewide educational campaign, as well as a mandate that these vaccination distribution plans must go in partnership with the local offices for the aging. We're the experts in care of this population. We know who they are. We have registered clients who have all of their data, their health insurance information, their physician, names, phone numbers, emergency contacts. There is no reason that there is not a mandate that every single pharmacy or vaccine distribution site is not working with their local AAA to make sure that we're not leaving behind exactly who we're tasked with managing, which are the most vulnerable individuals that don't have access to many of the items that we've raised. So, the takeaway here is that we stand ready to assist, and most counties have compiled their own internal listing of individuals that need to get vaccinated that are unable to do so.
And that's great. And that's really important that they're able to do that and work with all of you guys too. I just have one more last question for Ray. Ray, I was just wondering if you're hearing from any of the folks that you serve, are they having any issues like with getting the vaccine, with having maybe to leave the house to get the vaccine? Is that an issue that they stay at home, or anything there too?
Yeah, that's an issue. And as she said, it's hard for people to get information about how to get the vaccine. And yeah, we work. I mean, if they're in nursing homes, they're getting the vaccine, I believe, I hope. But I run into the same problem every time. I'm 61, so I'm probably not eligible yet, but I run into the same problem every time I think about figuring out how to get the vaccine. It's like, oh, you have to go online. I mean, I'm moderately computer literate, but today was an adventure.
Thank you, Ray. Thank you, everyone.
Thank you all for being here with us today, and I believe we have no more questions for the panel. Thank you for the work you do for all New Yorkers. Now we're going to go to panel F. Neighbors Together, Velvet Johnson Ross, Urban Democracy Lab at New York University, Gina Paula Biaggi, I'm sorry if I mispronounced your name, YWCA of Rochester, Monroe County, Myra Henry, President CEO. So if we can start with Neighbors Together. You just need to, Velvet, you need to unmute yourself, please.
Sorry. Good afternoon. My name is Velvet A. Johnson Ross, and I'm a leader at Neighbors Together in Brooklyn. Thank you for this opportunity to testify. I'm here today to discuss the need for the Housing Access Voucher Program to be passed and fully funded in this year's budget. I understand all too well what many New Yorkers are currently facing, because I too faced that situation in 2019 when I was illegally evicted by my landlord, who refused to remediate toxic black mold, several mice infestations, and 3 bed bug infestations. The constant exposure to toxins and rodents made me severely ill, and after fighting and beating cancer, my health is still severely impacted to this day. Studies show that Black women are primary householders in communities hosting environmental hazards, and they bear a disproportionate environmental burden. Before experiencing housing insecurity, I never thought someone like me would be impacted by homelessness. I was educated with an advanced degree from a prestigious college. I had a full-time job on Madison Avenue and served on my community board appointed by the Bronx Borough President. We have a narrative of what someone who is homeless looks like, but I'm here to tell you that any one of us could be in this position. Housing should be a human right. Good, clean, safe, and affordable housing should not be the standard and not an option, regardless of your accolades. I have been looking for stable housing with my voucher for over a year and a half. It is hard for me because I'm severely allergic to mold and vermin. Now, where can I find a brand new apartment building or a building less than 10 years of age with a voucher for $1,265 and with a compromised immune system in the age of COVID? Because it pays fair market rent, HAVP will allow me to move into newer developments and finally give me the stability I need to heal and pursue my PhD. HAVP will help the homeless and people at risk of homelessness, especially right now as thousands of New Yorkers stand on the cliff of being evicted. As I come to a close, the importance of my speaking today during Black History Month as the great-great-granddaughter of enslaved persons in America is not lost on me. Both sides of my family fled the South to the North to escape Jim Crow, only to find redlining, redistricting, and gentrification. Data shows African Americans often face barriers when attempting to move to more favorable neighborhoods. Passing HAVP will allow me to move into a neighborhood that generations of people who look like me have been locked out of. The dream of equity and equality that my grandparents had is still that, a dream that's been deferred too long. History will look back and look at what we did in these times of trials and hardships. I hope to look back and know that our leaders took action to pass and fund HAVP as soon as possible, because the lives of tens of thousands of homeless New Yorkers depend on it, and so do generations to come. Thank you.
Thank you. Urban Democracy Lab at New York University.
Thank you. My name is Jean-Paolo Baiocchi. I appreciate the opportunity to be with you today. It's been a very long day. Thank you, Velvet. That was very powerful, what you were saying. I'm going to pick up on those themes. We're before this housing emergency. You all know that. I'm not going to go through the facts and figures, but it's staggering. And I would just want to remind you that the research is showing that even the numbers we have are understating the problem. You know, average renters behind $5,600, but we know many renters have been putting rent on credit card and pawning things to pay rent. And we know the burden of this the rental situation has been falling very heavily on communities of color. So I wanted to bring a couple of points for you today as we consider the very important action that we have to take as a state. I just want to remind us that things were terrible in terms of housing before the pandemic, and that we should keep our eyes on the bigger picture and how do we address the kinds of questions that Velvet was talking about as we do this emergency bailout. So I had 4 suggestions for you today. I was thinking just to be succinct. One, this rent forgiveness needs to be immediate, and there should not be means testing for tenants. I believe that landlords should be the one applying for aid, not tenants. We need to follow the examples of the PPP. The research, the on-the-ground experience is very, very clear that the more vulnerable a person is, the more difficult it is for them to come up with the paperwork and the evidence. Landlords have the capacity to do that. Second, relief to these landlords needs to operate in order of priority. So nonprofits, smaller buildings in more vulnerable areas need to come first. Large scale and corporate landlords in the luxury market should absorb some of the costs, in my view. Third, any relief that we provide needs to be conditioned on maintaining habitability and the full protection of tenants. The research we've been doing, the conversations we've been having these last few weeks shows very clearly that the potential for mistreatment of tenants right now is very, very high. Landlords are saying they're not able to pay the bills and all this stuff. Tenants are being mistreated right and left So if we're going to offer relief, it needs to be conditioned on maintaining those standards. Finally, the last thing I wanted to bring up is that we need to think about how to think about this moment as a way to bring forward longer term solutions. We have developed a proposal for a social housing development authority. We're going to be rolling out a white paper for a state version of it. There's some discussion of it for the federal level, but essentially we feel the public actor needs to act, purchase the distressed assets that are going to come out, not let private equity get its hand on it, and transfer it to the social housing sector, which we know has a very strong history of successes here in New York State. Thank you.
Thank you. We now go to YWCA of Rochester Monroe.
Good afternoon, and thank you to the chairs and members of the committees, and a hello to Assemblyman Meeks for the opportunity to submit testimony. My name is Dr. Myra Henry, and I am the president and CEO of YWCA of Rochester and Monroe County. Our mission is to eliminate racism and empower women through housing and young adult services. Just as you cannot build a house without a strong foundation, we believe we cannot help to build a stronger Rochester community without a foundation of empowered families. I am here today to share with you two main points. First, the critical impact the YWCA Parents as Teachers program has on the families we serve. And then second, how reinstating the public-private partnership will help build the stronger Rochester we all deserve. Our community has the third highest rate of childhood poverty in the country. The YWCA Parents as Teachers program is one program in our community's toolkit that demonstrates proven success in diminishing the devastating effects of poverty on those we serve. We find it unconscionable that programs specifically designed to combat the effects of poverty for children have been lost to other funding priorities. As I look at the committee today, I know that many of you are parents, and like you, the families in our program want to be the best parents they can be. All parents face a mountain of challenges that can make pregnancy and early parenting a very stressful time. This stress is only compounded for our young families who are also trying to navigate poverty, their own education and employment, as well as for many systemic barriers built on years of institutional racism. Thanks in part to a public-private partnership grant administered by the state's Office of Children and Families, YWCA Parents as Teachers Home Visitors Program build trusting relationships with mothers and fathers to help ensure that parents and babies are safe and healthy. We are there in times of crisis for the long term to assist with mental health concerns, domestic violence, and housing instability. I imagine that as policymakers and budget writers, you feel more confident in knowing with a high degree of certainty that grant-funded programs ultimately lead to better statewide outcomes. With the Parents as Teachers, you can be certain that your investment has proven success metrics. Data from just about 2 months ago, a novel study in one of the largest longitudinal intervention studies on home visiting with a randomized controlled study demonstrated that Parents as Teachers has lasting biological DNA benefits that prevent mental health concerns in children. It's this sort of data that proves the long-term health impact of our community and prevention and abuse. In closing, the elimination of the public-private partnership grant at OCFS placed a significant financial strain on our agency and our families, and we're asking you to reconsider funding it again. Thank you.
Thank you. We go to Linda Rosenthal for 3 minutes.
Thank you so much. Good to meet all of you. I'm Linda Rosenthal. I represent the Upper West Side and parts of Hell's Kitchen. I was recently named the chair of Social Services Committee, and I just want to say all of you were just so powerful. And I thank you so much for bringing home the real crises that are out there and how they affect you personally. The gentleman, I'm not sure how to pronounce your name, the director of the Urban Democracy Lab. I agree with everything you said in terms of the rent relief program, and I'd be interested in reading the white paper and discussing more with you about how to create more housing for people who who need it. And, you know, the wealthy can buy any number of units that are going up in my neighborhood that are unnecessary because there's plenty of luxury out there. There's not enough affordable and certainly not enough supportive, and the system's broken and we really have to fix it. You know, any comments on that?
I should answer you directly.
Yes.
So, yeah, so we have a proposal currently we've developed for a federal program called the Social Housing Development Authority. But the idea is the following. There's a lot of distressed real estate. A lot of smaller landlords are in trouble at the moment. And the idea is for a public entity to step in, purchase those because they're going to be sold at discount prices and finance the transfer to the social housing sector. You know, we have the tremendous shortage of affordable housing in New York City, but throughout the state. You know, we think this is a good moment for the public sector to step in, because if we don't, it's going to be private equity and investors who are going to buy those things at discounts, flip them. You know, they're not often the best landlords. So we think it's a good time for us to step in that way.
Yeah, we've read that story before, haven't we? Do you have an opinion, or have you researched at all the fact that there are so many hotels and other commercial properties that you know, could be useful in providing affordable housing and supportive housing, but there doesn't seem to be a plan right now. Would you advocate for public buying those similar properties?
Absolutely. You know, as part of our research, I've attended private equity seminars where they're discussing they're going to be investing in failing retail, failing hospitality, and failing residential. We think hospitality and retail provide very good possibilities. I think, incidentally, abandoned shopping malls could also be very nice community housing. Our paper discusses those possibilities. We think it's a very good thing to do.
Great. I'd love to read it. I see my time's up, but thank you. Thank you to all of the...
We're happy to be in touch.
Thank you so much.
Hello, I think we have a senator. Hi, Jabari.
Hi.
Good.
Good.
I just wanted to make sure the Assemblywoman didn't think I was jumping ahead of her. Senator Brisbois, welcome back.
Thanks so much, Madam Chair, and thank you to the panel for being here tonight. I have a few questions. I would just like to start with Velvet. Hi, it's me, Senator Brisbois from Brooklyn. I think I heard some of these in your opening statements, but I just want to double check. Which voucher do you currently have?
Thank you, Senator Brisbois. I currently have the City Theft voucher.
Thank you. And I just wanted to hear, does it pay fair market rent? And if not, how much less than fair market rent does it pay?
No, it doesn't pay fair market rent. So it's significantly, it's about maybe about $500 less. For one person is $1,265. For two people, it's $1,303. For 3 to 4 people, it's $1,580. So it's severely under. I'm a part of various groups on Facebook for people who are looking for apartments, and you see the desperation, especially for women who are in a shelter with their young children, who cannot find an apartment with 3 children. And they're getting turned down because how can you have 3 children in a 1-bedroom? And you're not getting the best of the stock. Let's be honest. I mean, when I talked about redlining and redistricting and gentrification, we all know what that's about.
Thank you. And I actually wanted to follow up 2 more on like when you're doing the housing search itself. So when you do a housing search, like 2-part question: how many units do you find at your voucher's pay rate, and is there any choice or variety in the neighborhoods?
Okay. Pre-COVID, none. Now, I'll be honest with you, because of the flight of COVID, I am finding some availability with some places, but even with that availability, I didn't even really get a chance to speak on the discriminatory process of how when you tell them you have a voucher If it's not Section 8, automatically you won't hear from them. They will tell you, well, what's your income or what's your credit score? Things are not supposed to say, even with you having the full amount that will pay for the apartment. So there are other things that kind of put you out of the game already, which is illegal. But because the way the system is built, and there are a lot of different ways of them overlooking you with your voucher. Yeah, so in the areas in which you look in that are available are places where the transit systems are not as accessible, the school systems are not as great. You know, I mean, again, there are a lot of systematic issues within the neighborhoods. The quality of living is severely impacted.
Thank you, Velvet.
Thank you. So I see two additional assembly members. Assembly Member Meeks.
All right, thank you, Madam Chair, and thank you to the panelists that have joined us today. I just want to say that, you know, these are definitely things that myself, along with many of my colleagues, feel are of high importance. And so much so we realize that the struggles that have come about by way of COVID-19, but many of these struggles existed before the onset of this pandemic. And one of the things that we realize is the way we get these things done is by looking at different ways to generate additional resources for the state of New York in order to do these type of things that are definitely needed. So with that being said, one of the things that we move forward with is a number of progressive revenue raising bills. One that I'm supporting and I introduced is 4604. That's Assembly 4604. I would love to talk with you all in more detail as it relates to joining other advocates across the state and pushing forward with these type of bills to ensure that we have resources for these programs to continue to exist. So I just want to present that to you all and say thank you for your time.
Great, thank you.
Thank you, Assemblyman. And Assemblywoman Matenis.
Hi, thank you. This question in particular is for Mr. Giampaolo. I wanted to know, can you tell us a little bit about your experiencing researching disaster relief and how it is usually distributed, and what are the best practices and what are the common restrictions put on relief?
Thank you. So when this crisis came about, we started to do research on how disaster relief is distributed around the world. And we've been paying attention to some of the experiences around the country, around rent in particular. The best practice is to have it be as universal and unrestricted as possible. Means testing for vulnerable people is a terrible idea. Means testing is saying, you know, you have to prove that you didn't pay rent because of a COVID-related economic downturn. That is very difficult to prove if a person is in the gig economy, in the informal economy, in the cash economy. And the research shows that the more vulnerable a person is, the more difficult it is for that person to provide that kind of evidence. So the best practice today is universal, speedy, not means-tested relief. California, Oregon, and Washington, D.C. are actually going to go with a landlord-based process with the next round of rent relief. So, we think in this case for us in New York, it really needs to be landlord-based, and we do not need to be placing the additional burden on tenants.
Thank you.
Thank you, and I believe that is the end of members with questions for the panel. I want to thank you all for being here and helping and sharing the information you have with us. And when you share the report, with Assemblywoman Rosenthal, if you can also share it with Senator Krueger, myself, so we can distribute to the other members. Velvet, you mentioned you live in Brooklyn. Just curious, as a fellow Brooklynite, what neighborhood?
Red Hook.
Okay, Marcella's neighborhood. Okay, thank you for being here, and we're going to move on to our next panel.
Thanks for your time.
So, thank you. Yes. So we have 1050-1064 Carroll Place Tenants Association, Florencio Gill, tenant leader, and Syracuse Tenant Union, Palmer Harvey, founder. So if can go in that order. First, the Carroll Place Tenant Association.
Hola, buenas tardes. Mi nombre es Florencio Gil. Tengo aquí mi identificación. Vivo en el 1050 de Carroll Place, apartamento 4D, Bronx, New York, 10456. Vivo en este edificio durante 33 años. Soy miembro de casa y formo parte de una asociación de inquilinos en el mismo edificio donde estoy residiendo ahora. Estoy aquí para testificar porque la pandemia nos ha afectado a todos. Muchos de mis vecinos y yo hemos perdido nuestro trabajo. Apenas si podemos comprar nuestra comida para también preocuparnos por pagar la luz, el teléfono, la renta y otros gastos. Simplemente no tenemos el dinero para solventar nuestros gastos de la renta. Estamos en huelga de renta en nuestra asociación de inquilinos y el propietario ha iniciado casos contra muchos de mis vecinos. Ahora tenemos el temor de ser desalojados. Conozco a mis vecinos y siento estrés y pánico cuando reciben documentos de la corte. Ahora no solo tenemos la preocupación de encontrar trabajo, sino también tenemos la preocupación de ser desalojados de nuestros apartamentos. No tenemos los recursos para pagar la renta y la moratoria de desalojo no es suficiente. ¿De qué sirve si todavía vamos a deber la renta? ¿Y de dónde vamos a sacar el dinero si ya estamos hasta el cuello de deudas? Se avecina una crisis de vivienda y ustedes tienen el poder de prevenirla. 1.3 millones de hogares están atrasados con la renta, la mayoría de los cuales son comunidades negras y de color. Se ha presentado más de 40,000 casos en la Corte de Vivienda en la ciudad de Nueva York y el mayor número de casos son en el Bronx. Estamos sufriendo mientras los multimillonarios crecen sus bolsillos. Por eso, hoy estoy aquí y exijo 2 puntos muy importantes: que aprueben la ley de cancelación de la renta e hipoteca para proteger a los neoyorquinos de la deuda de renta y últimamente del desalojo. No pongan la carga sobre los inquilinos para que soliciten el alivio de renta. Número 2, pasen y apoyen la plataforma de Invierten en nuestro Nueva York para obtener los fondos necesarios para no solo cubrir la cancelación de la renta, sino también para proveer hogares a las personas desamparadas y otros servicios sociales necesarios para las comunidades de Nueva York. De antemano les doy mis más sinceros agradecimientos por darme la oportunidad de testificar y compartir nuestro testimonio y espero nos puedan brindar su apoyo. Muchas gracias de mi parte. Que pasen una feliz noche.
Muchas gracias. I'm going to ask our colleague, Assemblywoman Matanz, to just assist us for a moment to even if just to say thank you appropriately. Can we, can Marcella be unmuted?
I'm here.
Oh, okay.
So, I missed the beginning part, pero quiero agradecerle por su testimonio. Lamentablemente me avisaron a la mitad, entonces sí pude apuntar sus datos, entonces les voy a traducir.
Yo estoy aquí para traducir para él.
Thank you.
Oh.
So they have a translator. I thank them.
Okay, thank you. No one told me. I was hoping. Okay.
Sorry about that. I can translate
Yes.
for you. Muchas gracias.
Okay, thank you, Marcella. You pitched in. Okay, yes, thank you.
Florencio, voy a interpretar para usted ahora. Muchas gracias.
Sí, gracias.
Okay. So good evening. My name is Florencio Gil, and I live at 1050 Carroll Place in the Bronx. I have lived in my building for 33 years, and I'm a member of CASA, and also a part of the tenant association in my building. I testify because the pandemic has affected us all. Many of my neighbors and I have lost our jobs, and we can barely buy our food, to also worry about paying for electricity, telephones, rent, and other expenses. We just don't have the money. We are on rent strike in our tenant association, and the landlord has started cases against many of my neighbors. And now we are in fear of being evicted. I know my neighbors and I feel stress and panic when they receive these court documents. Now they not only have to worry about finding a job, but also about being evicted. We do not have the resources to pay the rent, and the eviction moratorium is not enough. What good is it if we are still going to owe the rent, and where are we going to get the money if we're already up to our necks in debt? A housing crisis is looming, and you have the power to prevent it. 1.2 million households are behind on rent, and the majority of which are Black and Brown communities. More than 40,000 cases have been filed in New York City housing courts, with the largest number of cases being in the Bronx. We are suffering while billionaires grow their pockets. Today, I demand that you all pass the Rent and Mortgage Cancellation Act to protect New Yorkers from rent, debt, and ultimately eviction. Don't put the burden on tenants to apply for rent relief. Support the Investor in Our New York platform to obtain the necessary funds to not only cover the cancellation of rent, but also to provide homes to the homeless and other social services necessary for the communities of New York. Thank you for giving me the opportunity to testify and share our story. I hope that you support us.
Gracias.
Thank you. So now our final witness, Palmer Harvey.
Hello, my name is Palmer Harvey, and the Syracuse Tenants Union founder. Before the pandemic in Syracuse, according to a benchmark study by the Maxwell School at Syracuse University in 2019, an average of 11,000 residents were evicted each year in Syracuse. Syracuse's population is over 142,000, and 66% of residents rent where they live. Nearly 55% of renters spend 30% or more of their income on housing costs, including rent and utilities. This rate of housing cost burden is well over 60%. In some of our census tracts, poor housing conditions are rampant among poor and disabled. Disabled tenants suffer some of the most egregious experiences from bad landlording. I remember taking a call from a disabled tenant. For the sake of the story, we will call her Miss M. Miss M had always paid her rent on time, but this time she had fallen short. Due to the pressures of the COVID-19 pandemic, she did what a good tenant was supposed to do. She contacted her landlord and told him that she was going through a financial hardship and could not come up with all the rent. In the same breath, she also told him that the leak from the ceiling that she had told the landlord about 7 months ago has worsened to the point that the ceiling has collapsed in her dining room and has created a smell of moldy odor in her home, causing her to have breathing problems. To which the landlord replied, "No rent, no fix," and then hung up the phone. There is a shortage of affordable, decent housing in Syracuse. Many tenants in Syracuse live in deplorable conditions. 1 out of every 4 children has childhood lead poisoning caused by a lead paint in their home. Yet rents paid for unacceptable housing continue to rise, and most tenants are left completely without any protections from rent increases or evictions. There's great concern for increased homelessness when housing court reopens and evictions start up again. Where will homeless families go? There's not anywhere near enough shelter spaces for those newly homeless people. Doubled up with family or friends may not be safe because of COVID-19. Many of our families have suffered multiple traumas, including loss of job, family members, or health insurance. You can prevent more unnecessary trauma by clearing back rent owed and creating a landlord hardship fund. At the same time, tenants in Syracuse are behind on rent, utilities, and bills. In Syracuse, we feel safe in saying more than a national average of 1 in 7 families do not have enough food. Children have fallen behind in school because online schooling is difficult. The need for childcare has increased with remote learning. Women are more likely to leave the job market to supervise their children. The need for mental health services now and after the pandemic will increase dramatically. With all of these issues, families should not have to worry about staying housed in a pandemic. The Syracuse Tenants Union has been a shining light on tenants in Syracuse. Syracuse Tenants Union has been fighting for years to get the Good Cause bill and ETBA expansion. Now that New York State needs to understand that Syracuse is here and we are hurting too. One of the best things a government should do is take care of the most vulnerable without taking decades to act. The New York State legislature needs to take action right now in the housing relief and recovery for all bill and for the fastest way to solve the rental crisis. Thank you.
Thank you. I believe we have, to the Senate, I believe we have a question there.
I do. I see a fellow Syracusean. Are you a Syracusean? Is that correct?
Syracusan, we say.
Syracusan.
Yeah, I don't really have a question for you, Palmer, but I just want to thank you for sticking out with us till the bitter end and for your testimony and for your advocacy. And please know that we do know we hear you, and we'll be doing what we can, especially from my part, to raise revenue so that we can cover some of these costs that are so critical. So thanks for being here. Good to see you.
Good to see you.
With that, thank you for all the witnesses who testified today, all of the members who participated, but also both in questions and also just participated by being here. Thank you to Marcella for for picking up and helping out with with our last witness. This is going to end our hearing, but just want to tell people tomorrow is the public protection hearing. Last year it went 14 hours. We are not looking to break another record, but Senator Krueger and I do have some concern that we are going to approach that record. So again,
but I've actually been spending part of today explaining to people why I couldn't make it a 18-hour hearing and saying no to them. So perhaps it won't be that long, Helene. Be optimistic.
Well, I'm going to be optimistic. I'm going to ask all of the witnesses and members, maybe really almost more so our members' cooperation tomorrow, so we can get to hear all of our witnesses. Again, thank you all for being here, and this formally closes the Human Services hearing tomorrow morning at 9:30, public protection.
Thank you.